Good evening, Dr. Abdelhamid Atiyah. Today we are going to conduct the anatomy mock exam for Dr. Abdelhamid. So, Dr. Abdelhamid, you have 3 stations, and for each station you have 9 minutes. Okay?
Okay.
Is the picture clear?
Yes, but if we can make it bigger.
Okay.
Okay. I'm using mobile. I will try to use laptop, maybe better.
I can make it bigger if you want.
Yeah, please.
Okay, is it clear now?
Yes, it's okay now. Yes.
Okay, so 9 minutes will start by now. Please identify structure number 1.
Number 1, abducent nerve.
Number 5.
Number 5. This is a free margin, attached margin of tentorium cerebelli, of the tentorium cerebelli.
Number 9.
Free margin of tentorium cerebelli.
19.
19 is this is oculomotor. This is oculomotor nerve.
24.
24. This is the optic nerve.
26.
26. This is the pituitary stalk.
Number 2.
Number 2. This is the olfactory bulb.
Number 4.
This is the optic nerve.
And what else? Number 4 are 2 structures.
Yes. Olfactory and the internal carotid artery.
Number 6.
Number 6. This is optic nerve. Excuse me. Sorry. This is the oculomotor nerve.
Number 7.
Number 7. This is the abducent nerve.
Number 9.
Trochlear nerve.
Number 15.
Number 15. This is the trigeminal nerve.
16.
16. This is the facial and the vestibulocochlear nerve.
Okay. Regarding the oculomotor nerve, what is the course and the muscle supply?
Oculomotor nerve. The course of the oculomotor nerve, it arises from the ventral aspect of the midbrain. Ventral aspect of the midbrain. It passes inferior to the posterior cerebral artery, and the superior to the superior cerebellar artery. Then it passes through the wall of the cavernous sinus bears the dura, and it bears the dura and passes in the wall of the cavernous sinus to reach the superior orbital fissure, where it is divided into superior division and inferior division. It supply medial rectus and the superior rectus and the inferior rectus and the and the inferior and inferior oblique muscle, and the constrictor pupilli muscle, and the levator palpebral muscle, and the levator palpebral muscle, and it gives sympathetic fibers. That's all. That's all.
Okay, what is the clinical picture of the oculomotor nerve palsy?
Clinical picture: downward and the outward, downward and outward rotation of the eye. Downward. This is due to action of the superior oblique muscle, which are not antagonized by the inferior oblique or superior rectus, or the superior rectus muscle, because all are paralyzed except the superior oblique, which is take nerve supply from the trochlear nerve, which is intact in this case. While lateral deviation, this is due to the action of the lateral rectus, which is supplied by the abducent nerve. Also, there is mydriasis due to paralysis of the constrictor pupilli muscle, and the also the patient have ptosis due to a dropping of the eyelid, due to paralysis of the levator palpebral superiors.
Okay, what is the first sign?
Excuse me?
What is the first sign to happen in the clinical picture of oculomotor nerve palsy? From what you said.
Mydriasis, dilatation of the pupil, due to compression of the nerve, against the superior border of the petrous part of the temporal bone, at its attachment to the tentorium cerebelli.
Okay, what are the attachments of the tentorium cerebelli?
It is attached laterally to the superior border of anterolaterally to the superior border of the petrous part of the temporal bone, which extended anteriorly to the posterior and anterior clinoid process, and attached posteriorly to the occipital bone through the transverse sulcus for the transverse dural sinus, while the medial margin are free. Medial margin is free and makes the oval shaped opening, which is called tentorial notch, through one pass.
What is false localizing sign?
We call the neurological sign that is the false localizing sign if they reflect pathology, away, remote or distant from the expected anatomical location of the pathology. If they reflect symptoms away or remote from the expected anatomical pathology.
What is the abnormality in this figure?
This is middle cerebral artery aneurysm.
And what is the consequence of rupture?
Consequence of rupture, it results in subarachnoid hemorrhage.
What is the abnormality in this figure?
This is the middle cerebral artery aneurysm, middle cerebral artery infarct.
What is the clinical picture?
Aphasia, if this occur in the dominant hemisphere, contralateral hemiplegia of the lower half of the face, and the contralateral hemiplegia of the upper and the lower limbs.
What is structure number 1?
This is a contralateral anterior cerebral artery.
Structure 2?
This is medial cerebral artery.
Okay. That was the last question. So we'll move on to next station.
Okay.
Please identify structure 5.
Structure 5.
Yes.
This is the talo. This is the anterior talofibular ligament.
Number 7.
Number 7, calcaneofibular ligament.
Number 18.
The head of the talus. This is the head of the talus, and the
It's okay.
calcaneonavicular joint.
Number 19.
This is the navicular bone.
Number 34.
Number 34. This is the deltoid ligament, anterior part of the deltoid ligament.
31.
31. 31. This is this is 31. This the 31. Excuse me. This is a sustentaculum tali.
32.
This is a 32. This is a calcaneus bone.
35.
35. This is a talus.
30.
30. This is a talonavicular ligament. Calcaneonavicular ligament.
Okay, this is the first metatarsal bone. What is structure 8?
This is the head.
Structure 8.
We can pass it. We can pass this question.
What are the arches of the foot and what are their components? Bones, ligaments, and muscles.
Medial longitudinal arch. Components of the medial longitudinal arch from the calcaneus and the talus and the navicular bone and the three cuneiform bone and the medial three metatarsal bone. Muscle, ligaments, short and long plantar ligament and spring ligaments. Muscle, tibialis anterior and posterior, and the flexor and the flexor hallucis longus, flexor hallucis longus can support this arch, and the peroneus longus. The lateral longitudinal arch, which is composed of calcaneus bone and the cuboid bone and the medial and the lateral two metatarsal bone. Regarding to the ligaments, short and long plantar ligament. Regarding to the muscle, short plantar muscles and the peroneus longus. Transverse arch, which is formed from the base of the fixed metatarsal base of the fifth metatarsal bones, which forms half an arch for each foot, and the muscles formed of muscle is the peroneus longus muscle.
What are the deltoid ligament attachments?
Deltoid ligament attached superiorly to the superiorly to the medial malleolus, and inferiorly attached to the sustaculum tali, and to the neck and the body of the talus, and attached to the spring ligament.
What is the type and articulating surfaces of the subtalar joint?
Subtalar.
Yes.
Blunt synovial.
And what are the articulating surfaces of this joint?
Subtalar joint from the talus talus articulating talus. We can pass this question.
What is the type and articulating surfaces of talocalcaneonavicular joint?
Talocalcaneonavicular joint, synovial joint.
And what else?
And the talonavicular part. Talonavicular part. This is talonavicular part. This is talonavicular part. Ball and socket joint.
And what are the articulating surfaces of this joint?
From the anterior talonavicular, from between the anterior head of the talus with the posterior part of the calcaneus and the navicular bone. Anterior surface of the talus articulating with the posterior part of the navicular and the calcaneus.
What is the type and articulating surfaces of the calcaneocuboid joint?
Calcaneocuboid, blunt synovial.
And articulating surfaces?
Between the anterior surface of the anterior end of the calcaneus with the posterior surface of the cuboid bone.
What are the type and bones forming ankle joint?
Ankle joint is formed by the lower end of the fibula and the tibula with the trochlear surface of the talus.
And what is the type of this joint?
It is synovial hinge joint.
Regarding the ankle joint, why is it most stable in dorsiflexion?
Dorsiflexion because the talus, the wider anterior portion of the talus glides posteriorly, so it becomes widget with the ankle mortise. So it become more stable. While in the plantar flexion, in the plantar flexion, the anterior portion moves anteriorly and they become less stable. And there is some movement like abduction and abduction and eversion and diversion can occur in this position.
Okay, time out. So we move on to next station.
Okay.
Please identify structure number 6.
This is a fundus of the stomach.
Number 2.
Body of the stomach.
Number 18.
Pyloric antrum.
19.
Pyloric canal.
23.
First part of the duodenum.
What is the blood supply of the stomach? Arterial and venous drainage.
Okay. Arterial blood supply from the left gastric artery, left gastric artery, and the which is a branch from the celiac trunk, and the short gastric arteries, which is branches from the splenic, and the left gastrooblique, which is a branch of from splenic, and the right gastrooblique, which is a branch from the gastroduodenal artery, and the right gastric artery, which is a branch from the common hepatic artery. Regarding venous drainage, left gastric vein, which is drained into the portal vein, and the right gastric vein drained also on the portal vein, and the left gastrooblique, which drains into the splenic vein, and the right gastrooblique, which drains into the superior-mesenteric vein.
What are the peritoneal relations of the different parts of the duodenum?
The duodenum is retroperitoneal, except the first part is which is covered by the peritoneum.
What is the blood supply of the duodenum?
The blood supply of the duodenum it takes a blood supply from the superior and inferior pancreatic duodenal arteries and the duodenal branches. It takes also duodenal blood supply from the duodenal branches of the superior mesenteric artery.
Where do they come from, the superior and inferior pancreatic duodenal arteries?
Excuse me, I can't hear the word. I can't catch what you said.
What is the origin of the superior and inferior pancreatic duodenal arteries?
Superior and inferior pancreatic duodenal artery. These are branches from the superior mesenteric artery.
Both arteries are branches of the superior mesenteric artery? Superior pancreatic duodenal artery is a branch from the gastroduodenal artery, and the inferior pancreatic duodenal artery is a branch from the superior mesenteric artery. Okay, what are the different relations to the third part of the duodenum?
Third part of the duodenum?
Yes.
Third part of the duodenum anteriorly, it is related to the root of the mesentery and the coils of the jejunum and the superior mesenteric vessels, and the posteriorly related to the psoas major, muscle, and to the right ureter and the right gonadal vessels, and the IVC and the aorta and the inferiorly it is related to the coils of the jejunum, and the superiorly it is related to the head of the pancreas, and its ancillary process.
Where is the major duodenal papilla and what is its function?
Major duodenal papilla, it is located in the posteromedial aspect of the second part of the duodenum, and its function it is It is the junction. It is the junction between the common bile duct and the main pancreatic duct.
What is the blood supply of the pancreas?
Superior pancreatico-duodenal artery and the inferior pancreatico-duodenal artery and the pancreatic branches from the splenic artery.
Where are the ducts of the pancreas open?
Duct of the pancreas?
The ducts of the pancreas, where do they open?
Main pancreatic duct open in the second part of the duodenum, and also the minor pancreatic duct opens in the second part also.
What are the vessels to encounter during pancreatic surgery?
Abdominal aorta, and the superior mesenteric vessels, and the superior and inferior pancreatico-duodenal artery, and the splenic vein, and the superior mesenteric vein, and the portal vein, and the left renal vein.
What is the ligament connecting the pancreatic field to the spleen?
Linorenal ligament.
Describe the development of the pancreas.
It is developed from the hepatic diverticulum. It is from the ventral bud and dorsal bud. Ventral bud from the hepatic diverticulum, which give rise to the ancillated process and the lower part of the head of the pancreas. And the dorsal bud, it is divided from the duodenum, which gives rise to the upper part of the head and the neck and the body and the tail of the pancreas.
Identify structure number 3.
Head of the pancreas.
9.
The neck of the pancreas.
Number 14.
Superior mesenteric artery.
15.
Superior mesenteric vein.
Okay, so that was the last question. So now we are done. Thank you, Dr. Abdulhamid. The feedback will be provided to you soon.
Thank you, Dr. Adham.
Thank you. Now you. Good evening, Dr. Abdulrahman Magdi. Now today we are going to conduct the anatomy mock exam for Dr. Abdulrahman. So Dr. Abdulrahman, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. 9 minutes started by now. Please identify structure number 2.
Structure number 2 is inferior vena cava. Superior vena cava.
Number 4.
Number 4. I don't know it.
Number 5.
Number 5, I think it's the right atrium.
Number 6.
Number 6, aortic valve.
Number 8.
Skip.
Number 9.
Number 9. Capillary muscle.
Number 18.
18. It's the pulmonary trunk.
Number 19.
Skip.
Number 20.
20. Pulmonary valve.
Number 21.
I don't know. Skip.
How many cusps have the pulmonary valve?
3.
How many cusps have the pulmonary valve?
3.
Okay. What is the vertebral level of the pulmonary valve?
6. T6.
What is the level of the pulmonary trunk division?
T5.
Where to auscultate the pulmonary valve?
Second left intercostal space. Parasternal.
Which side? Right or left?
Left. I said second left intercostal. My voice is not clear. Second left intercostal space. Parasternal line.
Okay. What are the branches of ascending aorta?
Right and left coronary arteries.
What are the branches of pulmonary trunk?
Right and left pulmonary arteries.
How many pulmonary veins are present?
4.
Please identify structure number 3.
1 minute. I can see number 3. This is sympathetic trunk.
Number 5.
This is the right main bronchus.
Number 10.
Phrenic nerve.
Number 12.
Greater splanchnic nerve.
Number 14.
14. Skip.
What are the tributaries of the azygous vein?
Well, there is the right superior intercostal. There is pericardial veins, mediastinal veins, esophageal veins, accessory hemiazygous, and bronchial veins, esophageal.
What else?
I said the pericardial hemiazygous, accessory hemiazygous, mediastinal.
What else?
I can't remember.
So would you like to skip?
Yes.
Where preganglionic fibers of the sympathetic trunk come from?
The corresponding spinal nerves from T1 to L2.
What connects the sympathetic trunk to the spinal nerves?
White ramus communicants, gray ramus, and the ganglion itself.
How sympathetic nerves leave the sympathetic chain?
Through spinal nerves and through the plexus around the blood vessel, like the cardiac, pulmonary, greater splanchnic, and lesser splanchnic nerves.
Okay, so that was the last question in this station. So would you like to return to the unanswered questions? We still have 2 more minutes.
Yes, we can.
Other branches of the other tributaries of the azygous vein.
Okay, let's wait. I said the intercostal, right superiors, the hemiazygous and the accessory hemiazygous, pericardial, mediastinal, in the lower right, esophageal, bronchial.
Lower right what?
lower right intercostal veins.
Okay, and what else has intercostal veins other than the lower right? And
So
lower
this
right
is
anterior or
upper right.
posterior?
Yes, posterior right intercostal and the right superior intercostal.
Okay.
I can't remember.
So now we're done. We move on to next station. Where are the different parts of the brachial plexus found?
Okay, there are first there are the roots from the foramina of the corresponding nerves from C5 to T1. Then the trunks, they are found in the base of the posterior triangle of the neck. Then divisions behind the middle third of the clavicle. 1 minute. Then the cords, they are found behind the third part of axillary artery.
The third part?
Second.
Okay, show on the skeleton the roots of the brachial plexus. Which of these letters indicate the root of the brachial plexus?
The letters.
Which letters?
I'll go with A.
Okay, describe and justify the clinical picture of Erb's palsy.
Okay, Erb's palsy, it's injury of the upper roots of the brachial plexus, C5, C6. At the level of the arm, medially rotated due to paralysis of the external rotators, which are the infraspinatus and teres minor. The arm is adducted due to paralysis of the arm abductors, supraspinatus and deltoid. Also, there is elbow extension due to paralysis of the flexors, brachialis, biceps, and brachioradialis. Okay, the hand is in pronated position due to paralysis of the supinators. The wrist is in flexion. The wrist is in flexion due to
due to paralysis of which muscle?
Of the extensor carpi.
Which extensor?
1 minute. I think. I think extensor carpi radialis. I don't know.
Okay, so this is the motor affection. You know the sensory affection?
Sensory. Okay, there is loss of sensation on the lateral side of the arm and forearm.
Okay. In Erb's paralysis, what would be the impacted reflexes?
Biceps and brachioradialis.
What is the action of brachioradialis muscle?
It's a weak flexor, but its most action is in mid-prone position.
What are the muscles supplied by musculocutaneous nerve?
musculocutaneous, biceps, brachialis, coracobrachialis.
What is the sensory supply of the musculocutaneous nerve?
Lateral side of the arm.
What is the sensory supply of the radial nerve?
Sensory supply.
Mhm.
Okay. There is an area on the lower lateral cutaneous nerve, lower lateral side of the arm, and there is a sling on the posterior side of the forearm. In the dorsum of the hand of the lateral 3.5 fingers, sparing the tips of the feet.
Okay. Identify structure number 3.
3. Greater tuberosity.
What are the muscles attached?
Supraspinatus, infraspinatus, teres minor.
Identify 8.
8. This is the lesser tuberosity.
What are the muscles attached?
Subscapularis.
Identify structure 6.
It's a bicipital groove.
What are the muscles attached?
Latissimus dorsi.
And what else?
There is on the lips or on the groove itself.
I mean attachment. Other attachments to the bicipital groove.
Other attachment, okay. There is teres major and pectoralis major on the lateral lip and on the medial lip.
Okay. Identify structure 5.
5.
Mm-hmm.
The head of the humans.
Number 1.
It's the neck.
Which neck?
Anatomical neck.
Number 10.
Surgical neck of humerus.
Describe how to articulate humerus, radius, and ulna.
Okay. First, the capitulum articulates with the radius, and the olecranon of the ulna articulates in the olecranon fossa. Okay, and the interosseous groove on the radius is directed medial towards the ulna.
Okay. What is the bony prominence that extensor pollicis longus tendon wraps around?
Tubercle of extensor pollicis longus.
Sorry, again?
Lister tubercle.
Okay. So that was the last question. We'll move on to the next station and the last one. Please identify structure number 2.
1 minute. Number 2.
Mm-hmm.
This is the belly of digastric muscle.
Number 37.
37. This is the posterior belly of digastric muscle.
Number 19.
19. This is the hypoglossal nerve.
Number 45.
45.
Mm-hmm.
This is the hyoid bone.
Number 45. This muscle.
Okay, this is 1 minute. You can skip it to later.
Number
Sternohyoid.
54. Sorry?
Sternohyoid.
Which one is stenohyoid?
45.
Okay. 54.
54. Okay. 45 is sternothyroid, and 54 is homohyoid. Yes, okay, 54 is homohyoid. 45 is sternothyroid.
Okay, so 54 is which part of the homohyoid muscle?
Superficial belly.
Superficial? Okay, number 8.
Here is number 8. The mark, please, I can see it. Okay, number 8 is the common carotid artery.
Number 11.
Sternal carotid.
Number 1.
Accessory nerve.
16.
16. Can't find 16. 16. Is a great auricular nerve.
What are the boundaries of the anterior and posterior triangles of the neck?
Okay, the anterior triangle. Posteriorly, it's the anterior border of sternomastoid. The upper border is lower border of the mandible. Separate. The anterior border is anterior midline of the neck. And at the lower border of the mandible there is the digastric muscle separating the anterior triangle into muscular carotid triangle. About the posterior triangle, anteriorly it's posterior border of sternomastoid, and the base is the medial half of the clavicle, and posteriorly is anterior border of trapezius muscle. Medial half of the anterior border of trapezius muscle.
Interpret the microscopic findings of preauricular lymph node biopsy.
Okay, there is area of abnormal staining, most likely malignant melanoma.
What are the regions that might contain the primary lesion of malignant melanoma? In this case,
the gums, temporal region, the lower half of the upper half of the face, and the auricle.
what is the nerve supply to the posterior belly of digastric?
Facial nerve.
Regarding the great auricular nerve, what is the root value and the areas supplied by?
C2, C3, lower half of the auricle, area around the angle of the mandible, skin over the baroque.
Regarding external carotid artery, what is the course and nerve passing anterior to it?
The course, okay, it starts at the level of C4. It's one of the two terminal branches of the common carotid. It ascends upward. It terminates behind the angle of the mandible at the parotid gland by giving superficial temporal and maxillary branches. Nerve to and anterior to it is hypoglossal.
What are the branches of external carotid artery?
The branches, okay, it gives first the superior thyroid, ascending pharyngeal branch, then lingual and facial, then posterior auricular and occipital, and two terminal branches, superficial temporal and maxillary.
Where is the carotid body and what is its function?
Carotid body, okay, it exists at behind the bifurcation of common carotid. Its function is maintaining the pH of the blood.
Where is the carotid sinus and what is its function?
The carotid sinus exists on the posterior border behind the internal carotid, just above its beginning. It's responsible for maintaining blood pressure.
Regarding the facial artery, what is the palpation surface marking?
Okay, at the lower border of the mandible, at the anterior edge of masseter muscle.
What is the effect of unilateral ligation?
Unilateral ligation, there would be no effect because there are generous tributaries between facial artery and maxillary artery.
Okay, so that was the last question. Thank you, Dr. Abdulrahman. The feedback will be provided to you soon.
Okay, thank you.
Now you can leave the meeting. Thank you. Good evening, Dr. Ahmed Buma. Today we are going to conduct the anatomy mock exam for Dr. Ahmed Buma. So, Dr. Ahmed, you have 3 stations, and for each station you have 9 minutes.
Okay.
So, we will start by the first station. 9 minutes started by now. Please identify structure number 1.
Structure number 1, abducent nerve.
Structure 5.
The attached border of tentorium cerebri.
Structure 9.
Structure 9, the free border of tentorium cerebri.
19.
Just a second. 19 is the oculomotor nerve.
24.
24 is the optic nerve.
26.
26 is the pituitary gland.
Identify structure number 2.
Number 2 is the olfactory bulb.
Number 4.
And number 4 is the optic nerve and internal carotid artery.
Number 6.
Number 6 is the oculomotor nerve.
7.
And 7 is the abducent.
9.
9 is the trochlear.
15.
15 is the trigeminal nerve.
16.
16 is the facial nerve and vestibulocochlear nerve, and the nerve to I think it's facial and vestibulocochlear nerve.
Okay. Regarding the oculomotor nerve, what is the course and muscle supply?
Well, the oculomotor nerve arises from the anterior part of the midbrain, anterior to the cerebral aqueduct. It arises from that area and passes between the posterior cerebral artery and the posterior cerebral artery and superior cerebellar artery. And then it pierces the dura mater and enter in the lateral border of the cavernous sinus, and then it enters the superior orbital fissure, where it divides into superior and inferior branches. That is course. What else, doctor?
The muscles supplied by oculomotor nerve.
The muscle supplied, it gives the superior rectus, the inferior rectus, the medial rectus, the inferior oblique, sphincter, constrictor pupilli, levator palpebri superioris, and gives the Miller's muscle by the sympathetic fibers.
What is the clinical picture of oculomotor nerve palsy, and what is the first sign?
Well, if there is an oculomotor nerve palsy, it will lead to the eye will be deviated outward and downward. The deviation outward will be due to the function of the lateral rectus due to abducent nerve function, and it will be downward due to the function of superior oblique supplied by the trochlear. And they will be ptosis due to loss of function of levator palpebri superioris, and they will be mydriasis. And the first sign will be mydriasis because the parasympathetic fibers are the most superficial, so they can get compressed easily.
What is the structure the oculomotor nerve might be pressed against?
It can be pressed against the free border of tentorium cerebri.
What are the attachments of tentorium cerebri?
The attachment of tentorium cerebri are as the following. First, posteriorly, it will attach to the groove of the transverse sinus, and anteriorly, it will attach, laterally, it will attach to the petrous part of temporal bone, and then anteromedially, it will attach to the anterior clinoid process and posterior clinoid process. The medial part will be free, which is called the tentorium notch, where the brain stem will pass.
What is false localizing sign?
A false localizing sign is used when there is a pathology that reflects damage in anatomical location that's distant from the expected area. For example, there is signs of abducent nerve damage, but it is due to increased intracranial pressure.
What is the abnormality in this figure?
Well, there is an aneurysm, seems to be in the middle cerebral artery.
And what is the consequence of rupture?
It might cause subarachnoid hemorrhage.
What is the abnormality in this figure?
There is right middle cerebral artery infarct.
And what is the clinical picture?
It will cause contralateral hemiplegia of upper and lower extremities. It will cause phasia if the dominant limb, if the dominant atmosphere is affected, and it will cause contralateral loss of the facial muscle at the lower part, in the contralateral side.
Identify structure number 1.
One is the anterior cerebral artery,
Number 2.
middle cerebral artery.
Excellent. Dr. Ahmed. So that
Thank
was the last question. So we move on to the next station.
Okay.
Okay. Nine minutes started. Please identify structure number 5.
This is the anterior talofibular ligament.
Structure 7.
Calcaneofibular ligament or spring ligament.
18.
18 is the head of talus at the talocalcaneonavicular joint.
19.
19 is the navicular bone.
34.
34 is the deltoid ligament.
31.
31 is the systemiculum taloi of calcaneus.
32.
32 is the calcaneus bone.
35.
35 is the talus.
30.
calcaneonavicular ligament.
This is the first metatarsal bone. What is structure A?
A tubercle of first metatarsal.
Okay. What are the arches of the foot, and what are their components regarding bones, ligaments, and muscles?
First, there is the medial arch of the foot. The medial arch is formed from the calcaneus and the talus and the naviculum and the three cuneiforms, the medial and intermediate and lateral, and the first three metatarsal. Regarding the ligaments, there is the calcaneonavicular ligament. There is a short plantar ligament. Regarding the muscle, tibialis anterior and posterior, peroneus longus, and peroneus tertius, I think. Then there is the lateral arch of the foot. It's formed by the calcaneus bone and the navicular calcaneus bone and the cuneiform and the lateral two metatarsal. The ligament, short and long plantar ligament. The muscles, peroneus longus. And there is the transverse arch. It's formed by the calcaneus and naviculum and the three metatarsals on both sides.
Okay. What are the deltoid ligament attachments?
The deltoid ligament attachment will be attached to the head and neck of talus. It will be attached to the medial malleolus and to the navicular bone. That's navicular bone and yeah, that's it.
What else?
It will attach medial malleolus is the origin. It will attach to head and the neck of talus. Navicular tubercle. Those are what I can remember now.
Okay, what is the type and articulating surfaces of the subtalar joint?
The type and articulation surface of subtalar joint. The subtalar joint is a synovial joint. It is formed by the inferior surface of talus with the superior surface of calcaneus.
And what are the movements at this joint?
Well, it is responsible for inversion and eversion.
What is the type and articulating surfaces of the talocalcaneonavicular joint?
It is a plain synovial joint, while the navicular, the talonavicular is a ball and socket joint. It's formed by the head of talus with the navicular bone and calcaneus downward. It is responsible for dorsiflexion. It is gliding rotatory movement too.
What is the type and articulating surfaces of the calcaneocuboid joint?
The calcaneocuboid joint is plain synovial joint. It's formed by the calcaneus surface and the navicular and the cuboidal surface laterally, and it participates in inversion and eversion too.
And what else as movements at this joint?
Inversion and eversion. I think that's it.
Okay, what are the type and bones forming the ankle joint?
The bone forming the ankle joint, it's formed by the lower surface of the tibia and fibula, articulating with the talus joint, and it is It is a biarthroidal hinge joint.
Biarthroidal.
No, I think it's synovial joint.
Okay. Regarding the ankle joint, why is it most stable in the dorsiflexion position?
Well, because in dorsiflexion, the talus is pushed backward, and the wide anterior area becomes the wide anterior area becomes close to the ankle mortise, so it limits the movement. While if in the case of plantar flexion, there is a wobbly movement because the talus is free, the anterior surface of it is free.
What is the type of inferior talofibular joint?
Inferior talofibular joint, it is a syndesmotic joint.
What are the structures passing behind the medial malleolus?
The structure passing behind the medial malleolus are extensor hallucis longus, extensor digitorum, extensor digitorum extensor digitorum longus, tibialis posterior, and tibial nerve and tibial vessel.
What are the structures deep to extensor hallucis longus tendon?
Can you please repeat that? I'm sorry.
What are the structures deep to extensor hallucis longus tendon?
Well, there is the anterior tibial artery and peroneal nerve.
The anterior tibial
Deep
artery in this
and deep
at
peroneal
this
nerve.
level,
At which level?
deep to extensor hallucis longus tendon.
Deep peroneal nerve and anterior tibial artery.
Is it the anterior tibial artery or dorsalis pedis artery?
Yeah, the dorsalis pedis after the continuation of it. Yeah, the dorsalis pedis
Identify
artery.
structure number 1.
Neck of talus.
Number 2.
Can I skip that, please?
Number 3.
Head of talus.
Okay, time out. So we'll move on to the next station.
Okay.
Okay, please identify structure number 6.
This is the fundus.
Number 2.
The body.
Number 18.
Pyloric antrum.
19.
Can I skip it?
23.
The pylorus itself and the beginning of duodenum.
18 is the pyloric antrum. Okay.
Okay.
And 23 is
The first part of duodenum.
okay. So 19 would be
I can't recall it.
okay. What is the blood supply of the stomach and what is the venous drainage?
The blood supply of the stomach, first, the celiac artery will give the left gastric artery, and it'll give splenic artery. The splenic artery will give the short gastric and give left gastroepiploic, and then the hepatic will give gastroduodenal, and the gastroduodenal will give the right gastroepiploic. Regarding the venous blood supply, the short gastric and left gastroepiploic will drain in the splenic vein. The short gastric and the right gastric and left gastric will drain in the portal vein, and the right gastroepiploic will drain in the superior mesenteric vein.
What are the peritoneal relations of the different parts of the duodenum?
The first part of duodenum is covered by the is peritoneal, while the rest is not peritoneal.
What is the blood supply of the duodenum?
The blood supply of the duodenum, blood supply of the duodenum, superior pancreaticoduodenal artery, which come from gastroduodenal artery, and inferior pancreaticoduodenal artery, which arise from superior mesenteric artery.
What else?
There is can't remember anything else.
Okay, what are the different relations to the third part of the duodenum?
Well, the first part of duodenum anteriorly is the gallbladder and quadrate lobe of the liver. Posteriorly is the right kidney and right renal vessel and inferior vena cava. The second part of duodenum anteriorly is the liver, gallbladder, liver and gallbladder, and part of the ascending colon.
I need only the third part of the duodenum, the relations of the third part only.
Okay, the third part of duodenum anteriorly is the superior mesenteric artery and vein. Posteriorly, they will be the aorta and inferior vena cava, left renal vein, splenic vein, left renal vein, splenic vein, and oh, let's see. That is what I can remember.
Okay, where is the major duodenal papilla and what is its function?
It is found at the posteromedial part of the second part of duodenum, and it's where the common bile duct and the pancreatic duct open.
And where specifically is it situated? Distal to the pylorus.
It's around 10 to 13 centimeters from the pylorus.
Okay. What is the blood supply of the pancreas?
The blood supply of the pancreas, it receives blood supply from the splenic artery, superior pancreaticoduodenal and inferior pancreaticoduodenal artery, and splenic. That's it.
Okay. Where are the ducts of the pancreas open?
The ducts of the pancreas, where the main pancreatic duct, it opens in the major duodenal papillae, and the accessory pancreatic duct open in the accessory opening of accessory papillae.
What are the vessels encountered during pancreatic surgery?
Aorta, inferior vena cava, aorta, inferior vena cava, superior and inferior pancreaticoduodenal artery, right gastroepiploic artery, splenic artery, and splenic artery, portal vein.
What else?
We can skip it.
What is the ligament connecting the pancreatic tail to the spleen?
A linearenal ligament.
Describe the development of the pancreas.
Well, the pancreas, there is a ventral pod and dorsal pod. The dorsal pod arises from the posterior surface of the duodenum, and it is responsible for formation of all of the pancreas except for the unicate process. While the ventral pod arises from the liver, it forms the unicate process.
Please identify structure number 3.
Number 3,
Mm-hmm.
unicate process of pancreas.
Number 9.
Body of pancreas.
14.
Superior mesenteric artery.
15.
Superior mesenteric vein.
Okay, so that was the last question, and we still have 1 more minute. Would you like to recall any of the unanswered questions? Or
No,
uncompleted
Doctor.
questions?
No, that's okay. We can finish.
Okay, so thank you, Dr. Ahmed. And,
Thank you, Doctor, for your time.
now we are done, and the feedback will be provided to you soon. Thank you.
I can't hear you, Doctor.
The feedback will be provided to you soon.
Okay, let's start our station with identification with Dr. Ahmed Hamdi. Please identify number 5.
I think it's the deltoid ligament.
Sorry.
The deltoid ligament.
Okay, number 7.
Posterior talocalcaneal ligament.
18.
18 is a joint or not ligament, I think. True.
19.
19, I don't know.
Okay, 34.
34. No, I don't know.
35.
I didn't revise this photo.
Okay, no problem. Okay. Please mention bones, ligaments, and muscles sharing in formation of foot arches.
Okay, we have the medial arch and the lateral arch and the transverse arch. For the medial arch, we have tibialis posterior. Tibialis posterior and medial metatarsal or the first metatarsal bone. I don't remember the foot arches. I'm sorry.
Okay, please mention attachments of deltoid ligament.
Progress.
Okay, please mention type and articulating surfaces of the following joints. Number 1, subtalar joint. Hello? Hello, Dr. Ahmed. Enable your mic, please.
Okay, I'm sorry for that.
Okay, no problem.
Okay, is my voice clear now?
Yes. Please mention types and articulating surfaces of the following joints. Number 1, subtalar joint.
Subtalar joint. Synovial pivot joint.
Okay. Talocalcinonavicular joint.
Talocalcinonavicular. Synovial plane joint.
Okay. Calcaneocupoid.
Calcaneocuboid. Synovial plane.
Okay. What are the type and bone forming ankle joint?
Ankle joint is formed by calcaneus, talus, tibia, and fibula.
Okay. And the and type of this joint.
Hinge joint. Synovial hinge joint.
Okay. And what are types of movement at the ankle joint level and muscle performing them?
Plantar flexion, dorsiflexion, inversion, and eversion. Plantar flexion is formed by tibialis posterior, gastrocnemius, soleus, flexor digitorum longus, and flexor hallucis longus. Dorsiflexion is formed by tibialis anterior, extensor hallucis longus, and extensor digitorum longus. Inversion is formed by tibialis anterior and posterior. Eversion is formed by peroneus longus and peroneus brevis.
Okay. Why ankle joint is more stable than dorsiflexion?
Uh, because in dorsiflexion, the talus is moved posteriorly, and the articulating surface is more exposed in dorsiflexion, so it become more stabilized.
Okay, what is the type of inferior talofibular joint?
Syndesmosis joint.
Where to palpate dorsalis pedis and posterior tibial artery?
Dorsalis pedis is palpated lateral to flexor hallucis longus, extensor hallucis longus. Posterior tibial artery is palpated midway between Achilles tendon and medial malleolus.
What are the structures passing behind the medial malleolus?
The structures passing behind the medial malleolus is the structures of the posterior compartment, which is tibialis posterior, flexor digitorum longus, flexor hallucis longus, posterior tibial vessels, and posterior tibial nerve.
Okay, what are structures pass deep to extensor hallucis tendon?
Extensor hallucis tendon. Okay, the dorsalis pedis artery and the deep peroneal nerve.
Okay. Considering this is the first metatarsal, what letter A may indicate?
This is the first metacarpal bone.
Yes. First metatarsal bone.
First metatarsal bone.
What could number A may indicate? What could A may indicate?
No, I don't know.
Okay, considering this is the talus, what could number 1 may indicate?
Number 1 indicate the neck of the talus.
Number 2.
The head of the talus.
Number 3.
No, I don't know.
What bone articulate to number 4?
Bones articulate to number 4. Tibia.
Number 5.
Number 5. Navicular bone.
And number 6.
Calcaneus.
Okay, what is the blood supply of talus?
Supply of talus. Posterior tibial artery and the peroneal artery.
Okay. Where are to the next station? Where are the different parts of the brachial plexus found? Roots, trunks, divisions, and cords.
Roots, divisions, cords, and trunks. Roots are found between scalenus anterior and scalenus posterior, scalenus anterior and scalenus medius. Trunks are found at the base of the posterior triangle. Cords are behind the medial 1/3 of the clavicle. And cords are related to the second part of the axillary artery.
Okay, thank you. Please show on the skeleton roots of brachial plexus A, B, C, D, E.
I don't understand the question, please.
On this figure on the left, please show me the roots of brachial plexus.
Roots of brachial plexus.
Just
It,
select the letters between A, B, C, D, E.
it emerges starting from C5. So the last one is C7, 6, 5. So it emerges from C, D, and E.
Okay, please describe and justify the clinical picture of herpes palsy.
Okay, Erb's palsy first. The arm is adducted and internally rotated. Forearm is extended and pronated, and the rest are flexed. And we have sensory affection. We have loss of sensation of the radial side of forearm.
Okay, in herpes palsy, what would be the impacted reflexes?
The biceps reflex and the brachioradialis reflex.
What is the action of brachioradialis muscle?
Brachioradialis has a weak flexion of forearm, especially in mid-pronation position.
Okay, what is what are the muscles supplied by musculocutaneous nerve?
Musculocutaneous nerve supplies biceps, brachioradialis, and coracobrachioradialis.
What is the sensory supply of musculocutaneous nerve?
The radial side of the forearm.
What is the sensory supply of radial nerve?
Sensory supply of radial nerve. Radial nerve supply in the forearm, a strip down the forearm between a strip down the forearm, the posterior, the dorsal surface of the palm, and the dorsum of the lateral 3.5 fingers except the tips.
Okay, what number 3 may indicate?
The greater tuberosity,
Number 8,
the lesser tuberosity,
number 6,
the intertubercular groove,
what are muscles attached to this area?
H2, the latissimus dorsi from the floor, the medial lip for pectoralis major, and the lateral lip for teres major.
Okay, number 5,
The head,
1,
the anatomical neck of humerus,
number 10.
the surgical neck of humerus.
Please describe how to articulate humerus, radius, and ulna.
Humerus, radius, and ulna. Okay. First, we have humerus above the radius. We will articulate the radial head with the capitulum. The ulna, we will articulate the olecranon process with the olecranon fossa behind, and the chronoid process with the chronoid fossa above or anterior. And we will articulate radius and ulna. We will form the superior radio-ulnar joint by articulating the radial tuberosity with the radial notch on ulna.
What is the bony prominence that extensor pollicis longus tendon wraps around?
The Lister tubercle.
Okay, thank you. I've finished our second station. We will go through the last station. Please identify number 2.
Number 2, pulmonary trunk.
Okay, number 4.
The auricle of the right atrium.
Number 5.
The right atrium.
Number 6.
Oh, number 2 was the aorta. Sorry. Number 6 is the vestibule of pulmonary trunk.
Okay, number 8.
Papillary. This is number 8. Mitral valve. No, tricuspid valve.
Okay, number 9.
Papillary muscles.
Okay, number 15. Sorry, number 18.
18. The pulmonary trunk.
19.
Left atrium.
Okay, how many cusps have the pulmonary valve?
Three cusps.
What is the vertebral level of the pulmonary valve?
Pulmonary valve. Second intercostal space. Second right intercostal space. Just lateral to the sternum.
Right? Right intercostal space?
Yes. Left. Okay, sorry. Second left intercostal space, just lateral to the sternum.
And at which vertebral level?
Which vertebral level is the pulmonary valve? No, I don't know.
And pulmonary trunk division, at which level?
T4.
Okay. What are the branches of ascending aorta?
ascending aorta gives in 10% the artery to the isthmus of the thyroid emma, to the thyroid gland, and the two coronaries.
Okay, what are the branches of pulmonary trunk?
Pulmonary trunk,
Right.
it gives two pulmonary arteries,
How many pulmonary veins are present?
4 pulmonary veins.
Okay. What number 3 may indicate?
1 minute. Sympathetic chain.
Where preganglionic fibers come from?
Ganglionic fibers come from the spinal nerves by white ramus and the gray ramus.
At which level?
No, I don't know.
How sympathetic nerve leaves the sympathetic chain?
No, I don't know.
Okay. What number 5 may indicate?
Number 5 indicates the bronchi.
Number 10?
Number 10, the azygos vein.
What are the tributaries of azygos vein?
Okay, the azygos vein drains the supracostal vein, and it drains hemiazygos and accessory hemiazygos, and it drains the coastal veins, inner coastal veins.
What else?
Drains the pericardium and the pleura.
Okay. Okay, thank you. I finished the stations for today. Thank you for your effort. You did a very good job.
Good evening, Dr. Amani Abdelaziz. Today we are going to conduct the anatomy mock exam for Dr. Amani. So Dr. Amani, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. 9 minutes started by now. Please identify structure number 2. Dr. Amani.
Hello,
Hello.
Dr. Adam, I'm with you.
Okay, so we will restart.
Okay.
Please identify structure number 2.
Structure number 2, superior vena cava vein.
Structure 4.
Structure 4. Okay. I think it's a part of right atrium.
So 5.
Can I pause this question?
Okay, number 6.
This infundibulum.
Number 8.
Tricuspid valve.
Number 9.
Chorda tendini.
Number 18.
Number 18. Pulmonary trunk.
Number 19.
Calabasas coaching.
21.
Mitral valve.
20.
No, I don't know. Okay.
How many cusps have the pulmonary valve?
3.
What is the vertebral level of the pulmonary valve?
T4.
What is the level of the pulmonary trunk division?
T5.
Where to
Sorry,
auscultate
T4.
the final answer?
T4.
Okay. Where to auscultate the pulmonary valve?
Second intercostal space. Just a parasternal.
Right or left?
Right side.
What are the branches of the ascending aorta?
Ascending aorta. Give two branches, right and left coronary.
What are the branches of the pulmonary trunk?
Branches of pulmonary trunk. Right and left pulmonary artery.
How many pulmonary veins are present?
4.
Please identify structure number 3.
Structure number 3. Sympathetic chain.
5.
Pulmonary trunk.
10.
Azygos vein.
12.
Splanchnic nerve.
Which splanchnic nerve?
What?
Which splanchnic nerve?
Greater.
Number 14.
Vagus nerve.
What are the azygous vein tributaries?
Azygous vein tributaries. He takes tributaries from superior costal vein, hemiazygous and accessory hemiazygous, esophageal and precardial and bronchial veins, and inferior intercostal veins, lower inferior.
What else?
I think mediastinal vein.
Where preganglionic fibers of the sympathetic trunk come from?
Sorry, again, can I hear the question again?
Where the preganglionic fibers of the sympathetic trunk come from?
Where from spinal root from sorry, from T1 to from T sorry, spinal root from thoracic from T1 to L5.
What connects the sympathetic trunk to the spinal nerve?
What's the next?
What connects the sympathetic trunk to the spinal nerves?
Sympathetic ganglion.
And what else?
Preganglionic fibers relay in sympathetic ganglion and it out as spinal nerves.
The ganglion and what else connects the sympathetic trunk to the spinal nerves?
No, I can't remember.
Okay, how sympathetic nerves leave the sympathetic trunk, sympathetic chain?
Sympathetic nerve leaves sympathetic chain through greater splanchnic nerve and lesser splanchnic nerve.
And what else?
About يعني plexus around the blood vessels.
What else? Okay, time out.
Okay.
So we move on to next station.
Okay.
Nine minutes started by now.
Okay.
Where are the different parts of the brachial plexus found?
Brachial plexus, different part. First root in found between anterior scalene muscle and intermedial scalene intermedius from C5, 6, 7, and 8 and T1. Then the root give main trunks. You know, you ask about the site of the main trunks also?
Yes.
Okay. The main trunk related to subclavian artery. Then the main trunk give anterior and posterior divisions and the cord related to axillary artery.
Which part of the axillary artery?
First part of axillary artery.
Show on this skeleton the roots of the brachial plexus.
Root of brachial plexus.
The roots of the brachial plexus, yes. What letters represent the root of the brachial plexus in this figure?
Okay. From C, D, and E.
Describe and justify the clinical picture of herpes palsy.
Clinical picture of herpes palsy. Patient presented with adducted arm and pronated forearm. Adducted arm due to a loss of abductors paralysis to abductor muscle, which is supraspinatus and infraspinatus. Pronated arm due to paralysis of supinator muscle.
And what are these muscles paralyzed?
This muscle paralysis because the herpes palsy is the injury to the nerve root from C5 to C7. So patient lose his nerve supply to shoulder abductors and nerve supply to supinator muscle.
Can you name these shoulder abductors, for example?
Shoulder abductors. First, shoulder abduction according to degree of abduction from 0 to 15 with supraspinatus, from 15 to 90 with the deltoid muscle and deltoid muscle and
okay, and paralysis of what else?
Paralysis of weak flexion of wrist joint due to injury to injury of roots of median nerve.
Okay, and what else?
Loss of sensory. Patient has sensory affection at the rear side of forearm.
In herpes paralysis, what would be the impacted reflexes?
In nerve paralysis, what
would be the impacted reflexes?
Impacted reflexes?
The impacted reflexes, yes. The affected reflexes.
البايسبس tendon. البايسبس tendon will be a loss reflex.
And what else other than the biceps reflex?
Biceps, no, biceps. Biceps and I think triceps.
What is the action of brachioradialis muscle?
Brachioradialis muscle, flexion of elbow joint.
In what position of the forearm? In which position? Dr. Amin.
Pronator position.
What are the muscles supplied by musculocutaneous nerve?
Musculocutaneous nerve supply brachioradialis and coracobrachialis. And brachialis muscle. Brachialis muscle.
What else?
And biceps muscle.
What is the sensory supply of musculocutaneous nerve?
give sensory supply of musculocutaneous nerve هيدي lateral cutaneous nerve of the arm and the forearm.
What is the sensory supply of the radial nerve?
Radial nerve give supply of sensory supply of the dorsum of the hand just proximal to the terminal ends, and dorsum of the forearm.
What else?
I think dorsum of arm, posterior aspect of arm.
And what else?
Dorsum of the hand and forearm and posterior of arm.
Okay, identify structure number 3.
Structure number 3. Okay. Greater tuberosity.
What are the muscles attached?
Deltoid muscle.
Identify structure number 8.
Lesser tuberosity.
Muscles attached.
Subscapularis.
Number 6.
Spiral groove.
Spiral groove.
No. Intertrochanteric space.
Okay, what are the muscles attached?
Latissimus dorsi.
Sorry?
Latissimus dorsi.
Okay, and what else?
At the lateral end, insertion of lateral line insertion of pectoralis major and medial line insertion of teres major.
And what is the structure passing through it? Okay, time out.
Okay.
So we move on to next station. Please identify structure number 2.
Okay.
This one.
Oh, okay. Digastric muscle, superior belly.
Superior belly?
No, so I'm so sorry. Inferior belly of digastric.
Does the digastric muscle have superior and inferior bellies, or anterior and posterior? Okay, so
Okay.
structure 37.
Posterior belly of digastric muscle.
Okay, so 2.
Anterior belly of digastric.
Okay, number 19.
Number 19. Okay. Okay, can you mark, please?
This
hypoglossal nerve.
Okay, 45.
45. Omohyoid muscle.
54.
54.
Mhm.
Sternohyoid.
Number 8.
Common carotid artery.
Number 11.
External carotid.
Number 1.
Number 1. Okay. Ansa cervicalis.
Number 16.
Number 16. Spinal accessory.
Okay. What are the boundaries of the anterior and posterior triangles of the neck?
Anterior triangle of the neck is bounded by midline line of the neck and anterior border of laterally anterior border of sternocleidomastoid and superiorly by the lower free margin of mandible. Posterior triangle of neck is bounded by anteriorly by posterior border of sternomastoid muscle and posteriorly by anterior border of trapezius and inferiorly by the middle third of clavicle.
You know the subdivisions of the anterior triangle?
Yes, it's divided by digastric muscle and two digastric triangle and muscular triangle and the carotid triangle and submandibular triangle.
Interpret the microscopic findings of this preauricular lymph node biopsy.
This biopsy show malignant melanoma due to brown deposition of intracellular.
What are the regions that might contain the primary lesion of malignant melanoma in this case?
Primary lesion.
Mm-hmm.
The site of the primary lesion.
Considering this is a microscopic picture of a preauricular lymph node biopsy.
Okay, preauricular lymph node drain primary from the scalp, occiput, and upper face, and auricle.
What else?
I can't remember. Okay.
Okay, what is the nerve supply to posterior belly of digastric?
A marginal mandibular branch of facial nerve.
Regarding great auricular nerve, what is the root value and the area supplied by it?
Great auricular nerve supplies the area around the lower angle of mandible and lower half of auricle for sensory sensation, and a part of and the skin over the parotid gland.
And the root value?
C5, C6.
Regarding external carotid artery, what is its course and the nerve anterior to it?
External carotid artery, its course.
Yes, and the nerve
external
passing
carotid-
anterior.
Okay, external carotid artery, one of two terminal branch of common carotid artery. It's bifurcated at the level of thyroid, upper border of thyroid gland, pass upward to supply to enter the parotid gland. Its branches give superior thyroid artery, ascending pharyngeal artery, one moment, pharyngeal artery, facial artery, and end by two terminal branch, superficial temporal and maxillary artery.
What is the nerve passing anterior to the external carotid artery?
Hypoglossal nerve.
Where is the carotid body and what is its function?
Carotid body, it's found at the posterior side of bifurcation of common carotid, and it's a baroreceptor. It's a chemoreceptor to detect any change in pH of the bloodstream.
Where is the carotid sinus and what is its function?
Carotid sinus is a baroreceptor found at posterior side of common carotid artery, and they monitor change in blood pressure of blood. Monitor changes of blood pressure.
Okay, so time out. Thank you, Dr. Amin. Now we are done. The feedback will be provided to you soon.
Thank you.
Thank you. Now you can leave the meeting.
All right.
Good evening, Dr. Ammar Zahid. Today we are going to conduct the anatomy mock exam for Dr. Ammar. So Dr. Ammar, you have 3 stations and for each station you have 9 minutes. So
All right.
let's start by the first station. 9 minutes started by now. Please identify structure number 2.
It is the ascending aorta.
Number 4.
Number 4. This should be the auricle. Right auricle.
Number 5.
It's also the auricle. Skip. I'd like to skip this.
6.
Infundibulum.
8.
8 is the tricuspid valve.
9.
9 is the papillary muscle.
18.
Pulmonary trunk.
19.
Left auricle.
21.
21. Again, papillary muscle.
20.
I'd like to skip this.
How many cusps have the pulmonary valve?
3.
What is the vertebral level of the pulmonary valve?
T5.
What is the level of pulmonary trunk division?
T6.
Where to auscultate the pulmonary valve?
Like the second intercostal space, parasternal on the left side.
What are the branches of ascending aorta?
The left and right coronary arteries.
What are the branches of the pulmonary trunk?
The left and right pulmonary arteries.
How many pulmonary veins are present?
4.
Please identify structure number 3.
Structure number 3.
Yes.
This should be the. Wait, give me a second, please. This is the sympathetic chain. Sympathetic
Number
trunk
5.
chain. Yeah. Number 5 is the pulmonary bronchus.
Which one?
Right side. Right pulmonary bronchus.
Number 10.
Should be. Is this the vagus nerve? Right vagus nerve?
Number 12.
Well, this is the greater splanchnic nerve.
14.
Give me a second, please. This is the right phrenic nerve.
What are the tributaries of the azygous vein?
I'd like to skip this question.
Where the preganglionic fibers of the sympathetic trunk come from?
I'd like to skip this.
What connects the sympathetic trunk to the spinal nerve?
The white and gray rami communicantes and the ganglia.
How sympathetic nerves leave the sympathetic chain?
I'd like to skip this.
Okay, so that was the last question in this station. Would you like to recall any of the unanswered questions, or would you like to move on to the next station?
No, we can move on.
Okay. Nine minutes started by now. Where are the different parts of the brachial plexus found?
The roots are in between the anterior and middle scalene muscles, and after that, I don't recall properly. Wait, give me a second, please.
Okay.
The roots are between the scalene anterior and no, I'm sorry, I can't recall this properly. I'd like to skip the rest. So that's the whole of my answer.
Okay, show on the skeleton the roots of the brachial plexus.
This on this diagram right here.
This diagram is what letters indicate the roots of the brachial plexus?
Please. So they form the roots. They form between these foramina, these transverse foramina. That's where they lead from.
Sorry.
So they leave from A and B. They leave the. Oh wait. Okay, wait. This is This is C7 over here, so but it shouldn't be on this diagram. It should be it starts from C8 to T1. I'm sorry, no. Just give me a second, please. C7 to
Manage
C8.
your own time. Your own time.
All right. It starts at D. Give me a second, please.
The answer of this question is letters. What letter indicates the roots of the brachial plexus on this skeleton, on this diagram?
Okay, this should be B then. B for butter. Yeah.
And what else?
It should be B, C, D, and E as well.
Okay. Describe and justify the clinical picture of Erb's paralysis, Erb's palsy.
Okay. There's a greater step deformity. There's an injury to the upper roots of the brachial plexus. So C5 and C6 are injured. Because of this, what happens? The arm is adducted and internally rotated. What happens? The wrist also is flexed and flexed. Wait a second. The forearm is completely pronated and the wrist is flexed. So, and do I have to describe?
Yes, please justify your answer.
Okay, just give me a second, please. Okay, so the arm is adducted. That's because the supraspinatus and deltoid muscles are inactive. What else happens? The flexors and supinator is also, the flexor of the forearm and supinator are also paralyzed. The biceps, the brachialis and brachioradialis. So the forearm is extended and pronated. And I don't know, I can't recall why the wrist is in a flexed position. So that would be my answer.
Okay, in Erb's paralysis, what would be the impacted reflexes?
Wait. It should be the biceps reflex.
And what else? And brachioradialis. What is the action of brachioradialis muscle?
It acts by a flexion of the forearm.
In which position?
I don't know this.
What are the muscles supplied by musculocutaneous nerve?
The biceps muscle, brachialis muscle, and brachioradialis.
What is the sensory supply of the musculocutaneous nerve?
It should be the upper. Wait. Just a second, please. It will be the forearm, lateral side of the forearm.
What is the sensory supply of the radial nerve?
The radial nerve supplies the extensor surfaces of the arm, the forearm, and the radial half of radial 3 digits as well in the hand. 3.5 digits.
Which surface of the 3.5 digits?
Extensor surface. Dorsal surface.
Okay. Identify structure number 3.
This is the greater tubercle of the head.
And what are the muscles attached?
Greater tubercle. Second to third view. I can't recall all of this right now. Please, I'd respect it.
Number 8.
This would be the lesser tubercle.
Muscles attached.
Let's see if I can. Give me a second to think. I can only recall that there's a subscapularis that attaches here.
Structure number 6.
This is the bicipital groove.
Muscles attached.
You're asking about the muscles that attach to the, either of the lips of this, right?
Okay, time out, so we move on to next station.
All right.
Okay, please identify structure number 2.
Number 2. This is the anterior belly of the digastric nerve.
37.
37 is the posterior belly of the digastric.
Number 19.
19. This is. Could you zoom in, please? Just once, yes. Thank you.
This structure.
Yes. This is the hypoglossal nerve.
45.
Okay, 45. This should be. This is sternohyoid.
54.
54 is. This is the omohyoid, superior belly of the omohyoid.
Number 8.
Number. This is the. This is the. It is the. This is the common carotid artery.
Number 11.
It should be. Yes, it should be the external carotid artery.
Sorry?
External carotid artery.
Number 1.
The greater auricular nerve.
Number 16.
Oh, I'm sorry. I'd like to change mine. So 16 is the greater auricular nerve, and 1 is the accessory nerve.
Okay. What are the boundaries of the anterior and posterior triangles of the neck?
Okay, I'll start with the posterior triangle. The posterior triangle's posterior border is the anterior border of the trapezius. The base is the middle third of the clavicle, and the anterior border is made by the posterior border of the sternocleidomastoid muscle. And the anterior triangle has as its posterior border the anterior border of the sternocleidomastoid. A line, an imaginary line from the midline down to the sternum, and wait, what could it? What's the base? Could be, the base would be. I think. Okay, I can't recall the anterior triangle properly. So that's it. I'd like to move on.
Okay. Interpret the microscopic findings of preauricular lymph node biopsy.
This has normal cells that are stained by hematoxylin and leucine, but these brown cells are the cells that are staining brown are melanocytes, which are suggestive of malignancy if they're since they're from the lymph node.
So what is this disease you suspect?
Malignant melanoma.
Okay. What are the regions that might contain the primary lesion of malignant melanoma in this case?
I'm sorry, could you repeat the question?
What are the regions that might contain the primary lesion of malignant melanoma? Considering this a preauricular lymph node biopsy microscopic picture.
I heard you, but I'd like to skip this question for now.
What is the nerve supply to posterior belly of digastric?
The facial nerve?
Regarding great auricular nerve, what is the root value and areas supplied by it?
I'm sorry, could you repeat yourself?
Regarding the great auricular nerve, what is the root
Yes.
value and the areas supplied by it?
C2, C3, the root value, and it supplies the auricle, the skin or the carotid line, the external auditory meatus, and the angle, skin or the ankle of the mind.
Regarding the external carotid artery, what is the course and nerve passing anterior to it?
The nerve that passes anterior to it is the hypoglossal nerve, and the course. It begins at the upper border of the thyroid cartilage, and it enters the substance. It enters. It keeps going upwards, and it terminates in the substance of the parotid gland. By dividing it to the superficial temporal artery and the maxillary artery, which are its terminal branches.
What are the branches of external carotid artery?
The superior thyroid artery, the ascending pharyngeal artery, the lingual artery, the facial artery, the occipital artery, please. Occipital artery, the maxillary artery, and the superficial temporal artery.
And what else? There is one artery missing.
Just a second. The posterior auricular artery.
Where is the carotid body and what is its function?
The carotid body is at the. Wait, let me think. It is at the bifurcation of the common carotid artery on the posterior side, and it contains chemoreceptors that are sensitive to changes in pH.
Where is the carotid sinus and what is its function?
It is at the base of the internal carotid artery, and it is a small dilatation over there. It contains baroreceptors.
And what is the function of these baroreceptors?
They sense changes in the blood pressure, of course, and they adjust accordingly. They fire sympathetic and parasympathetic signals accordingly to maintain, to adjust blood pressure.
Time out. So now we are done. And the feedback will be provided to you soon. Thank you, Dr. Ammar.
All right. Thank you very much. Thank you.
Thank you.
Goodbye.
Good morning, Dr. Ashraf Sheikh. Now, today we are going to conduct the anatomy mock exam for Dr. Ashraf. So, Dr. Ashraf, you have 3 stations, and for each station you have 9 minutes. We'll start by the first station, 9 minutes started by now. Please identify structure number 1.
Structure number 1. I'm just trying to find where it is. Just a second.
This one.
Yeah. So the structure number 1 is the trochlear nerve. No, sorry. I'm so sorry. I just tried to correct my answer. It's the abducens nerve. It's the abducens nerve.
Structure 5.
Structure 5 is the attached border of the tentorium cerebelli.
9.
Structure 9, just a second. Okay. Structure 9 would be the trochlear nerve.
Structure 9, this structure.
To what would be structure 9 actually? Structure 9, I'm not too sure. So it is probably the part of the tentorium cerebelli itself.
Which part? Which part of tentorium cerebelli?
The unattached part of the tentorium cerebelli, I think.
Okay, structure number 19.
Structure number 19. Yes. Structure number 19 is the oculomotor nerve.
24.
24 is the optic nerve.
26.
26 is the pituitary.
Pituitary what?
The pituitary stalk.
Okay, please identify structure 2.
Structure 2 is the olfactory bulb.
4.
Structure 4 is the optic nerve as well as the internal carotid artery.
6.
Structure 6 is the oculomotor nerve.
7.
7 is the abducens.
9.
9 is the trochlear nerve.
15.
15 is the trigeminal nerve.
16.
16 is the facial and the vestibulocochlear nerve.
Regarding oculomotor nerve, what is the course and muscles supplied by it?
So the oculomotor nerve, the course of the oculomotor nerve is such that it starts in the oculomotor nucleus in the midbrain. From there, it proceeds ahead ventrally, and it will cross the inferior cerebral artery. It will cross the inferior cerebral artery inferiorly to it, and superior to the superior. It will cross superior to the superior cerebellar artery, and from there, it will enter the cavernous sinus in the lateral wall, and from the lateral wall of cavernous sinus, it will exit the cranial cavity from the superior orbital fissure, where it gives two branches: the superior oculomotor nerve branch and the inferior oculomotor branch. So that is the course, and then it supplies the muscles of the eye, and the muscles are levator palpebrae superioris, the sphincter dilator, the sphincter pupillae. Then it supplies the medial rectus, the inferior rectus, the superior rectus, and the inferior oblique muscle.
And what else as muscle supply?
I think that means apart from the lateral rectus and the superior oblique, all the extra ocular muscles are supplied by the oculomotor nerve. So superior, medial, and inferior rectus, inferior oblique, the levator palpebrae superioris, and the sphincter pupillae. These are the muscles that I know.
There are sympathetic fibers. You know the name of the muscle supplied by the sympathetic fibers?
Name of the?
There are sympathetic fibers in the oculomotor nerve.
Okay. Yes. The parasympathetic fibers.
Okay.
The parasympathetic fibers supply the sphincter pupillae, which when the oculomotor nerve is affected, that causes dilation of the pupil.
Okay. What is the clinical picture of oculomotor nerve palsy?
Clinical picture is the gaze is downwards and outwards, along with drooping of the eyelid, as well as mydriasis. So the gaze is downward and outwards because so the gait is downward and outwards because it is outwards because of the lateral rectus pull, which is supplied by the abducens. So because of that pull, it is outwards, and it is downwards because of the pull of the superior oblique muscle, which is supplied by the trochlear nerve. This is the reason for its downward and outwards. And it is ptosis because of paralysis of the levator palpebrae superioris. So there will be ptosis of the eyelid, and mydriasis is because of loss of the parasympathetic fibers supplying the sphincter pupil, which will cause dilation of the pupil.
What is the first sign and why?
The first sign is mydriasis, because these are the fibers that are affected first because they are arranged peripherally.
Okay, what is the structure the oculomotor nerve might be pressed against?
The attached border of the tentorium cerebelli.
What are the attachments of tentorium cerebelli?
So tentorium cerebelli is tecton membrane is a membrane that separates the cerebellum from the cerebral hemispheres. It is attached posteriorly along the groove for transverse sinus in the occipital bone, and anteriorly it is supplied. Anterolaterally it is attached to the superior border of the petrous temporal, and medially it has an opening which allows the passing of the brain stem.
What is false localizing sign?
False localizing sign is when the dysfunction that we are seeing is actually distant from the site of the anatomical damage. For example, in right temporal lobe trauma, there will be left-sided abducens nerve palsy. That is an example of a false localizing sign.
Do you know a common example of localizing sign?
Yes. The right temporal lobe trauma will cause palsy of the left-sided abducens nerve.
Okay. What is the abnormality in this figure?
The abnormality is that there is an aneurysm that is present. The aneurysm is present in the middle cerebral artery.
And what is the consequence of rupture?
Middle cerebral artery rupture can cause paralysis of the contralateral upper and lower limb.
Okay, time out.
Paralysis of the. Okay.
Time out. So we'll move on to next station.
Okay.
Okay. Please identify structure 5.
Structure 5 is the lateral talofibular ligament. Is the talofibular ligament.
Which talofibular ligament?
The anterior talofibular ligament.
7.
7 is the talocalcaneal ligament.
Talocalcaneal?
The calcaneum and from the
Okay, 18.
18 is talonavicular joint, the articular surface of the talus and the talonavicular joint.
Number 19.
Number 19, just a second. Number 19 is navicular bone.
34.
So can I go back to 9 once?
Okay.
Not 9, sorry, 8. Sorry, 8. You had asked me 8, right?
I asked you about 7, number 7.
Sorry, number 7. Should I revise my answer to calcaneofibular ligament?
Okay. So number 34.
34 is talus, body of the talus.
34. 34 is a ligament.
Okay. 34 looks like a ligament. So deltoid ligament.
31.
31. Not so sure of 31. Just about the sustained form. 31 is I'll come back to it, sir, if I remember.
Okay, 32.
32 is the calcaneum.
35.
35 is the talus.
13.
13 are the
30.
plantar ligaments. 1 3, right? Oh, sorry, 3 0.
Yes.
Okay. It's like maybe the sustentaculum terrae.
Okay. Would you like to return to the number 31 or we move on to the next question?
Maybe I can just say anterior 23 or 31. We can move on to the next question, sir.
Okay. If this is the first metatarsal bone, what is structure A?
Structure A is the tuberosity at the base of first metatarsal.
What are the arches of the foot and what are their components?
So arches of the foot are there are longitudinal arches and transverse arch. So there are two longitudinal arches: the medial longitudinal arch and the lateral longitudinal arch. And then there is a transverse arch, which is half, which is completed by the by keeping both the foot together. The medial longitudinal arch consists of the calcaneum, the talus, the navicular, and the three cuneiform bones and the three metatarsals. The medial three metatarsals. This is the medial longitudinal arch. The lateral longitudinal arch has the calcaneum.
What are the ligaments? What are the ligaments and muscles in the medial longitudinal arch?
Yes, so the muscles of the medial longitudinal arch are the tibialis anterior muscle, the tibialis posterior muscle, the plantar ligaments.
Which plantar ligaments?
The medial plantar ligaments.
What else?
And apart from that, the peroneus longus.
What are the ligaments, the ligamental components of medial longitudinal arch?
The deltoid ligament and the plantar ligament.
Okay, proceed.
The lateral longitudinal arch has the calcaneum, cuboid. Then it has the lateral two metatarsals.
And ligaments and muscles.
Yes, and the muscles will be the peroneus longus, peroneus brevis will be the muscles, and lateral plantar ligament will be the ligaments, and the talofibular ligament will also be the ligament.
Okay,
then proceed to the transverse arch. The transverse arch is formed by the metatarsal bones of the foot, and it is an incomplete arch which is completed by forming the by keeping both the foot together.
And the muscles.
The muscles are the peroneus longus is the muscle. Peroneus longus.
Okay, what are the deltoid ligament attachments?
Deltoid ligament attachments are it is attached to it is on the medial side of the ankle, but it is attached to the tibia superiorly, and inferiorly it is attached to the calcaneum, and
To the calcaneum.
inferiorly it is attached to the navicular. One limb is it is attached to the navicular.
What else?
And another limb is maybe attached to the talus.
Okay, what is the type and articulating surfaces of subtalar joint?
The articulating surface of the subtalar joint are between the talus and the calcaneum.
And type?
It is a synovial joint. It is a plain synovial joint.
What is the type and articulating surfaces of talocalcaneonavicular joint?
Talocalcaneonavicular joint. The articulating surface are between the talus head and the navicular.
So time out. Okay, so we'll move on to the next station and the last one.
Okay. Should I identify the numbers encircled?
Wait a minute, I will tell you.
Okay.
Okay, time starts. Please identify structure number 6.
Structure number 6 is the fundus of the stomach.
Number 2.
Body of the stomach.
18.
18 is the pyloric antrum.
19.
Pyloric canal.
23.
The first part of duodenum.
What is the blood supply and venous drainage of the stomach?
Blood supply of the stomach, it mainly comes from the celiac trunk, gives the left gastric artery. So that is one branch. The celiac trunk from the abdominal aorta gives the left gastric artery. Then it is also supplied from the splenic artery by short gastric arteries, as well as the left gastroepiploic artery. And another branch is supplied from the hepatic artery, which gives a branch gastroduodenal, which gives the right gastric artery.
And venous drainage.
And venous drainage is by the left and right gastric vein that drain into the portal vein, and the short gastric veins that drain into the splenic vein, and the right and left gastroepiploic veins that drain into the superior mesenteric vein.
What are the peritoneal relations of the different parts of the duodenum?
So in the duodenum, only the first part is intraperitoneal, and rest of the duodenum is outside the peritoneum.
The first part or the fourth part?
The first part.
First part, number 1 or number 4?
Number first, one. Part number 1.
Okay. What is the blood supply of the duodenum?
The blood supply of the duodenum comes from the superior pancreatico-duodenal artery and the inferior pancreatico-duodenal artery. The superior pancreatico-duodenal artery comes from the gastroduodenal artery, which is a branch of the common hepatic artery, and the inferior pancreatico-duodenal artery comes from the superior mesenteric artery.
What else?
It also gets supply from the hepatic artery and the gastric arteries.
Okay, what are the different relations to the third part of the duodenum?
Third part of duodenum.
Third, yes.
Third, right? So third part of duodenum, anteriorly we have the superior mesenteric artery, the superior mesenteric vein, the root of mesentery, the transverse colon, transverse mesocolon, and coils of jejunum. Then posteriorly we have the IVC, the right psoas muscle, the right renal vein, the right ureter. Posteriorly, superiorly we have the body of the pancreas, and inferiorly we have the small intestine.
Where is the major duodenal papilla and what is its function?
The major duodenal papilla is a semicircular hood, is an opening in the opening the second part of duodenum, which has a semicircular hood just above it. It has the opening. It has a opening, which is a hepatopancreatic ampulla, where the common bile duct as well as the main pancreatic duct will open into the major duodenal papilla to give the secretions of the bile as well as the pancreas. It is around 8 to 10 centimeters from the pylorus.
What is the blood supply of the pancreas?
The blood supply of the pancreas is the blood supply of the pancreas is the superior pancreatic duodenal artery, the inferior pancreatic duodenal artery, and superior pancreatic duodenal, as I said, is a branch of the gastroduodenal artery from the hepatic artery, and the inferior pancreatic duodenal artery is a branch of the superior mesenteric artery. Apart from that, it is also supplied by the hepatic arteries.
From hepatic?
No, not hepatic artery actually. It is supplied by the I can't recollect the other arterial blood supply.
Okay, where are the ducts of the pancreas open?
So the main pancreatic duct is the duct of Wirsung. That is the main pancreatic duct opens in the duodenal papilla, in the major duodenal papilla, 8 to 10 centimeters from the pylorus, and then there's an accessory pancreatic duct that opens just proximal to it, which it just opens just proximal to it.
What are the vessels encountered during pancreatic surgery?
The vessels encountered would be the superior mesenteric artery, the abdominal aorta, the superior pancreatic duodenal artery, the inferior pancreatic duodenal artery, the superior mesenteric vein, the IVC,
What else?
and the portal vein, and the portal vein, gastroduodenal artery, inferior mesenteric vein.
Okay, what is the ligament connecting the pancreatic tail to the spleen?
The the pancreatic tail to the spleen.
Yes.
The linorenal ligament.
Okay. Describe the development of the pancreas.
The pancreas developed from two ducts, the ventral duct and the dorsal duct. The dorsal duct developed from the dorsal part of the duodenum, and it forms the body tail and the half of the head. The ventral duct forms the half of head and uncinate process, and it develops from the hepatic tissue.
Okay, identify structure number 3.
Structure number 3 is the head of pancreas.
9.
9 is the neck of pancreas.
14, sorry.
14 is the superior mesenteric artery.
15.
Superior mesenteric vein.
Okay, so that was the last question. Thank you, Dr. Ashraf. And the feedback will be provided to you soon. Now you can leave the meeting. Thank you.
Okay, thank you. Thank you. Thanks a lot.
Good evening, Dr. Asma Fathi. Today we are going to conduct the anatomy mock exam for Dr. Asma. So, Dr. Asma, you have 3 stations, and for each station you have 9 minutes. Okay?
Okay, doctor.
So, we start by the first station. 9 minutes started by now. Please identify structure number 2.
Number 2, superior vena cava.
Sorry?
Superior vena cava.
Number 4.
The ankle.
Number 5.
Right atrium.
Number 6.
Number 6, pulmonary trunk.
6.
6, pulmonary valve.
Okay, number 8.
8, tricuspid valve and its muscles attached to the ventricle.
Number 9.
Chorda tympani. Sorry, chorda tendini. Asfa. Sorry.
Number 18.
Number 18. I'm so sorry. Wait, just wait. This is number 18. The left ventricle, left atrium. Sorry, left atrium.
Number 19.
No, it's left atrium. I can't remember right now.
Number 21.
21. Muscle attach chorda. Left muscles of left. No, it's not left ventricle. Sorry, I can't remember.
Number 20.
I can't remember it either.
Okay, how many cusps have the pulmonary valve?
Pulmonary valve. Bicuspid. 2.
What is the vertebral level of the pulmonary valve?
Vertebral level of pulmonary valve. I can't remember.
So would you like to skip the question?
Yes.
What is the level of pulmonary trunk division?
Skip the question. I didn't study it. Sorry.
Where to auscultate the pulmonary valve?
Pulmonary at parasternal. I didn't remember. Sorry. I didn't review this.
Okay, do you know the branches of the ascending aorta?
Ascending aorta. ascending, continue to form aortic arch, which give us left internal carotid, left internal carotid.
I need the branches of ascending aorta.
No, skip the question.
Okay, do you know the branches of pulmonary trunk?
Yes, the main right and left pulmonary arteries.
How many pulmonary veins are present?
4.
Okay. Can you identify structure number 3?
Number 3, where number 3? Just wait. Number 3 اللي هو azygous vein.
Number 5.
The pulmonary trunk, the pulmonary veins. The pulmonary the pulmonary trunk and its division to the lung.
Pulmonary trunk.
The division of the right, the left lung. Huh?
So what is structure number 5?
Just wait here. That is okay with you. 5.
Sorry?
I'm just trying to remember. Pulmonary veins in front. هما اللي قدام والبرونكس هي اللي ورا الميدل. the left pulmonary the left pulmonary artery, the left main trunk, the left pulmonary trunk, pulmonary branch.
Structure number 10.
10? No, I can't remember.
12.
Just wait. 12. No, I can't remember it.
14.
14. Phrenic nerve.
Which phrenic nerve? Right or left?
I think it's نازل على الventricle. Phrenic nerve. Right phrenic nerve, I think.
Okay, what are the azygous vein tributaries?
Azygous vein tributaries. Can't remember.
Where do preganglionic fibers of the sympathetic trunk come from?
Preganglionic fibers of the sympathetic nerve.
Of sympathetic trunk. Where do they come from?
Preganglionic come from spinal cord, from the ganglion, the root ganglion. Can't remember.
Okay, do you know what connects the sympathetic trunk to the spinal nerves?
Sympathetic trunk to the spinal nerves, peripheral ganglions.
What else?
Preganglionic, ganglion, postganglionic. Postganglionic guide to the organs. No, can't remember it. Didn't study it actually.
Okay, how the sympathetic nerves leave the sympathetic chain?
No, can't remember.
Okay. Time out, so we'll move on to next station.
Okay.
Nine minutes started. Where are the different parts of the brachial plexus found? Roots, trunks, divisions, and cords.
Again, sir.
Where are the different parts of the brachial plexus found?
Where are the different parts of brachial plexus? What?
Found.
Found. Brachial plexus on the root of the neck.
Specifically, where are the roots and the trunks, divisions, and cords? Each one of these.
No, can't remember.
Okay, can you show on the skeleton the roots of the brachial plexus? Which letters indicates the presence of the roots of the brachial plexus?
Brachial plexus. Brachial plexus that supply the upper arm.
Yes.
It must be at A.
Okay, describe and justify the clinical picture of herpes palsy.
Upper trunk. Upper trunk. It's about upper trunk injury. Herpes, right?
Justify the clinical picture of herpes palsy.
No, I can't remember.
Okay, in herpes paralysis, what would be the impacted reflexes?
Again, sir, sorry?
In herpes paralysis, what would be the impacted reflexes?
It's about herpes C5 and C6. Biceps reflex will be lost.
And what else?
Biceps. No, I can't remember what else. I just remember.
Okay, what are the action? What is the action of brachioradialis muscle?
Brachioradialis muscle. Just a minute. Brachioradialis muscle. Supination of the arm and flexion of the elbow.
Flexion of the elbow at which position?
Semi-pronation.
What are the muscles supplied by musculocutaneous nerve?
Musculocutaneous nerve supply deltoid muscle and coracobrachialis.
Deltoid is wrong. Coracobrachialis is right. What else other than coracobrachialis?
Teres minor, I think. I didn't remember, actually.
Okay, what is the sensory supply of the musculocutaneous nerve?
The medial side of the arm.
What is the sensory supply of the radial nerve?
Radial nerve, the dorsum of the arm up to the distal phalanx, below distal phalanx. The lateral 2/3 of the forearm, of the dorsum of the arm, up to the distal, the second interphalangeal joint. The distal phalanx is not supplied by the radial nerve.
What else?
Sensory. The extensor surface of the forearm, I doesn't remember actually. What else?
Please identify structure number 3.
Number 3.
Mhm.
Just give me a minute. Number 3, greater tubercle. Yes, greater
What are the
tubercle.
muscles? What are the muscles attached to it?
Greater tubercle muscles attached to it. It give attachment to deltoid muscle. No, sorry. Yes, this is the okay. Greater tubercle. No, not deltoid. لا. Can't remember. Sorry.
Structure number 8.
Lesser tubercle.
And what is the muscle attached?
I didn't revise it. I'm so sorry.
Structure number 6.
Structure number 6. It's the groove, biceptal groove.
Muscle attached.
We have one muscle attached. biceps. The tendon لا ده مش بعد فيها. Pectoralis major.
What else?
No. Can't remember. muscle في biceptal groove. No, I can't remember other than pectoralis.
Okay, what are the structures passing through it?
The tendon of long head of biceps pass through it.
Okay, structure number 5.
Structure number 5. The head, the head of the humerus.
Number 1.
Number 1. No, I can't remember number 1.
Number 10.
Number 10, medial and lateral edges of biceptal groove.
Number 10 is all this region.
Tuberosity. It's called tuberosity. Tuberosity. Oh yes, the circular one. Yes, surgical neck around it. Surgical neck. Okay.
Describe how to articulate humerus, radius, and ulna.
How to articulate
humerus, radius, and ulna.
Humerus, radius, yes, radius and ulna. Okay. The humerus had its lower end called trochlea. Articulate with trochlear notch or fossa of the ulna. The same as the olecranon. What's the opposite? Olecranon fossa of the humerus articulate with olecranon of the ulna. As regard the radius, the radial head articulate with I can't remember the part articulating with the radial head.
Okay, time out, so we move on to next station.
Okay.
Okay, we'll start the 9 minutes. 9 minutes started. Please identify structure number 2.
Structure number 2. Wait, can you just point to it, sir?
I just pointed this structure.
Yes, it's the anterior belly of digastric muscle.
37.
Where? 37? 37?
Here.
Yes.
You see my arrow. Okay.
37, it's stylo. No, it's I can't remember 37. I'm sorry.
19.
19 where? 19 is the lingual nerve.
Number 45.
45, it's the sternohyoid bone. Sternohyoid bone, yes, sternohyoid bone.
54.
54, it's the superior belly of omohyoid.
Number 8.
8 is the common carotid, or no, it's the external carotid artery.
Number 11.
11 where? 11? Oh. 11?
Yes. You see number 11.
Yes. 11 external carotid. How? 8 if 11 is external carotid, so 8 is a common carotid. I can't remember it actually.
Okay, so what is your answer? What is your final answer for 8 and 11?
11, it's okay. 11 external carotid. 8, I think it's common carotid, but I'm not sure. The same is continuity, so it had to be the common carotid, but I'm not sure.
Number 1.
Number 1. I can't remember actually.
16.
Number 1. Anticervicalis. 16. No. Number 1. I'm sorry. Number 1. No, I can't remember number 1. No, I'm sorry.
16.
16. Oh yes. واحد فيهم greater auricular, but I think 16 is greater auricular. I think.
What's your final answer?
1 is too deep. Yes, it's greater auricular 16.
You know the boundaries of the anterior and posterior triangles of the neck?
Anterior triangle of the neck bounded by anterior, the midline anteriorly, the anterior border of sternomastoid posteriorly, anterior sternomastoid, and anterior midline, and the mandible. Anterior border of sternomastoid, midline of the neck, yes. The mandible superiorly. Posteriorly, posterior triangle of the neck, posterior border anteriorly, bounded anteriorly by the posterior border of sternomastoid, posteriorly by trapezius, anteriorly by middle part of the clavicle. Yes. I hope it's right.
Do you know the subdivisions of the anterior triangle?
Anterior triangle divided into submental, carotid, and digastric. No, digastric is the carotid, muscular, I think, muscular.
Okay, interpret the microscopic finding of preauricular lymph node biopsy.
Microscopic finding of
of this preauricular lymph node biopsy?
Yes, this melanin pigment lymph node صح؟ mostly malignant.
What is this microscopic picture? What indicates this microscopic picture?
I can't remember the explanation. Just I just remember that we have melanin pigments here, so it may be taken from a lymph node with a malignant melanoma metastasis.
Okay, so that's right. What are the regions that might contain the primary lesion of malignant melanoma?
Malignant melanoma can come in different parts of the body, face, upper limb.
I mean here, in this case. This is a
case,
preauricular lymph node biopsy.
preauricular, yes, preauricular take.
What are the areas drained by preauricular lymph nodes?
The face, the upper lip, the upper face mainly. I can remember the upper face mainly, the upper half of the face.
What else?
Upper half of the face. I can't remember what else. I can't remember. I'm sorry.
Okay, what is the nerve supply to posterior belly of digastric?
Anterior belly trigeminal, posterior belly facial nerve.
Regarding great auricular nerve, what is the root value and what is the area supplied by?
Great auricular nerve, teeth 2 and 3. I can't remember exactly.
Neither the root value or the area supplied by it?
The area supplied external the auricle. I can remember it's about the lower half of the auricle and the area around. The root, it's either 1, 2, 3 or 2, 3. I can't remember exactly.
2, 3 what?
Cervical.
Okay, do you know the course of external carotid artery and what is the nerve passing anterior to it?
External carotid artery, the nerve passing hypocrustal? No, I can't remember. I'm sorry.
Do you know the branches of external carotid artery?
Yes, branches of external carotid started with superior thyroid, lingual, facial, give posteriorly the occipital artery and posterior auricular, and it ends by maxillary and superficial temporal. There is one missing. Ascending pharyngeal, sorry.
Okay, where is the carotid body and what is its function?
Carotid body in the bifurcation of between external and internal bifurcation. Yes, bifurcation of the common carotid. It's a chemical. It's a chemoreceptor.
Okay, thank you, Dr. Asma. The time is out, so now we are done. And the feedback will be provided to you soon. Thank you. Now you can leave the meeting.
So sorry, I didn't prepare well.
Good morning, Dr. Aya Sak. Today we are going to conduct the anatomy mock exam for Dr. Aya. So Dr. Aya, you have 3 stations, and for each station you have 9 minutes. So
Okay.
let's start by the first station. 9 minutes started by now. Please identify structure number 2.
Pulmonary trunk.
No. Superior vena cava.
Structure number 4.
Infundibulum.
Number 5.
Auricle of the right atrium.
Number 6.
Six is the infundibulum. So 4 is the right atrium.
Number 8.
Trabecula carni.
Number 9.
Papillary muscles.
Number 18.
Pulmonary trunk.
19.
Left atrium.
Number 21.
Papillary لا. Valve. لا. Muscle. لا مش muscle. Trabecular carni again? I don't think so.
You like to skip
Oh,
number 20.
20.
You like to skip.
Okay, skip.
How many cusps have the pulmonary valve?
2.
What is the vertebral level of the pulmonary valve?
C4.
What is the level of the pulmonary trunk division?
C5.
C5?
T5. T5.
Where to auscultate the pulmonary valve?
Pulmonary valve, left second intercostal space.
What are the branches of the ascending aorta?
Intercostal branches. Can we skip it and return back to it?
Okay, sure. What are the branches of the pulmonary trunk?
Intercostal.
If you would like to skip a question, skip. Tell me skip for your time.
Skip.
How many pulmonary veins are present?
4. 4 ايه؟ لا 3.
Please identify structure number 3.
Sympathetic trunk or chain.
4 or 3 pulmonary veins?
Pulmonary veins 3.
Identify structure number 3.
Sympathetic trunk.
5. Number 5.
Pulmonary artery.
Number 10.
Azygos.
Number 12.
Inferior phrenic.
Number 14.
Vagus. لا recurrent laryngeal.
What are the azygous vein tributaries?
Lower four intercostal veins. Lower four intercostal. Okay. Hemiazygous. Right to left, right and left phrenic. Lower four pulmonary veins. Lower four intercostal veins, not pulmonary. Lower four intercostal veins. With pulmonary veins and pulmonary veins.
Would you like to skip?
Yes.
Where the preganglionic fibers of the sympathetic trunk come from?
From the roots of the spinal nerves.
At which level? Corresponding to which spinal nerve specifically?
Okay, from T2 to T12.
What connects the sympathetic trunk to the spinal nerve?
The preganglionic fibers, preganglionic nerves.
What connects the sympathetic trunk to the spinal nerves?
The dorsal root ganglia, the ganglia.
Sorry?
What connects the spinal trunk to the spinal nerves? There is fibers, the nerve fibers.
Okay, time out.
Fibers. Okay.
Okay, time out. So we'll move on to the next station.
Okay.
Nine minutes started by now. Where are the different parts of the brachial plexus found?
Different parts. There is root, trunk, and division cords. The roots are between scalus anterior and scalus medius. The trunks is behind the second part of subclavian artery. The third part is behind the middle 1/3 of the clavicle. Trunk division. The divisions is behind the middle 1/3 of the clavicle. The cords is behind the second part of subclavian axillary artery. The third part of no. Subclavian is the third part, while axillary is the second part.
Okay, show on this skeleton the roots of the brachial plexus. Which letter is indicated?
Okay. D.
Sorry?
D. D.
Describe and justify the clinical picture of Erb's palsy.
Okay. It's injury in the upper root of brachial plexus, C5 and C6. The arm will be adducted, internal rotated. The forearm will be pronated and also internally rotated. The hand will be, the rest will be flexed and also internally rotated.
Okay, justify your answer.
Okay. First of all, an arm will be adducted, as the abductors of the arm will be paralyzed, which are supinator and biceps. It will be pronated because supinator is paralyzed. It will be internally rotated as the supraspinatus and deltoid. Supraspinatus and deltoid will not be functioning.
What are the supraspinatus and deltoid? What are their functions?
Supraspinatus elevation from 0 to 15. Deltoid
So
elevation.
they are arm abductors, not internal rotators, not rotators.
Yes. Yes.
Okay, so paralysis of supraspinatus and deltoid muscles will cause arm adduction.
Okay.
And paralysis of what will cause internal rotation?
Internal rotation. Teres minor? No. External rotators. Read external rotators. External rotators. Anything else? The horse, the scapula. And serratus. No, serratus.
Okay, the damage first will be to what nerve roots? Which nerve roots?
What?
Which nerve roots are damaged in
C5 and C6. Upper trunk.
Okay. Do you know the sensory affection?
Sensory loss on the lateral side of the arm and forearm.
Okay. So please complete your answer regarding the motor affection.
Okay. The arm will be pronated as a supinator and pronator quadratus will be lost. Okay. No.
What are the supinators and flexors of the forearm?
The reflexes of the forearm.
What are the flexors and supinators of the forearm?
Okay. The flexors is biceps. Forearm. Okay. Biceps and pronator.
Biceps and what?
Biceps and brachialis and coracobrachialis. They are the flexors of the forearm. Biceps brachialis and
coracobrachialis is a flexor of the forearm.
Yes.
Okay, and what else? Would you like to skip the question?
Okay.
Because your answer is not complete.
Okay.
You should either complete your answer or skip the question.
Okay.
So
okay, skip.
Okay, in Erb's paralysis, what would be the impacted reflexes?
The biceps reflex will be lost.
What else?
Biceps reflex. The biceps reflex. We pronator reflex.
What is the action of brachioradialis muscle?
Brachioradialis. Adduction and lateral rotation.
What are the muscles supplied by musculocutaneous nerve?
Biceps. Biceps or supinator?
Biceps and what?
Supinator.
Supinator?
So it's wrong. Biceps. Okay, if it's wrong, skip.
What is the sensory supply of musculocutaneous nerve?
Lateral side of the arm and forearm.
What is the sensory supply of radial nerve?
The dorsal aspect of the palm. And the lateral side of the forearm.
What else?
The distal phalanx of the lateral 1/3 of the palm, and the lateral 3.5 fingers of the dorsal aspect.
What else?
The lateral aspect of the arm.
What else?
Lateral 3.5 fingers. I said the fingers, right? Yeah.
Okay, time out. So we move on to next station. Please identify structure number 2. This structure.
Omohyoid.
37.
Stylohyoid muscle.
Number 19.
Hypoglossal nerve.
Number 45.
Sternohyoid muscle.
Number 54.
No, 2 is digastric. 2 is digastric. 2 is not omohyoid. 2 is digastric. And 54 is the omohyoid.
Which part of the omohyoid and which part of the digastric muscle?
Okay. 2 in digastric is the inferior pili, and 54 is the superior pili of omohyoid.
Inferior belly of digastric muscle. Does digastric have inferior and superior bellies, or anterior and posterior?
Anterior and posterior, sorry. So 2 is the anterior pili of digastric.
Okay, so number 37 will be
Posterior pili. Posterior pili of digastric. لا, 48 is the posterior, sorry. 48 the
it's
posterior
right.
pili of
37 is the posterior belly of the gastric muscle.
Okay.
Number 8.
8 is the common carotid.
Number 11.
External carotid.
Number 1.
1. Spinal accessory nerve.
Number 16.
It's muscle. 16 is muscle.
No, it's a nerve.
Nerve?
Yes.
Okay. Yeah. 16 is the spinal accessory because it's moving on the trapezius. Trapezius. 16 is spinal accessory. 1 is not spinal accessory. 1 ورا sternomastoid. لا. spinal accessory. هو طلع منين؟ 1 is the facial. 16 is the spinal accessory. Okay. 1 facial, 16 spinal accessory.
Final answer?
Yes.
What are the boundaries of anterior and posterior triangles of the neck?
Anterior triangle. Yes. Anterior triangle, the posterior border, the anterior border of the anterior border of the sternomastoid. The superior is the lower border of the mandible. Anterior is the superior pili of omohyoid. Posterior triangle, the anterior border is the inferior border of the sternomastoid. The posterior is the anterior border of the trapezius, and the lower is the middle 1/3 of the clavicle.
Do you know the subdivisions of the anterior triangle?
It's divided into 3.5 triangles. Muscular triangle, digastric triangle, carotid triangle. Right? No.
Okay, what are the muscles that divide the anterior triangle of neck?
Omohyoid.
What else?
Omohyoid. Okay. Omohyoid and the digastric divided. No.
Okay. Interpret the microscopic findings of preauricular lymph node biopsy.
Okay, the pigmented cells is melanoma, so it's metastasis from a place which has pigmented cells, melanocytes.
What are the regions that might contain the primary lesion of malignant melanoma?
Skin.
Which skin? What are the regions or the
Okay.
areas?
Okay.
If
Face.
this is a preauricular lymph node biopsy, a microscopic picture.
Okay. From the face. So the sites drain to the preauricular lymph nodes, you mean?
Yes.
Okay. From the preauricular lymph nodes. من الإير والسفرة. ماشي. ارمي الأروما دي بتاخد منين من الفيس. Can we skip it to the end if you have time?
Okay. What is the nerve supply to posterior belly of the gastric?
Facial?
Regarding the great auricular nerve, what is the root value and what are the areas supplied by?
C2, no, C4 and C5 who supplies tragus and area over the mandible, the superior area over the mandible in front of the ear auricle, and the tragus, area over the mastoid process.
What else?
Supplies the angle of the mandible.
What else? Other than the angle of the mandible and the area in front of the tragus.
Parotid.
Okay, what else? Skip. Regarding external carotid artery, what is the course and nerve passing anterior to it? And what are the branches?
External carotid artery gives the cervical trunk. Cervical trunk. Skip.
Okay, time out.
Okay.
So thank you, Dr. Aya. The feedback will be provided to you soon.
Okay, thank you.
Now you can leave the meeting. Thank you. Good morning, Dr. Bishoy Raghib. Today we are going to conduct the anatomy mock exam for Dr. Bishoy. So Dr. Bishoy, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. 9 minutes started by now. Please identify structure number 2.
The arch of aorta.
Structure 4.
Right atrium.
Structure 5.
I don't know it.
Structure 6.
I don't know it also.
Structure 8.
Papillary muscles.
Structure 9.
So 9 will be the papillary muscles and 8 will be the tricuspid valve.
18.
The pulmonary artery.
19.
The left atrium.
21.
21, the papillary muscles for the left, the mitral valve.
20.
It is a valve for pulmonary artery.
How many cusps have the pulmonary valve?
3 cusps.
What is the vertebral level of the pulmonary valve?
T2.
What is the level of pulmonary
Sorry,
trunk?
T4. Okay. Pulmonary trunk.
What is the level of pulmonary trunk division?
T2. The pulmonary valve T4 and pulmonary trunk division T2.
Where to auscultate the pulmonary valve?
The left second intercostal space.
The second intercostal space, and where specifically in the second intercostal space?
Just lateral to the sternum.
What are the branches of ascending aorta?
Ascending aorta. The coronaries.
How many coronaries are there?
The right and left coronary.
Okay. What are the branches of pulmonary trunk?
Bronchial, and it ends by the right and left pulmonary arteries and bronchial arteries. And posterior intercostal, bronchials.
How many pulmonary veins are present?
They are 4 that ends into 2.
Please identify structure number 3.
Sympathetic chain.
Number 5.
The bronchi.
This is which bronchus? Number 5.
The left bronchus.
Structure 10.
Phrenic nerve.
Number 12.
I don't know it.
Number 14.
Recurrent laryngeal nerve.
What are the azygous vein tributaries?
It drains the left hemisthorax and mediastinum, but I don't know the tributaries.
Sorry?
I don't know the names of the tributaries, but it drains the left hemithorax and the mediastinum.
Okay, where preganglionic fibers of sympathetic trunk come from?
From from T1 to T12.
T1 to T12, what?
Sorry?
T1 to T12, what? Complete your answer.
And I'm not sure if it's from the anterior rami or not.
Okay, what connects the sympathetic trunk to the spinal nerves?
I don't know.
How sympathetic nerves leave the sympathetic chain?
Also, I don't know.
Okay, so that was the last question in this station. Would you like to move on to the next station?
Yes, please.
Where are the different parts of the brachial plexus found?
The roots rise from the C5, 6, 7, and T1 intervertebral foramina. The trunks are located in the posterior triangle. The divisions are behind the mid clavicle and the cords in the axilla, around the axillary artery.
Which part of the axillary artery?
The second and third part.
Okay,
Mainly.
show on this skeleton the roots of the brachial plexus.
B, C, D, E, and below E.
Describe and justify the clinical picture of Erb's palsy.
Erb's palsy leads to police mente position. There is C5 and 6 roots are affected. Or mainly the upper trunk is affected. So there is a loss of supination. So the forearm is pronated and loss of extension for the wrist. So the wrist is flexed, give the police mente position, and there is a sensory loss for the lateral aspect of the hand. Sorry, not the lateral aspect of the hand, the lateral aspect of the forearm.
So can you name the
arm.
muscles? Can you name the muscles that are affected or paralyzed, so that the arm is adducted and extended? What are the muscles that are affected?
Deltoid is affected. And for adduction, the deltoid is affected. Deltoid is responsible for abduction, so it's affected. For extension,
Only deltoid for abduction?
Deltoid is a mere abductor, but supraspinatus, it begins the abduction. Then deltoid from 15 to 90. Then the accessory muscles like serratus anterior and anterior minor.
So the supraspinatus and deltoid for abduction are paralyzed.
Yes.
So the arm would be abducted.
Yes.
And what else? Why would it be internally rotated? Should complete your answer.
Yes. For the extensor of the wrist, all the extensors in the forearm will be paralyzed. Extensors as extensor carpi radialis, palmaris longus, extensor digitorum, and digiti minimi. Muscles of the those are the extensors mainly.
Extensors of what?
For the wrist.
Okay, and the internal rotation of the arm and the flexors and supinators of the forearm.
The supinator is affected, brachyradialis.
Okay, would you like to skip to the next question for your time?
Okay.
In Erb's paralysis, what would be the impact of the reflexes?
C5 and 6, the biceps reflex and brachyradialis.
What is the action of brachyradialis muscle?
Slight flexion for the elbow and supination for the forearm.
Flexion of the elbow when the forearm is in which position?
In flexion position.
What are the muscles supplied by musculocutaneous nerve?
Musculocutaneous nerve, the brachialis, coracobrachialis, and the biceps. Brachial.
What is the sensory supply of the musculocutaneous nerve?
Musculocutaneous nerve supplies the lower part of the skin covering the deltoid. Sensory supply.
Skin covering deltoid?
The lower arm, lateral arm, lower lateral arm.
What is the sensory supply of the radial nerve?
Radial nerve supplies the posterior aspect of the forearm and supplies the dorsum of the hand till the middle phalanx.
What else?
The dorsum of the hand, the lateral 2/3.
Okay, what else as a sensory supply of radial nerve?
The lower lateral cutaneous nerve of forearm also, or of arm also.
Okay, please, what's structure number 3? Identify structure number 3.
It is the greater tuberosity.
What are the muscles attached?
Supraspinatus, infraspinatus, and teres minor.
Structure 8.
The lesser tuberosity.
What is the muscle attached?
Subscapularis.
Structure 6.
Bicipital groove.
What are the muscles attached?
Latissimus dorsi.
What else?
The long head of biceps passes in it.
What else as attachments?
No, I know only the latissimus dorsi.
Number 5.
The anatomical head of humerus.
Anatomical head.
Yes, anatomical head of humerus.
There's anatomical head and surgical head.
Yes.
Or only it's one head of the humerus.
Tanya neck. Okay, it's the head of humerus.
Structure 1.
Anatomical head, anatomical neck.
Structure 10.
Surgical neck and the two lips of the bicipital groove.
Okay, time out. So we move on to the next station. Please identify structure number 2.
The omohyoid. Digastric muscle.
Which part of the digastric?
Anterior belly of digastric muscle.
Structure 37.
Can you point on it?
This structure.
Yeah.
Did you see it?
Yes, I saw it. I don't know it.
If this is the anterior belly of digastric muscle, so
Yes.
what is this structure?
The posterior belly.
Okay. Structure 19.
Lingual nerve. Sorry, مش lingual nerve. Hypogastric nerve.
Hypogastric.
Yes.
You are in the head and neck.
No, I don't know it.
Do you know structure number 11?
Common carotid.
Structure
Artery.
8. Eleven is not the common carotid.
8 is a common carotid.
Okay, so 11.
External carotid.
Okay, there is a common nerve, or there's a nerve that passes anterior to the external carotid artery, which is this nerve, number 19. You know its name.
Glossus. I don't know it.
Okay. Structure 45.
Sternohyoid.
Structure 54.
Omohyoid.
Which part of the omohyoid?
The upper belly.
Okay. Structure 1. If you want me to skip a question, just say, just tell me.
Okay. Okay.
For your time. Structure 1.
Accessory spinal nerve.
Structure 16.
Can skip it.
Okay. What are the anterior and posterior triangles of the neck boundaries?
The anterior triangle laterally bounded by the sternomastoid, superiorly by the lower border of the mandible, and anterior by the midline. For the posterior triangle, anterior bounded by the sternomastoid, posterior by trapezius.
You should be more specific, Dr. Bishoy. What specifically in the sternomastoid and what specifically in the
Okay, anterior by the lateral border of sternomastoid.
Lateral border?
Posterior border of sternomastoid.
Okay.
Posteriorly, it's bounded by the anterior border of trapezius. Downwards, it's bounded by the upper border of clavicle, or upper surface of clavicle.
Which part in the clavicle?
Middle 2/3.
Okay. Do you know the subdivisions of the anterior triangle?
Yes, carotid triangle, the muscular triangle, and the digastric triangle, or carotid and muscular. There is a third triangle. I can't remember.
Do you know the muscles that divide the anterior triangle?
The digastric, the anterior belly of digastric.
What else?
And the omohyoid, the anterior belly of omohyoid, the upper belly of omohyoid.
Interpret the microscopic findings of preauricular lymph node biopsy.
I want to skip it.
What are the regions that drain the preauricular lymph nodes?
I want to skip it.
What is the nerve supply to posterior belly of the gastric muscle?
I can skip it.
Regarding great auricular nerve, what is the root value and the areas supplied by it?
Also skip it.
Regarding external carotid artery, what is the course and nerve passing anterior to it? And what are the branches?
The branches, superior thyroid, the posterior auricular and occipital, superior thyroid, lingual, the common facial, and superficial temporal and maxillary.
What else?
The ascending pharyngeal or pharyngeal.
Okay, time out.
Okay.
So thank you, Dr. Bishoy. Now we are done. The feedback will be provided to you soon. Thank you. Now you can leave the meeting.
Thank you.
Hello. Dr. Yes. Hello.
Hello, right now, I think you can hear me.
Yes, I can hear you now.
Assalamu alaikum wa rahmatullahi wa barakatuh.
So let's start. Are you ready?
إن شاء الله تعالى. ممكن أطلب من حضرتك شيء؟
تفضل.
أشكرك. هلا أنا صراحة بتشابترز بالاناتومي chapters I'm preparing everything other than the chest. فما بعرف is it obligatory to follow your selected stations?
Yes, it is. You can skip the question if you like.
Okay, it's okay. Let's try.
السؤال اللي ما تعرفوش او مش قادر تعرف اجابته ممكن تقول سكيب. تمام.
توكلنا على الله يا سيدي بنحاول.
Good evening, Dr. Iyas Zokaili. Today we are going to conduct the anatomy mock exam for Dr. Iyas. So Dr. Iyas, you have 3 stations. For each station you have 9 minutes. So let's start by the first station. 9 minutes started by now. Please identify structure number 2.
This is the ascending aorta.
4.
Sorry?
Number 4.
The aurcle of the right atrium.
Number 5.
The right atrium.
Number 6.
The number 6, skip.
Number 8.
The atrioventricular valve.
Which atrioventricular valve?
Tricuspid.
Number 9.
The phylum terminal. Muscles. Sorry.
What is the name of these muscles?
Skip.
Number 18.
Number 18 is the entry of the pulmonary veins.
So what is structure number 18?
Number 18. It is the number 18 pulmonary artery. The entry, this is pulmonary artery.
Number 19.
Number 19, the left atrium, or the auricle of the left atrium.
Okay, number 21.
21. This is the bicuspid valve.
Number 20.
Number 20, this is the mitral valve.
How many cusps have the pulmonary valve?
2 cusps.
What is the vertebral level of the pulmonary valve?
Vertebral level of the pulmonary valve. Skip. I don't know.
What is the level of the pulmonary trunk division?
Again, the question, please.
What is the level of the pulmonary trunk division?
Pulmonary trunk division, T4.
Where to auscultate the pulmonary valve?
Second intercostal space, parasternal line.
Right or left?
Left.
What are the branches of the ascending aorta?
The branches of ascending aorta is the brachiocephalic artery, the internal.
The ascending aorta, not the arch of the aorta.
The ascending aorta. The ascending aorta, the coronary arteries. Ascending aorta.
How many coronary arteries are there? What are the coronary arteries?
The coronary arteries are the left main coronary artery. The coronary artery. Skip.
What are the branches of the pulmonary trunk?
Pulmonary trunk. I think it's skip.
How many pulmonary veins are present?
4.
Please identify structure number 3.
Number 3.
Mm-hmm.
Sympathetic plexus.
So number 3 is a plexus.
I think yes. Sympathetic
Or a
plexus.
single.
Or a single
Plexus
nerve.
is a network of. Sorry. Number 3 is a single structure.
Single structure.
What is this structure?
And this is the phrenic nerve. I don't know actually.
Okay, number 5.
Number 5. This is the pulmonary trunk. This is the pulmonary trunk. Yes.
Number 10.
Number 10 is the azygous vein.
Number 12.
Number 12. I don't know.
Number 14.
Back to number 12. Maybe it's a phrenic nerve.
Which phrenic nerve?
Which phrenic nerve? The right side phrenic nerve.
What are the tributaries of the azygous vein?
Okay, the intercostal vein. The azygous vein tributaries. Hemiazygous vein. Intercostal veins from 8 the right side from 8 to 4 to 8 4 to 10 intercostal veins. Skip.
Where the preganglionic fibers of the sympathetic trunk come from?
Preganglionic fiber of the sympathetic trunk?
Yes.
Skip.
What connects the sympathetic trunk to the spinal nerves?
The ganglion.
And what else?
I don't know.
How sympathetic nerves leave the sympathetic chain?
I don't know.
So this was the last question in this station.
I told you I'm not prepared to
Okay.
the thoracic.
So would you like to move on to the next station, or would you like to recall any of the unanswered questions?
No, skip to the next station, please.
Okay. Where are the different parts of the brachial plexus found?
Where are they?
The different parts of the brachial plexus found.
Okay. The root of the brachial, we have the root of the brachial plexus and trunk and divisions and cords. Okay. The root of the brachial plexus comes from the anterior rami of the spinal cord from the C5, C6, C7, C8, and T1. It's emerged between the anterior and anterior scalenus and medial scalenus muscle. Okay. The division. The trunk is behind the middle girder of the clavicle. The divisions is related to the subclavian artery, and the cords roots and scalenus anterior medius muscle, divisions, cords. Okay, skip. Next,
show
please.
on this skeleton the roots of the brachial plexus.
Okay, so we have to identify the spinal nerve of C5. Okay, so because C1 is started from above the atlas.
What are the letters here that represent the roots of the brachial plexus? This is the question.
I'm sorry, the questions?
From A, B, C, D, and E. What are the letters that represent the roots of the brachial plexus?
Okay, C5, C6. Okay. Okay, so this is the E is the C7. So this is C6 and D is the C5. So D and E.
Describe and justify the clinical picture of Erb's palsy.
Okay. Erb's palsy is upper brachial plexus nerve injury, C5 and C6. The clinical picture is the adducted arm is related to the internal rotated contractures because of paralyzed the external rotators, which are the infraspinatus anterior minor muscle. The arm is adducted due to the paralysis of the supinator and the deltoid muscle, and is pronated due to the paralysis of the supinator and the biceps muscles as supinator, and the elbow is extended as well due to the paralysis of the biceps and the brachialis muscle, and the hand is flexed due to paralysis of the wrist extensors due to an opposed position of the wrist flexors.
Paralysis of extensor of wrist extensors. Which wrist extensor?
I'm sorry?
Which wrist extensor is paralyzed?
The wrist extensor is the extensor carpi radialis longus. And
okay, so this is the motor affection. Do you know the sensory affection?
Sure. The sensory affection is the loss of sensation over the C5, C6, which is the badge area over the deltoid muscles.
And what else?
The lateral aspect of the arm and the lateral aspect of the forearm.
In Erb's paralysis, what would be the impacted reflexes?
The brachioradialis and the biceps.
What is the action of brachioradialis muscle?
Brachioradialis is a weak flexors of the forearm. Its maximum action is for the flexion of the forearm in mid-pronation.
What are the muscles supplied by musculocutaneous nerve?
The muscle supplied by the musculocutaneous nerve is the biceps brachialis and the coracobrachialis.
What is the sensory supply of musculocutaneous nerve?
The sensory supply of the musculocutaneous nerve is the lower part of the posterior part of the arm. No, I'm sorry. This is the radial nerve. Okay, musculocutaneous nerve, lateral cutaneous nerve of the forearm. Lateral aspect of the forearm.
What is the sensory supply of the radial nerve?
The radial nerve sensory supply is we have branches here, posterior cutaneous nerve of the arm supplying the posterior aspect of the arm below the deltoid insertion. We have the posterior cutaneous nerve of the forearm. We have the supplying the posterior side of the forearm. We have the lateral cutaneous nerve of the arm, and we have also for the dorsum of the hand and the lateral 3.5 finger dorsally, sparing the distal interphalangeal joint and distal, which is supplied by the median nerve.
Identify structure number 3.
Number 3. That is the greater tuberosity of the humerus.
What are the muscles attached?
The supraspinatus muscle.
Only the supraspinatus.
And the infraspinatus as well. And the teres minor. No. Sorry. The supraspinatus, the greater tuberosity, the supraspinatus only, yes. Oh, sorry. Supraspinatus. No. I'm sorry. This is the greater tuberosity of the humerus. The muscle supply, the insertion supraspinatus, infraspinatus, teres minor.
Final answer.
The greater tuberosity of the humerus.
Okay, number 8.
Okay, number 8 is the lesser tuberosity of the humerus attached.
What are the muscles attached?
The subscapularis tendon, yes.
Number 6.
Where is 6, please? 6. This is the biceptal groove.
What are the muscles attached?
The muscle attached are the teres major, the pectoralis major, and the latissimus dorsi.
What are the structures passing through it?
The biceps tendon, or the long head of the biceps tendon.
Number 5.
This is the humeral head.
Number 1.
This is the surgical neck of the humerus.
Number 10.
Number 10. This is the anatomical neck.
Describe how to articulate humerus, radius, and ulna.
Okay. The humerus is it articulates with the ulna through the. I'm sorry, something. The message is coming out of the. Okay. The humerus is articulating with the ulna through the trochlea of the humerus, articulating with the trochlear notch of the ulna, and the olecranon process of the ulna articulating with the olecranon fossa of the humerus. The radius articulate with the ulna through the proximal radio-ulnar joint and articulate with the humerus through the capitulum.
What is the bony prominence that extensor pollicis longus tendon wraps around?
Lister tubercle.
Okay, so that was the last question in this patient. Time out, so we will move on to the next patient. Okay, 9 minutes started by now. Please identify structure number 2.
Can you please, because there is a lot of numbers, can you move your precursors to
this structure?
Okay, this is the anterior belly of the digastric muscle.
37.
Posterior belly of the digastric.
Number 19.
19. This is the hypoglossal nerve.
Number 45.
45. This is the sternohyoid.
54.
This is the omohyoid.
Which part or which belly of the omohyoid?
Superior, the superior part of it.
Number 8.
This is the common carotid artery.
Number 11.
Internal carotid artery. Oh, sorry, external carotid artery.
Number 1.
This is the accessory nerve. Spinal accessory nerve. This is the great auricular nerve.
Okay. What are the anterior and posterior triangles of the neck boundaries?
Okay, the anterior triangle of the neck is the anterior part is the midline, and the posterior and the base is the angle of the mandible, and the posterior part is the anterior margin of the sternocleidomastoid muscles. The posterior triangle is the anterior part is the posterior border of the sternocleidomastoid. The anterior border of the the anterior border of the triangle is the posterior border of the sternocleidomastoid. The posterior border is the anterior border of the trapezius, and the base is the middle third of the clavicle.
Do you know the subdivisions of the anterior triangle?
Yes, we have 3.5 triangles: the muscular triangle, the carotid triangle, submental triangle, and submandibular triangle.
And what are the muscles dividing these triangles?
It's divided by the anterior and posterior belly of the digastric and the omohyoid.
Okay. Interpret the microscopic findings of this auricular lymph node biopsy.
Okay, I can see some pigmented cells scattered in this biopsy, and this is might represent a metastatic melanoma, lymph node melanoma.
What are the regions that might contain the primary lesion of melanoma? In this case,
what is the lymph node periauricular?
Mm-hmm. Yes.
Okay, it might be the any site that may be drained by the periauricular lymph nodes.
This is the question.
Oh, so this is
What is the answer?
Okay, you need the question of the periauricular lymph node drainage, the angle of the mandible, the skin over the angle of the mandible, the skin over the posterior, the mid half of the auricle. No, this is, I think, this is nerve supply, not lymphatic drainage. Can you skip this question, please?
Okay, what is the nerve supply to posterior belly of digastric?
Posterior belly of digastric nerve supply. Skip.
Regarding the great auricular nerve, what is the root value and the area supplied by it?
The root value is C2, C3. The area supplied by it is the angle of the mandible and over the parotid gland, the skin over the parotid gland, and half of the auricle.
Regarding external carotid artery, what is the course and what is the nerve that passes anterior to it?
Regarding the nerve is the hypoglossal nerve. The course of the common carotid artery is it's divided as it's entered the neck. It's divided into the internal and external carotid artery at the level of the thyroid cartilage, and it enters common carotid artery. You mean the common carotid or the internal carotid?
The external carotid artery.
The external carotid artery. Okay. The external carotid artery is a branch of the common carotid artery at the angle of the mandible. It travels through the parotid canal and gives its branches to it until it gives its terminal branch, which is the maxillary and superficial temporal.
What are the branches?
The branches of the external carotid artery are superior thyroid artery, ascending pharyngeal artery, the ascending pharyngeal artery, the lingual artery, the maxillary artery, the superficial temporal, the auricular, and the occipital, and the facial as well.
Where is the carotid body and what is its function?
The carotid body is at the bifurcation of the common carotid artery to internal and external. It has the chemoreceptors that is sensitive to the pH.
Where is the carotid sinus and what is its function?
The carotid sinus is in the internal carotid artery just after the bifurcation just after its bifurcation from the common carotid artery. It's a little bit posterior dilation of the internal carotid artery, and it is sensitive to the blood pressure.
What is the facial artery palpation surface marking, and what is the effect of unilateral ligation?
Okay, the facial artery palpation, it can be at just angle of the mandible just anterior to the masseter muscle, at the mandible just anterior to the masseter muscle. Its ligation is eventless because it has tributaries and collaterals from the other side.
Okay, so that was the last question in this station, and we still have 1 more minute. So would you like to recall any of the unanswered questions in this station?
Would you remind me?
The areas drained by preauricular lymph node, or the nerve supply to posterior belly of digastric?
The posterior belly of digastric, actually, I don't know the nerve supply, but about the auricular lymph node drainage. Auricular lymph node drainage.
Preauricular lymph node.
Preauricular lymph node drainage. No, actually, I can't recall it, unfortunately.
Okay, so are we done?
Thank you so much.
Thank you, Dr. Yes, and the feedback will be provided to you soon.
Thank you so much. Appreciate it. Thank you. Bye-bye.
Thank you. Bye-bye.
Bye-bye.
Good evening, Dr. Inji Tolis. Now, today we are going to conduct the anatomy of exam for Dr. Inji. So, Dr. Inji, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. 9 minutes started by now. Please identify structure number 2.
This is pulmonary trunk.
Number 4.
Right auricle.
Number 5.
Right atrium.
6.
This is aortic valve.
8.
AV tricuspid valve.
9.
Anterior papillary muscle.
18.
Pulmonary trunk.
19.
Left auricle.
21.
What's the number again?
21.
Okay. Papillary muscles and chordae tendineae.
Number 20.
Pulmonary valve.
Okay, how many cusps have the pulmonary valve?
3 cusps.
What is the vertebral level of the pulmonary valve?
T6.
What is the level of pulmonary trunk division?
T5.
Where to auscultate the pulmonary valve?
At the left second intercostal space at the parasternal line.
What are the branches of ascending aorta?
Right and left pulmonary arteries.
What are the branches of pulmonary trunk?
Right and left pulmonary arteries.
How many pulmonary veins are present?
4 pulmonary veins.
Please identify structure number 3.
This is another spot, all right?
Sorry?
This is another spot, another exam.
No, it's the same station.
Same station? Sympathetic chain.
Number 5.
Right main bronchus.
10.
Azygos vein.
12.
Greater splanchnic nerve.
14.
right brain.
What are the tributaries of azygous vein?
They are pericardial veins, vein, intercostal vein, hemiazygous and accessory azygous veins, and bronchial veins.
What else?
Did I mention esophageal?
Okay. Where the preganglionic fibers of sympathetic trunk come from?
T8 to L1.
T8 to L1?
Yeah.
Okay, what connects the sympathetic trunk to the spinal nerves?
Gray, just a second. Gray and white ramus.
What else?
Spinal nerves.
What connects the sympathetic trunk to the spinal nerves?
Okay. Can I pause this question?
Okay, how the sympathetic nerves leave the sympathetic chain?
Through plexuses around the artery and through spinal nerves.
Plexus around the which arteries? Around the blood vessels and what else?
Like internal carotid artery. You need the names of vessel.
Okay, it's enough. So you still have time. Would you like to recall what connects the sympathetic trunk to the spinal nerves?
Can't remember.
So you like to move on to the next station?
Yeah.
Okay. So we'll start the 9 minutes. Where are the different parts of brachial plexus found?
I didn't hear. I didn't hear the question.
Where are the different parts of brachial plexus found?
On this photo, I have to.
In general.
Between anterior and you need to search
The roots, trunks, divisions, and cords. Each one of these. Where are they found?
The roots from C5 to C1. The anatomy is.
What are their relations? The relations of the roots. From where they exit. And what are the relations, anterior relations, posterior relations?
They are anterior to scanless medius and posterior to scanless anterior. They derive from the spinal roots from it is a plexus from C5 to C1.
Okay, and the trunks?
Then the superior two roots form the upper trunk. Then the middle trunk, it is from the C7. Then lower two roots convert.
Your voice is not so clear, Dr. Inji.
Okay. So the upper two roots converge to form the upper trunk. The middle trunk is formed from the C7. Then the lower two roots converge to form
The question is where to find the different parts of the brachial plexus. You said the roots are between the scanless anterior and medius.
Yes.
The trunks, where to find?
Can I pause this question?
Okay. On this skeleton, can you show the roots of the brachial plexus?
Okay. So I have to identify the letters.
Sorry?
I have to identify the letters. What letter is denoting?
Yes. Which letter indicates the place of the brachial plexus roots?
So E is C7, D is C6, C is C5. So this is the letters of brachial plexus. C, D,
So what is your answer?
C, D, and E.
Describe and justify the clinical picture of Erb's palsy.
Okay, the arm would be internally rotated, extended, and pronated with wrist in flexion. So the internal rotation would be because the paralysis of the external rotators of the rotator cuff. The extension would be due to paralysis of the flexors. Flexors of the forearm, like biceps and brachialis. Coordination, that was paralysis of the spinatus. And there would be a sensory loss at the radial side of the forearm and arm. This is all because the affection of the C5 and C6 roots. So the muscles of rotator cuff, that is supraspinatus and will be affected. So arm would be internally rotated, and all muscles supplied by musculocutaneous structures like biceps, brachialis would be affected. So the arm would be extended, and spinatus also would be affected. So it would be donated.
In Erb's paralysis, what would be the impacted reflexes?
What would be what?
The impacted reflexes in Erb's paralysis.
Okay, biceps and brachioradialis. C5.
What is the action of brachioradialis muscle?
And it is the weak flexor of the forearm, but it is its maximum function when the hand or when the forearm is in mid pronation. It would be
What are the muscles supplied by musculocutaneous nerve?
biceps, brachialis, and thoracic.
What is the sensory supply of the musculocutaneous nerve?
Lateral side of the forearm.
What are the sensory supply of the radial nerve?
So the posterior part of the forearm, part of the arm, and posterior lateral 2/3 of the bottom of the hand, and 3.5 lateral 3.5 fingers, except the lateral or the last discipline.
Can you raise your voice a little bit, Dr. Inji? Your voice is not so clear.
Okay. Again, it will innervate the posterior surface of the forearm and the posterior surface of the arm, and the posterior surface of lateral part of the hand, and okay, lateral 2/3 of the dorsal hand, and lateral 3.5 fingers, except distal pelvis.
Please identify structure number 3.
Greater fibers.
What are the muscles attached?
Rotator cuff muscle, supraspinatus, infraspinatus, and tibial spine.
Structure number 8.
Lesser tuberous.
Muscles attached.
Subscapular.
Number 6.
Occipital bone.
Muscles attached.
Teres major. No, sorry. That is not the point.
What else?
There is the tendon of biceps.
What else has muscle attachments to the bicipital groove?
Okay, the lateral lip, there is the teres major, and the medial lip, there is the abductor major.
Number 5.
One. This is the head of him.
Number 1. Okay, time out.
Okay.
So we move on to next station. Please identify structure number 2.
Can't find it.
This structure.
Okay. The gastric muscle.
Which part of the
anterior belly of the gastric muscle.
Okay. Structure 37.
Posterior belly of the gastric muscle.
19.
19. Facial artery.
45.
45. Okay. Sternocleidoid muscle.
54.
Superior belly of omohyoid.
Number 8.
Internal, common carotid artery.
11.
External carotid artery.
1.
Where it is? Okay. Spinal accessory nerve.
16.
Greater auricular nerve.
What are the boundaries of the anterior and posterior triangles of the neck?
Well, anterior triangle, medially it is bounded by midline of the neck. Superiorly it is bounded by the mandible. Laterally it is bounded by anterior surface of sternomastoides. Posterior triangle. Anteriorly it is bounded by posterior surface of sternomastoid muscle. Posteriorly it is bounded by anterior border of trapezius muscle. And inferiorly it is bounded by middle third of clavicle.
Do you know any subdivisions of the anterior triangle?
Yeah, it is 4 divisions. Submental, half of submental triangle, submandibular, muscular, and carotid.
Okay. Interpret the microscopic findings of preauricular lymph node biopsy.
So it is pigmented melanin cells from melanoma.
What are the regions that might contain the primary lesion of melanoma? What are the areas drained by preauricular lymph nodes that might have the primary lesion?
It is lower half of the face and gums. And
What else?
temporalis muscle.
Sorry?
Muscles of the face.
Can you raise your voice a little bit, Dr. Inji?
Okay, I mean muscles of the face.
Muscles of the face?
Yeah, skin and muscles of the face are drained by preauricular lymph node. And gums and temporal region.
Okay, what is the nerve supply to posterior belly of the gastric?
Facial nerve.
Regarding the great auricular nerve, what is the root value and the areas supplied by?
It is C2 and C3. It supplies the angle of mandible. Lower half of the air loop.
Lower half of what?
Air lobule.
Okay, and what else?
Parotid gland.
Regarding external, sorry?
Over carotid gland.
Okay. Regarding external carotid artery, what is the course nerve passing anterior to it and branches?
What is the course of what?
External carotid artery.
Yeah. You need the course of external carotid artery?
The course and branches and nerve related to it, nerve anterior, nerve passing anterior to it.
Nerve related to it is the hypoglossal nerve. External carotid, it is started at the upper border of silent cartilage and giving branches okay, the terminal two divisions are the maxillary artery and superficial temporal artery. There is other arteries like pharyngeal, lacrimal, facial. No, it is not facial.
Can you raise your voice a little bit, Dr. Inji?
Oh, okay. There are a lot of divisions. It is divided. Okay, it is beginning at the upper border of thyroid cartilage. Then it moves upwards, and then divides at the parotid gland. Two terminal branches, maxillary artery and superficial temporal artery. Other branches.
Okay, what are the branches?
Ascending pharyngeal, lacrimal, occipital, Can I pass this question?
Where is the carotid body and what is its function?
The carotid body found at the posterior surface of common carotid artery, and it is sensitive to the pH change.
It is what? I can't hear you.
It is sensitive to the change of pH.
Okay, so where is the carotid sinus and what is its function?
Carotid sinus found at the posterior border of internal carotid artery. And it is sensitive to the changes of blood pressure due to presence of pulse.
Okay, time out. So thank you, Dr. Inji. Now we are done and the feedback will be provided to you soon. Thank you. Now you can leave the meeting. Good evening, Dr. Gaurav Ranglani. And now today we are going to conduct the anatomy mock exam for Dr. Gaurav.
Yes,
Dr.
sir.
Gaurav, you have 3 stations and for each station you have 9 minutes.
Yes, sir.
So let's start by now, the first 9 minutes. Please identify structure number 2.
Sir, I can't see the screen, sir.
Sorry?
I'm not able to see the screen, sir.
You
Hello?
cannot see the screen?
Yes, sir. It is visible now. So, can you repeat the question, sir, again?
Identify structure number 2, please.
Sir, it is superior vena cava.
Structure number 4.
Right auricle.
Number 5.
I'd like to pass this question, sir. and I would like to come back.
Number 6.
6 is myocardium of left ventricle.
Structure number 6.
Myocardium, sir.
Number 8.
This is the tricuspid valve.
Number 9.
This is papillary muscles anchoring the caudate tendinite.
Number 18.
Pulmonary trunk.
Number 19.
Left atrium, sir.
Number 24.
Septum. Interventricular septum.
23.
Again, papillary muscles.
Okay. How many cusps have the pulmonary valve?
Pulmonary valve has 3 cusps, sir.
What is the vertebral level of the pulmonary valve?
What is the vertebral level?
Vertebral level of the pulmonary valve.
T10, sir.
Sorry?
T10.
T10. What is the level of the pulmonary trunk division?
It's a trunk. Okay, so trunk division is at angle of Lewis, so it has to be T2.
Where to auscultate pulmonary valve?
On the left second intercostal space.
Left what?
Second intercostal space on the left side, parasternal region.
Okay, what are the branches of the ascending aorta?
So ascending aorta has 3 branches. Ascending aorta has no branches.
Ascending aorta has no branches?
Arch of aorta has 3 branches. Ascending aorta has gives branch. Ascending aorta has no branches. Sir.
Has no branches. Okay, what are the branches of the pulmonary trunk?
Pulmonary trunk gives right and left pulmonary vein.
Right and left pulmonary vein?
Yes, sir.
How many pulmonary veins are present?
Total 2 pulmonary veins are present, sir.
2?
Yes,
Your
sir.
answer is 2, Dr. Gurav?
The total 4 pulmonary arteries are present, sir.
How many pulmonary veins are there?
2.
Okay, please identify structure number 3.
Structure number 3 is sympathetic trunk, sir.
Sympathetic? What?
Trunk. Sympathetic trunk.
Okay, structure number 5.
Structure number 5. So this is pulmonary trunk, sir.
Number 10.
I don't know, sir. I would like to pass this one.
12.
Well, I don't know, sir. I would like to pass this one.
14.
Okay. 14 is oblique sinus, sir.
Fourteen is a nerve.
Okay, sir, phrenic nerve.
Okay. Which phrenic nerve?
This looks like left phrenic nerve, sir.
Left.
Oh, sorry, right phrenic nerve, sir.
Okay. What are the azygous vein tributaries?
So, sir, azygous vein. First is hemiazygous vein. Then hemiazygous vein. Upper 7 intercostal veins. That's all, sir.
Upper 7 intercostal veins. Okay, what else?
I don't know, sir.
Okay, would you like to skip?
Yes, sir, I would like to skip this.
Where the preganglionic fibers come from?
Preganglionic fibers come from anterior ramus of white rami communicans.
Sorry, where do they come from?
White rami communicans, sir.
What connects the preganglionic fibers to the spinal nerves?
Anterior ramus of the anterior division of the anterior spinal nerve.
How sympathetic nerves leave the sympathetic chain?
By postganglionic fiber via gray rami communicans.
Postganglionic fibers and what?
Gray rami communicans.
Okay, time up. So we move on to next station. Where are the different parts of the brachial plexus found? Roots, trunks, divisions, and cords.
Yes, sir. So, what is the question, sir?
Where are the different parts of the brachial plexus found?
So, roots are present. Roots, trunks are supraclavicular. Division and cords and division. These are infraclavicular. The roots are present. The trunk is present between scalenus anterior and medius, and roots are present adjacent to the transverse process. Then the division, the cords are present with respect to third part of the axillary artery, second part of the axillary artery, and the divisions are present in the arms, sir.
Divisions are present where?
After the third part of axillary artery, sir.
Okay, show on the skeleton roots of the brachial plexus. On this skeleton.
Okay, sir. So
where would be the
the
roots of the brachial plexus?
they're coming from the AB brachial plexus, no, sir? So this is first, second, third, fourth, fifth. So it is going to come from D and E, sir. From C5, C6, C7, C8, and T1. So I can see C5 foramen, intervertebral foramen, and C5, 6 intervertebral foramen. So C5 and C6 root will be visible in this image, sir.
Where on this skeleton?
D and E, sir.
B and E?
Yes, sir.
Describe and justify the clinical picture of Erb's palsy.
So Erb's palsy is a palsy due to injury at Erb's point, which is a confluence of 6 important nerves, that is C5, C6 nerve root, then nerve to subclavius, nerve to suprascapular nerve, and the divisions, anterior and posterior divisions. So total 6 nerves are affected due to Erb's point, sir. It's a confluence, and if Erb's point palsy is there, then the attitude of limb becomes adduction, adducted, and adducted, internally rotated at shoulder, extended at elbow, and flexed at wrist, and pronated.
And what else?
And fingers flexor.
These are the motor affections.
Yes,
Do
sir.
you know
And
any
sensory.
affections?
Yes, the sensory will be loss of sensation on the upper lateral aspect of the arm, sir, at the regimental patch area due to axillary nerve.
Only in the arm?
And on the lateral aspect of the forearm, sir.
In Erb's paralysis, what would be the impacted reflexes?
Brachioradialis reflex will be gone, sir.
And what else?
And sir, biceps reflexes will also be gone, sir.
What's the action of brachioradialis muscle?
So brachioradialis is the prime supinator of the prime flexor of the elbow joint, sir. Brachioradialis or brachialis, sir?
Brachioradialis.
Brachioradialis, sir. So brachioradialis is the prime flexor of the elbow joint. No, sir. I apologize, sir. I want to correct myself. The brachioradialis is an important lateral flexor of the wrist.
What are the muscles supplied by musculocutaneous nerve?
It supplies brachialis, biceps brachii. These two muscles, sir.
Only brachialis and biceps.
Biceps.
What else other than brachialis and biceps supplied by musculocutaneous nerve?
Biceps. These two, sir, only.
What is the sensory supply of the musculocutaneous nerve?
Musculocutaneous nerve becomes the lateral cutaneous nerve of forearm.
What is the sensory?
Yes, sir.
What is the sensory supply of the radial nerve?
So radial nerve supplies the posterior aspect of arm, posterior aspect of forearm, and wrist, excluding the terminal portion of the phalanx and the medial half of the arm, medial half of the wrist and fingers.
The medial half.
Excluding the medial half, the lateral half, excluding the tip of the fingers and thumb. Lateral 3.5 digits.
Identify structure number 3, please.
So this is greater tuberosity, sir.
And what are the muscles attached?
Supraspinatus, infraspinatus, teres minor.
Structure number 8.
Lesser tuberosity.
What are the muscles attached?
Subscapularis.
6.
Bicipital groove, latissimus dorsi. And content is sheath of tendon of biceps brachii with sheath of biceps brachii, along with ascending branch of anterior circumflex artery.
What are the muscles attached in the bicipital groove other than the latissimus dorsi?
In lateral lip, pectoralis major. In medial lip, teres major. And in bicipital groove, latissimus dorsi.
Structure number 5.
Structure number 5 is humerus head, sir.
1.
1 is anatomical neck of humerus head.
Structure number 10.
Surgical neck of humerus.
Describe how to articulate humerus, radius, and ulna.
So humerus articulates with radius and ulna via trochlear notch. It articulates with ulna. With radius, it articulates with capitulum.
Sorry?
With radius, it articulates with the help of capitulum, capitulo-radiocapitular joint, and, with ulna, it articulates with trochlea.
And what else?
With olecranon fossa, sir. Of ulna, the trochlea of humerus articulates.
What is the bony prominence that extensor pollicis longus tendon wraps around?
So, pardon, sir?
What is the bony prominence that extensor pollicis longus tendon wraps around?
Extensor pollicis longus.
Okay,
lateral condyle, sir.
Time out. So we'll move on to next station.
Yes, sir.
Please identify structure number 2.
Sir, I can't see 2, sir. Structure number 2. It is anterior belly of digastric.
Number 37.
Posterior belly of digastric, sir.
Number 19.
I want to skip this one, sir.
Number 45.
Where is 45, sir?
Here it is.
Okay. So this is sternothyroid.
Sternothyroid?
Sternohyoid, sir. Sternohyoid.
Okay, and 54?
This is sternothyroid.
54 is sternothyroid?
No, sir. This is omohyoid, sir.
Which belly?
Superior belly of omohyoid.
Okay, number 8.
Number 8 is looking like artery to me, so it is common carotid artery, sir.
Number 11.
This is also common carotid artery, sir. No, number 11 is external carotid artery, sir.
Okay, number 1.
Number 1. This is greater auricular nerve.
And number 16.
Number 16 is skip, sir.
What are the boundaries of the anterior and posterior triangles of the neck?
Posterior triangle, the anterior boundary is posterior border of sternocleidomastoid. Posterior boundary is by posterior border is by anterior border of the trapezius, and inferiorly the clavicle forms the inferior boundary of the triangle. Anterior triangle, there are multiple triangles, sir. So all the anterior triangles are present anterior to the anterior border of sternocleidomastoid, sir, till mandible, angle of the mandible and jaw. Should I tell all the triangles, sir? Digastric, carotid, muscular, and submental triangles, sir. Boundaries, sir. So, digastric triangle is bound by lower border of mandible, anterior belly of digastric, and posterior belly of digastric. Carotid triangle is bound by posterior belly of digastric, anterior border of the sternocleidomastoid, and posterior border of superior belly of omohyoid, sir. Then superior belly of omohyoid, between two superior belly of omohyoid, there is muscular triangle, sir. And submental triangle is present between two belly of anterior belly of digastric. So that is a half triangle.
What are the boundaries of the posterior triangle of the neck?
Sir, I told, sir, posterior triangle is bound by posterior border of the sternocleidomastoid, sir, and anterior border of trapezius, and inferiorly by clavicle.
Which part of the clavicle?
So middle third, sir.
Interpret the microscopic findings of the preauricular lymph node biopsy.
Preauricular lymph node. Skip, sir.
Okay, what are the regions drained or areas drained by the preauricular lymph node?
Preauricular lymph node, sir. Anterior, the area anterior to the triggers, and upper part of the posterior triangle, and anterior half of the external ear.
What is the nerve supply to the posterior belly of digastric muscle?
So posterior belly of digastric, the nerve supply is glossopharyngeal. No. Okay. Facial nerve, sir.
What is the root value of the greater auricular nerve, and what
C2,
are the
C3.
areas supplied by it?
Angle of the mandible over the parotid region, sir.
And what is the root value?
C2, C3.
And where else areas supplied by great auricular nerve?
So over the parotid region and ankle of mandible.
Where else?
And posterior border of the ramus of mandible, sir.
Regarding the external carotid artery, what is the course and the nerve anterior to it?
The nerve.
Describe the course of the external carotid artery and the nerve passing anterior to it.
So at the lower border of C4 vertebra, external carotid emerges from the common carotid artery inside the carotid sheath. From up, it ascends upward, and the nerve which is related anterior to it is phrenic nerve. The nerve which is related posterior to it is vagus nerve, and even posterior to that is sympathetic trunk. And it ascends in carotid triangle, and at the upper half of the carotid triangle, it originates from common carotid artery.
And how it's describe its termination?
So it terminates with two terminal branches, that is superficial temporal and maxillary artery.
What are the branches of the external carotid artery?
So medial branch is ascending pharyngeal artery. The anterior branch is superior thyroid artery. And then posterior branches occipital and posterior auricular artery. And this is all I remember, sir, right now.
Where is the carotid body and what is its function?
So carotid body is located at the just proximal to the division of external carotid artery into external and just before the division of common carotid artery into external and internal carotid artery. So carotid body, the function of carotid body, it is located at the level of C6 vertebra and C5 vertebra, and the function is in BP blood pressure regulation, sir. Short-term regulation of blood pressure.
Okay, time out. So now we are done. Thank you, Dr. Gorab. And the feedback will be provided to you soon. Now you can leave the meeting. Thank you.
Okay, thank you.
Good morning, Dr. Gorab Ranglain. Today we are going to conduct an anatomy mock exam for Dr. Gorab. So Dr. Gorab, you have 3 stations, and for each station you have 9 minutes. 9 minutes started by now. Please identify structure number 2.
Structure number 2. The superior vena cava, sir.
4.
Right atrium. Right auricle.
5.
Right atrium.
6.
This is aortic valve.
8.
Tricuspid valve.
9.
Anterior papillary muscles.
18.
Pulmonary trunk.
19.
Left auricle.
21.
Papillary muscle with chordate tendon.
20.
एक बार phone उठा. Can you sir give me 1 minute sir? ये बोला टेस्ट चालू है मेरा.
Sorry?
Hello.
Yes.
Sir, which number sir?
20.
20. टेस्ट चालू है बताना. 20 is pulmonary valve sir.
How many cusps have the pulmonary valve?
Pulmonary valve has 3 cusps sir.
What is the vertebral level of pulmonary valve?
T6 sir.
What is the level of pulmonary trunk division?
T5 sir.
Where to auscultate the pulmonary valve?
Left parasternal region at second intercostal space.
What are the branches of the ascending aorta?
Ascending aorta. It gives coronary arteries, right and left coronary arteries.
What are the branches of pulmonary trunk?
Right and left pulmonary artery.
How many pulmonary veins are present?
Total 4 veins are present which drain into left atrium.
Identify structure 3.
Which structure, sir?
3.
3. So this is sympathetic trunk.
5.
5. I want to skip this question.
10.
10th. 10th looks like azygous vein, sir.
12.
12th is going to it's splanchnic nerve.
14.
14. Phrenic nerve, sir.
Which phrenic nerve?
Right phrenic nerve, sir.
And number 12, which splanchnic nerve?
Greater splanchnic nerve, sir.
What are the azygous vein tributaries?
Where azygous vein tributaries are hemiazygous vein, then intercostal veins, the right side superior intercostal vein, then accessory hemiazygous, then mediastinal veins, bronchial veins, esophageal veins, sir.
What
and
else?
Intercostal veins, sir. Posterior intercostal veins.
Okay, where preganglionic fibers of the sympathetic trunk come from?
Preganglionic fibers of sympathetic trunk. They come from their corresponding spinal nerve, sir.
At which levels?
So first thoracic vertebra to first thoracic nerve to second lumbar nerve. T1 to L2.
Okay. What connects the sympathetic trunk to the spinal nerves?
Sympathetic trunk to spinal nerve. To spinal nerve. White ramus communicants, sir, plus gray ramus communicants.
What else?
Ganglion.
Okay. How sympathetic nerves leave the sympathetic chain?
Sympathetic trunk. Sympathetic nerves. Sympathetic nerves leave the sympathetic chain through I would like to skip this question, sir.
Okay, so that was the last question in this station. So would you like to move on to the next station? Or would you like to answer the unanswered questions? Number 5.
Yes, sir, I would like. So number 5 is it, sir, bronchus? Sir, hello. So this looks like right bronchus, sir.
Okay, and number 10.
Number 10. Number 10, I told, no, sir, azygous vein.
Okay. So would you like to move on to the next station?
Yes, sir.
Where are the different parts of brachial plexus found?
Brachial plexus. So the roots and trunks, they are present supraclavicular, and what do you call it? Division cords and division, they are infraclavicular.
What are they related to? And the roots and the trunks?
Sir, can you repeat, sir?
Where are the different parts of the brachial plexus found? Roots, trunks, divisions, and cords.
So, so the trunks of brachial plexus, they are present between scalenus anterior and scalenus medius, and cords and division, they are present around the second and third part of axillary artery, respectively.
Okay, show on the skeleton the roots of the brachial plexus.
Roots of the brachial plexus, sir. So they emerge from C, D, and E, sir.
Describe and justify the clinical picture of Erb's palsy.
So Erb's palsy is due to injury at Erb's point, and due to injury at Erb's point, the deltoid palsy is there, because of which the arm is adducted. There is a palsy of external rotators. So because of that, the arm position is in internal rotation. Then elbow position is fully extended because the flexors are paralyzed. Then the forearm is pronated, wrist is flexed, and fingers are flexed, sir.
Can you explain more?
More
And
about
what is the
Erb's
sensory
palsy.
affection? And what are the
Sensory,
nerve roots affected?
so sensory affection is to the radial side of arm and forearm. This part sensation is gone.
The damage is to what nerve roots? Which nerve roots?
Sir, so basically the upper nerve roots are gone, C5 and C6, sir.
Okay, in Erb's paralysis, what would be the impacted reflexes?
Impact of?
The impacted reflexes.
The reflex. Hello?
The impacted
sir?
reflexes.
So the brachioradialis reflex is gone, sir. And biceps reflex is gone. These two reflexes are gone.
What is the action of brachioradialis muscle?
Brachioradialis muscle. It is a weak flexor of forearm, sir. And also when the forearm is mid-pronated, that time it acts maximally in this
What
position.
are the muscles supplied by musculocutaneous nerve?
Musculocutaneous nerve. So biceps brachii, brachialis, and coracobrachialis, sir.
What is the sensory supply of musculocutaneous nerve?
Lateral cutaneous, it becomes lateral cutaneous nerve of forearm after emerging from the on the lateral aspect of the
What is the sensory
elbow.
supply of the radial nerve?
So radial nerve supplies the lower lateral cutaneous nerve of arm, the lower lateral cutaneous nerve, posterior cutaneous nerve of forearm, then posterior cutaneous nerve of arm also, and posterior part of the hand, in which lateral 3.5 digits are supplied by radial nerve except the tip of the fingers and thumb.
Identify structure number 3.
Structure number 3 is greater tuberosity.
And what are the muscles attached?
Supraspinatus, infraspinatus, and teres minor.
Structure 8.
Structure 8 is lesser tuberosity.
Muscles attached.
Subscapularis.
Structure 6.
Bicipital groove.
Muscles attached.
On lateral lip, pectoralis major. On medial lip, teres major. And on the floor, latissimus dorsi.
And what is the structure passing through it?
Tendon of biceps brachii along with the sheath and ascending branch of anterior circumflex humeral artery. Structure number 5. Humerus head, sir.
1.
1 is anatomical neck of humerus.
10.
Surgical neck of humerus.
Describe how to articulate humerus, radius, and ulna.
Humerus, radius, and ulna. So, humerus articulates with ulna via trochlear notch, and it articulates with olecranon fossa of the ulna, olecranon process of the ulna with the trochlea. Then, with radius, radial head articulates with the capitulum.
What is the bony prominence that extensor pollicis longus tendon wraps around?
Extensor pollicis longus tendon. The pollicis longus tendon. Lister's tubercle, sir.
Okay, so that was last question. And move on to the next patient. Please identify structure number 2.
So number 2, I can't see, sir. Number 2.
This structure.
Anterior belly of digastric.
Structure 37.
Posterior belly of digastric.
19.
19 is 19. I would like to skip this question.
45.
45. 45 is sternohyoid.
54.
54. Where is 54? Oh, so it is it is superior belly of omohyoid.
Number 8.
Number 8. These are 8 is number 8 is common carotid artery, sir.
11.
11 is carotid bulb.
Number 11. Structure 11. This structure.
External carotid artery, sir.
Number 1.
Number 1. Where is number 1, sir?
This structure.
Greater auricular nerve.
Number 16.
Number 16. This is I would like to skip this one, sir.
Okay, what are the boundaries of the anterior and posterior triangles of the neck?
Anterior and posterior triangles of neck. So the posterior triangle of neck, the anterior border is formed by posterior border of trapezius, and posterior border is formed by anterior border of the sorry sir, I want to correct myself. So anterior border is formed by posterior border of sternocleidomastoid, and posterior border is formed by anterior border of trapezius, and the the lower border is formed by the clavicle, middle third of the clavicle.
Okay, and the anterior triangle?
Anterior triangle is present anterior to the sternocleidomastoid, sir. Anterior to anterior border of the sternocleidomastoid, sir.
What is the boundaries of the anterior
ये एक बार
triangle of the neck?
ये फोन लेना, ये बोलना उनको कि टेस्ट चालू है. Sorry, sir. Sorry for the disruption, sir. So can you repeat the question, sir?
What are the boundaries of the anterior triangle of the neck?
So anterior triangle is present anterior to the sternocleidomastoid, anterior border of the sternocleidomastoid, and
this is which boundary?
This is the posterior border of the anterior triangle, sir.
Okay, and the anterior boundary?
So the anterior boundary of anterior triangle is in the midline, sir.
Okay, and then?
And
Will you
the
answer the
superior border
question?
is superior
Or would
body.
you like to skip?
No, I would like to add something, sir. The superior border is formed by the lower border of the mandible, sir.
Okay, and there are subdivisions of the anterior triangle. You know the subdivisions of the anterior triangle and which muscles
Yes, sir.
divide it?
Yes, sir. So the digastric muscle divides the digastric belly, anterior belly and posterior belly, and omohyoid, superior belly. These three divide the triangle in the in different parts, sir. And the triangles are digastric triangle, carotid triangle, muscular triangle, submental triangle.
Interpret the microscopic findings of preauricular lymph node biopsy.
Preauricular lymph node biopsy. So no, sir.
Skip.
I would like to skip the question, sir. Let me try, sir. Hello. This is metastatic blood cancer, sir. Metastatic cancer, sir.
Metastatic cancer of which type?
I can see pigments, sir. So I'm suspecting melanoma.
Okay, and what are the regions that might contain the primary lesion of malignant melanoma? Considering this a preauricular lymph node biopsy microscopic
Yes,
picture.
sir. So primary lesion is mainly present in the skin, sir. I didn't get the question, sir. Can you?
What are the areas supplied by preauricular lymph node?
Okay. So preauricular lymph node supplies the tragus, the anterior part of the tragus region, anterior part of the external ear, and lower part of the external ear, sir.
What is the nerve supply to posterior belly of digastric muscle?
Posterior belly of digastric. So posterior belly of digastric is supplied by I would like to skip this question, sir.
Regarding great auricular nerve, what is the root value and area supplied by?
By greater auricular nerve, sir.
Okay, time out. So now we are done.
C2, C3.
The time is up. Dr. Gurab, thank you. The feedback will be provided to you.
How was it, sir?
It was nice, good.
Okay.
Good evening, Dr. Rudra Prabhu. So today we are going to conduct the anatomy mock exam for Dr. Rudra. So Dr. Rudra, you have 3 stations, and for each station you have 9 minutes.
Okay.
So we'll start by the first station. Please identify structure number 1.
Oculomotor nerve.
1 is this structure.
Oculomotor nerve.
Okay, structure number 5.
It is the free border of the fox.
Free border of
Free border of the fox.
okay, number 9.
Falx.
Nine.
Can I skip it? Can I skip to the next question?
19.
You said 19, right?
Yes.
I'm sorry, I'll have to skip it. I'll come back to it again.
Number 24.
24th is the optic nerve.
26.
26 is the pituitary gland.
Okay, identify structure number 2.
Structure number 2 is the olfactory nerve.
4.
Number 4 is the optic nerve.
And what else? Number 4 indicates 2 structures.
Optic nerve and can I skip it?
Number 6.
Number 6. Number 6 is the oculomotor nerve.
Number 7.
I'll skip it.
9.
Number 9 is the trochlear nerve.
15.
15th is the facial nerve.
16.
16th is the vestibulocochlear nerve.
Regarding the oculomotor nerve, what is the course and muscles supplied?
The oculomotor nerve enters the cavernous sinus. It is a part of the cavernous sinus, and following its exit from the cavernous sinus, it supplies the extraocular muscles, all except
from where it originates first. I need a detailed course.
It originates from the midbrain. Originates from the midbrain. And then it passes into the cavernous sinus. It is a content of the wall of the cavernous sinus. And
before entering the cavernous sinus, what are the important relations? Okay, then continue.
After the cavernous sinus, it supplies the extraocular muscles, all the extraocular muscles except the lateral rectus and the superior oblique muscle.
So what are the muscles supplied by oculomotor nerve?
The muscles supplied by the oculomotor nerve include the medial rectus, the inferior oblique,
Mhm.
The levator palpebrae superioris, and the Muller's muscle,
What else?
inferior rectus,
And what else?
and the medial rectus.
Okay. What is the clinical picture of oculomotor nerve palsy, and what is the first sign?
Oculomotor nerve palsy leads to drooping of the eyelid due to paralysis of the levator palpebrae superioris. Uh, then there is also mydriasis due to involvement of the Muller's muscle, and due to the unopposed action of the lateral rectus and the superior oblique, the eye is down and out.
And what is the first sign?
The first sign of oculomotor nerve injury, palsy.
Mhm.
Sorry, I don't know.
What is the structure the oculomotor nerve might be pressed against?
The petrous part of the temporal bone.
Where are the attachments of the tentorium cerebelli?
The tentorium cerebelli is the part which is separating the cerebrum from the cerebellar peduncles, and it is attached to the anteriorly to the petrous part of the temporal bone, and it has an anterior free margin, and posteriorly it is attached to the occipital bone.
So posterior to the occipital bone, laterally, what? Sorry?
Laterally it is attached to the petrous part of the temporal bone, and anteriorly it has a free margin, and posteriorly it is attached to the occipital bone.
Okay, what is false localizing sign?
False localizing sign is a sign in which a particular it is a feature of when a particular nerve is involved, but the sign is not related to that nerve. For example, in cases of rise in intraocular pressure, the first nerve which is compressed is abducent nerve, so it gives a false localizing sign.
What is the abnormality in this figure?
It is a aneurysm which is seen, and it is most likely originating from the middle cerebral artery.
And what is the consequence of rupture?
The rupture of the aneurysm can lead to subarachnoid hemorrhage.
Okay, time out. Move on to next patient. Okay, please identify structure number 5.
Structure number 5 is the anterior talofibular ligament.
Number 7.
Structure number 7 is the calcaneofibular ligament.
Number 18.
Structure number 18 is the joint between the talus and the navicular.
So number 18, what is structure number 18?
It is the head of the talus.
Number 19.
It is the navicular bone.
Number 34.
Number 34 is the it is a It is a part of the deltoid ligament which is extending from the medial malleolus to the talus.
So 34 is the deltoid ligament.
It is a part of the deltoid ligament which is extending from the medial malleolus to the talus.
31.
Structure number 31 is also a part of the deltoid ligament which is attaching to the calcaneum.
32.
Structure number 32 is the calcaneus.
35.
Medial surface of the calcaneum. Structure number 35 is the talus bone.
Number 30.
Structure number 30 is the sustentaculum tali of the calcaneum.
Okay. Considering this is the first metatarsal bone, what is structure A?
Structure A is the base of the metatarsal.
Regarding arches of the foot, what are the arches of the foot and what are their components?
The arches of the foot are the medial longitudinal arch, the lateral longitudinal arch, and the transverse arch. The medial longitudinal arch is including the calcaneum, the talus, the navicular, the intermediate, the three cuneiforms, and the three metatarsals. The muscles which are included are the tibialis anterior, the tibialis posterior, the flexor hallucis longus, and the peroneus longus. And the ligaments included are the short and the long plantar ligaments and the spring ligament. The lateral longitudinal arch consists of the calcaneum, the cuboid, and the lateral two metatarsals. The muscles which are included are the peroneus longus and the peroneus brevis, and the ligaments are the short and the long plantar ligaments. The transverse arch includes the 5 metatarsal bones, and the muscle included is the peroneus longus.
The muscles of the lateral longitudinal arch, peroneus longus and brevis, and what else?
Peroneus longus and brevis. Other than those two. Other than those two, I don't know, sir. Peroneus longus and brevis.
Okay. What are the deltoid ligament attachments?
The deltoid ligament is attached superiorly to the medial malleolus. Inferiorly, it is attached to the head of talus, the body of talus, the tuberosity of the navicular, the tuberosity of the calcaneum, and to the spring ligament.
What else? As inferior attachment.
5 attachments to the calcaneum, tuberosity, navicular tuberosity, head of talus, body of talus, and spring ligament.
Okay, what is the type and articulating surfaces of the subtalar joint?
The articulating surfaces of the subtalar joint include the inferior aspect of the talus and the superior aspect of the calcaneum.
What is the type of the joint?
It is a synovial joint, plain synovial joint.
What are the movements at that joint?
Movements occurring at the subtalar joint are inversion and eversion.
What is the type and articulating surfaces of the talocalcaneonavicular joint?
The talocalcaneonavicular joint consists of articulation between the talus, calcaneum, and the talus along head of the talus along with the navicular bone.
What is the type?
It is a synovial joint, and the talonavicular joint is a ball and socket joint.
And what is the movements?
The movements occurring are gliding and rotatory movements.
What is the type and articulating surfaces of the calcaneocuboid joint?
It is the anterior aspect of the calcaneum with the cuboid bone. and it is a plain synovial joint, and it is a saddle joint.
And the movements?
Movements are again inversion, eversion, and some amount of circumduction.
What are the type and bones forming ankle joint?
The ankle joint is formed by the lower part of the tibia and the superior aspect of the talus.
And what is the type of the ankle joint?
It is also a synovial joint.
Synovial what?
Plain synovial joint.
Why is the ankle joint more stable in dorsiflexion?
The ankle joint is more stable in dorsiflexion because on dorsiflexion, the talus moves posteriorly and it is wedged into the wider portion of the ankle mortise.
What is the type of inferior talofibular joint?
Inferior tibiofibular joint is a syndesmotic joint.
What are the structures passing behind the medial malleolus?
The structures passing behind the medial malleolus includes the tendons of tibialis posterior, tendon of flexor digitorum longus, the posterior tibial vessels, posterior tibial nerve, and the tendon of the flexor hallucis longus.
What are the structures deep to extensor hallucis longus tendon?
The structures deep to the extensor hallucis tendon, extensor hallucis longus tendon are the deep peroneal nerve and the dorsalis pedis artery.
Identify structure number 1.
Structure number 1 is the neck of the talus.
Number 2.
It is the head of the talus.
Number 3.
So number 3 is the head and number 2 is the articulating surface of the talus, anterior articulating surface.
So again, number 1. What is number 1?
So number 1 is neck of talus, number 3 is head of talus, and number 2 is the articulating surface of the talus.
What are the bones attached or articulating with number 4?
The tibia and the fibula.
And number 5?
With number 5, it is tibia, and with number 4, number 5 is the medial aspect. So there is the medial malleolus of the tibia, and number 4 is the superior dome. So the lower articular surface of the tibia articulates with number 4. Now the lateral aspect is the lateral malleolus.
Time out, so we move on to next station. And the last station. Okay, identify structure number 6.
Structure number 6 is the fundus of the stomach.
Number 2.
Number 2 is the body of the stomach.
Number 18.
Number 18 is the pylorus of the stomach.
Number 18.
Pyloric antrum.
Number 19.
Pyloric canal.
Number 23.
First part of duodenum.
What is the blood supply and venous drainage of the stomach?
The stomach is supplied on the lesser curvature by the right and the left gastric arteries, and on the greater curvature by the right, left gastroepiploic arteries, and also by the short gastric arteries, which supply the fundus of the stomach.
What is the origin of each artery? What you said.
The celiac trunk gives rise to the left gastric artery. It then gives rise to the common hepatic artery. The common hepatic artery gives rise to the right gastric artery, and the left and the right gastric artery supply the stomach along the lesser curvature. The common hepatic artery also gives rise to the gastroduodenal artery, and the gastroduodenal artery gives rise to the right gastroepiploic artery. Another branch from the celiac trunk is the splenic artery, which passes behind the stomach, and then it gives rise to the left gastroepiploic artery and the short gastric arteries, which supply the fundus of the stomach.
Okay, and what is the venous drainage of the stomach?
Venous drainage is again by the right-left gastric veins and the right-left gastroepiploic veins.
And where do each vein drain? Where do
Yes, sir. The left gastric vein drains into the portal vein, and the left gastroepiploic vein drains into the splenic vein. Other veins also, I think, drain into the portal vein.
So the right gastroepiploic vein drains into the portal vein, and the short gastric vein.
The right gastroepiploic. I'm sorry, I don't know about the exact veins which drain the. Can I skip this venous drainage part?
Okay. What are the peritoneal relations of the different parts of the duodenum?
Of the
duodenum. Peritoneal relations of different parts of the duodenum.
The duodenum is divided into 4 parts. The first part of duodenum is related anteriorly to the quadrate lobe of the liver and the gallbladder.
The peritoneal relations. The peritoneal relations of different parts of the duodenum. I do not need the relations, all the relations of different parts of the duodenum. I need the peritoneal relations. Relations to peritoneum.
The second, third, and the fourth part of duodenum is retroperitoneal.
Sorry?
The second, third, and fourth part of duodenum is retroperitoneal, behind the peritoneum.
Okay, and the first part?
First part is not retroperitoneal.
So it is? It is actually the free margin of the lesser omentum is attached to the superior aspect of the first part of the duodenum. Okay, what is the blood supply of the duodenum?
The duodenum is supplied by the gastroduodenal artery, which is a branch from the common hepatic artery. And also
from the gastroduodenal artery?
Gastroduodenal artery, which is originating from the common hepatic artery.
Yes, the duodenum is supplied directly by the gastroduodenal artery, or there are some specific branches that supply the duodenum?
The superior and inferior pancreatic or duodenal arteries.
And where do they come from?
The superior pancreatic or duodenal artery is coming from the gastroduodenal artery, and the inferior pancreatic or duodenal artery comes from the superior mesenteric artery.
Okay, and what else has blood supply of the duodenum?
I don't know.
Okay, what are the different relations to the third part of the duodenum?
The relations of the third part of duodenum include anteriorly are the superior mesenteric vessels, and posterior relations, and also posterior relations include the inferior vena cava, the abdominal aorta, the right ureter, the right psoas major, and superiorly is the head, neck of pancreas with the uncinate process, and inferiorly are the coils of the jejunum.
Where is the major duodenal papilla and what is its function?
The major duodenal papilla is a papilla which receives the opening of the common bile duct and the major main pancreatic duct combined together and open at the major duodenal papilla, which is located around 8 to 10 centimeters distal to the pylorus, near in the second part of the duodenum.
And where in the second part of the duodenum? Where specifically? In which wall?
8 to 10 centimeters distal to the pylorus.
Posteriorly, medially, anteriorly, laterally?
Posteriorly.
Surface of the duodenum.
Posteriorly.
What is the blood supply of the pancreas?
The pancreas is supplied by the splenic artery, and arterial supply includes the splenic artery, and it is also supplied by the pancreatic or superior and inferior pancreatic or duodenal arteries, and the venous drainage is from the splenic vein.
Where are the ducts of the pancreas open?
The pancreatic ducts are the main pancreatic ducts and the axillary pancreatic ducts, which open at the second part of the duodenum at the major duodenal papilla. The main pancreatic duct combines with the common bile duct to open at the major duodenal papilla.
Okay, what are the vessels to encounter during pancreatic surgery?
The vessels encountered during pancreatic surgery include the splenic artery, the splenic vein, the superior mesenteric artery, the gastroduodenal artery, the superior and inferior pancreatic or duodenal arteries.
What else?
Splenic artery also. Splenic artery, splenic vein, superior mesenteric vessels.
Okay, what is the ligament connecting the pancreatic tail to the spleen?
Pancreatic splenorenal ligament.
Okay, time out. So now we are done. Thank you, Dr. Rudra.
Thank you very much, sir. Thank you very much.
Feedback will be provided to you soon.
Okay, thank you very much.
Thank you. Now you can leave the meeting.
Okay, thank you.
We do not need the camera if you'd like to shut it down. Good evening,
Okay, sir.
Dr. Ravi Ranjan. Today we are going to conduct the anatomy mock exam for Dr. Ravi. So, Dr. Ravi, you have 3 stations, and for each station you have 9 minutes. So, let's start by the first station. 9 minutes starting
sir.
by now. Please identify structure number 1.
This is abduction nerve. Am I audible, sir? So this is abduction nerve, cranium number 6.
Structure number 5. You have to be a little bit faster, Dr. Ravi, because we're running out of time. Dr. Ravi. Dr. Ravi. Dr. Ravi. Dr. Ravi, I think you have a problem with your network.
Hello.
Yes.
Number 5 is attached margin of falx cerebelli.
Okay, 9.
Number 9. Yes, that is free margin of free margin of tentorium cerebelli. That was attached margin of tentorium cerebelli.
Number 19.
Yes, number 9 is free margin of
19. 19. Number
okay,
19.
sir, okay. Okay, I'm sorry, sir. 19 is yes, 19 is ophthalmic nerve, sir. Oculomotor nerve.
24.
24 is optic nerve.
26.
26 is pituitary stalk.
Identify number 2.
Yes, number 2 is olfactory bulb.
Number 4.
Optic nerve.
And what else? Number 4 are 2 structures.
Yes, internal carotid artery.
Number 6.
Number 6 is the oculomotor nerve.
7.
Is the abducen nerve.
9.
Trochlear nerve.
15.
Trigeminal nerve.
16.
That is facial nerve and along with vestibulocochlear nerve.
Regarding the oculomotor nerve, what is the course and muscle supply?
So oculomotor nerve rises from the midbrain and goes anteriorly and pierces the dura and comes to the cavernous sinus lateral border and then
Dr. Ravi, please restore your network. Try to restore your network. You have a problem with your network.
So superior orbital fissure. Then
Dr. Ravi, you have a problem with your network.
Then
I cannot hear your answer.
Supplies the palpebral superioris.
I cannot hear your answer, Dr. Ravi. Your network is.
Then medial rectus, superior rectus. Am I audible now, sir? Hello. Hello, sir. Am I audible?
No, I cannot hear you, Dr. Ravi.
Am I audible now, sir?
Yes. So please proceed with your answer. The course of oculomotor nerve.
Oculomotor nerve supplies the superior rectus, middle rectus, inferior rectus, levator palpebralis. Yes, sir. Sir, it arises from the midbrain, then goes anteriorly and pierces the dura and comes from the in the lateral border of the cavernous sinus, and then through the superior
Okay, what is the
fissure
clinical picture
and
of oculomotor
supplies
nerve palsy?
Yes, sir. The patient will have a down and out eye, and the patient will also have mydriasis and loss of light reflex.
And what is the first sign?
First sign is the mydriasis
Why?
because of parasympathetic fibers are on the periphery that will be affected first. So the mydriasis will go first.
What is the structure the oculomotor nerve might be pressed against?
So petrous part of temporal bone.
What are the attachments of tentorium cerebelli?
Yes, tentorium cerebelli is attached anteriorly to the lesser wing of a sternioid. Medial border is free and laterally attached to the temporal bone and the posteriorly occipital bone and internal occipital protuberance.
What is the force localizing sign?
Yes, it is due to compression of sixth cranial nerve because of it has long intracranial course. The location of the injury doesn't signify the exact location of nerve injury. The signs doesn't signify location. That's right.
Okay, time out. So we move on to next station.
Okay, sir.
Please identify structure number 5.
Yes, this is
Your network, Dr. Rabi. Please restore your network.
Anterior talofibular ligament.
Okay, number 7.
So this is anterior talofibular ligament.
7.
This is calcaneofibular ligament.
18.
Calcaneofibular ligament, sir.
18.
18, sir. Yes, sir. Yes, sir. 18 are calcaneocuboid joint. 18 is calcaneocuboid joint, sir.
Number 18.
Yes, sir. I said calcaneo.
This is calcaneo. Okay.
Cuboid joint.
Okay. 19.
19 is 19 is cuboid bone.
34.
34. Yes, this is deltoid ligament, deep part.
31.
31. 31 is this is deltoid. This is part of deltoid ligament, calcaneal part, attaching to sustentacrum tali.
32.
32 is medial surface of calcaneum.
35.
35 is the 35 is the talus bone.
Number 30.
30 is This is calcaneonavicular ligament. That is.
Okay. This is the first metatarsal bone. So what is structure A?
This is a metatarsal bar or tuberosity of the first metatarsal.
What are the arches of the tooth and what are their components? Bones, ligaments, and muscles.
Yes, sir. There are two longitudinal, medial and lateral longitudinal ligaments, and a transverse arch, medial arch and medial longitudinal and lateral longitudinal, and a transverse arch. Bones of medial longitudinal arch are calcaneum, talus, and navicular, and first, second, and third cuneiform, and first, second, third metatarsals. And the ligaments are spring ligament and plantar aponeurosis, and the muscles are tibialis anterior and tibialis posterior and plantaris. And the lateral longitudinal ligament, lateral longitudinal arch bones are calcaneum, cuboid, and fourth and fifth metatarsal, and the muscles are peroneus longus, peroneus brevis, and short plantar muscles, and ligaments are long and short plantar ligaments and plantar aponeurosis. And transverse arch is formed by base of first to fifth metatarsals. 1 foot is half of the transverse arch, and 2 foot completes the arch. Muscles are interosseous muscles and plantar aponeurosis are ligaments.
Okay, what are the deltoid ligament attachments?
So deltoid ligament attaches to the calcaneum, navicular, and the talus, and it arises from the medial malleolus.
What else as attachments of deltoid ligament?
It attaches to calcaneum sustentaculum tali, talus bone, navicular bone, and also to spring ligament.
What is the type and articulating surfaces of subtalar joint?
Subtalar joint articulates with inferior surface of the talus and superior articulating surface of the calcaneum.
And what is the type?
It is a synovial joint, hinge type.
What is the type and articulating surfaces of talocalcaneonavicular joint?
Yes, sir. It articulates with talus bone and the navicular bone and the calcanean bone. It is ball and socket type of joint.
And type and articulating surfaces of calcaneocuboid joint?
Yes, the calcaneum. It articulates with the calcaneum and the cuboid, and it is a type of synovial joint.
What are the type and bone forming ankle joint?
Yes, distal upper articulating portion of the talus and the distal portion of the tibia and the fibula, and it is type of synovial joint, hinge joint.
Synovial what?
Hinge joint, sir.
Regarding the ankle joint, what is the most? Why is it most stable in dorsiflexion?
Yes, because in dorsiflexion, the broad part of the talus comes in the contact with the articulating surface of the distal tibia, so it is most stable in the dorsiflexion. In the plantar flexion, only a small part is in contact with the bone, and it wiggles, so it is stable in dorsiflexion.
What is the type of inferior talofibular joint?
anterior. It is syndesmosis joints.
What are the structures passing behind the medial malleolus?
These are tibialis posterior tendon and flexor hallucis longus, flexor distorum longus, and tibialis posterior artery.
What are the structures deep to the external hallucis longus tendon?
These are dorsalis pedis artery and deep peroneal nerves.
Time out, so we move on to the next patient and the last one.
Okay, sir.
Please identify structure 6.
Structure 6 is the fundus of the stomach.
2.
Fundus of the stomach.
Okay, 2.
2 is the body of the stomach.
18.
18 is the antrum of the stomach.
19.
Is the pyloric canal of the stomach.
23.
Is the first part of duodenum.
What is the blood supply of the stomach and the venous drainage?
Blood supply is lesser curvature, is supplied with the short gastric artery and also the left gastric artery and the right gastric artery, and the greater curvature is supplied by the right gastroepiploic and left gastroepiploic, and also the short gastric artery. Left gastric artery is branch of celiac trunk, right gastric from the common hepatic artery, and right gastroepiploic from the gastroduodenal, and this left gastroepiploic from the splenic artery, and short gastric also from the splenic artery. And the venous drainage is gastroduodenal and the short gastric left gastric vein into the mainly the portal vein.
What are the peritoneal relations of different parts of the duodenum?
Yes, first part and fourth part is small part of fourth part is retroperitoneal and rest is intraperitoneal.
What is the blood supply of the duodenum?
Blood supply.
Blood supply, yes. Of the duodenum.
Yes, sir. Blood supply is from the superior mesenteric artery and also from the gastroduodenal artery.
Sorry, what is the blood supply of the duodenum again?
One from the one is a branch of common hepatic artery, that is gastroduodenal artery, and also from the a branch of superior mesenteric artery.
What are the names of these branches?
Sorry, sir, I'm not able to remember.
Okay, what are the different relations to the third part of the duodenum?
Third part, yes, sir. Anteriorly, third part of duodenum. Superiorly will be the uncinate process of the pancreas, and inferiorly the coils, inferiorly or anteriorly coils of the intestine, and anteriorly the transverse colon, and posteriorly will be the right aorta and aorta, and IVs inferior vena cava, and all and yes, sir, I'm not able to recall.
Where is the major duodenal papilla and what is its function?
Sir, could you please repeat, sir?
Where is the major duodenal papilla and what is its function?
Sir, major duodenal papilla is in the second part of this duodenum, and its function is it drains main pancreatic duct and also the secretion from the CBD.
Where is it situated?
It is situated in the posterior-medial border of the second part of duodenum.
What is the distance from the pylorus?
I'm not able to recall.
Okay, what is the blood supply of the pancreas?
Yes, blood supply is from one is from the mainly the splenic artery, and also a pancreatic branch from the splenic artery, and also from the gastroduodenal. Mainly it is supplied from the splenic artery, so pancreatic branch of the splenic artery.
Mainly. What else?
What, sir? Pancreatic branch from. I'm not able to recall.
Where are the ducts of the pancreas open?
Major duct open in the major duodenal papilla, and minor duct in the minor duodenal papilla.
What are the vessels encountered during pancreatic surgery?
Pancreatic resection.
Pancreatic surgery.
Yes, sir. That will be pancreatic surgery, superior mesenteric artery, superior mesenteric vein, and posteriorly maybe portal vein, and splenic artery, and gastroepiploic artery.
What else?
Posteriorly, maybe a renal artery and renal veins.
Okay, what is the ligament connecting the pancreatic tail to the spleen?
Splenorenal ligaments.
Describe the development of the pancreas.
Yes, pancreas develop from the ventral mesogastrium with ventral and dorsal bud, and which rotates during development, and ventral bud forms the uncinate process and the head, and the rest of part by is the dorsal part.
Identify structure number 3.
Number 3 is the pancreas. Number 3 is pancreas.
Which part of the pancreas?
Uncinate process of the pancreas.
Anterior process of the pancreas?
Uncinate
Okay,
process.
Number 9. Uncinate
The body of body of the pancreas. Head of the pancreas.
Number 14
is the superior mesenteric artery.
15
is the superior mesenteric vein.
Okay, so that was the last question. Now we are done, Dr. Ravi, and the feedback will be provided to you soon. Thank you. Good evening, good morning, Dr. Vaishnavi Chakravarti. Today we are going to conduct the pathology mock exam for Dr. Vaishnavi. So, Dr. Vaishnavi, you have 2 stations, and for each station you have 9 minutes.
Okay.
So let's start by the first station. Please read the stem.
Okay, yeah.
What is the pathophysiology of diverticulosis?
Pathophysiology of diverticulosis. Yeah, diverticuli are the outpouching of the colonic mucosa through the muscular layer and the serosa in the colon. These are usually commonly seen in the sigmoid colon, the descending colon, and sometimes in the ascending and transverse colon. The pathophysiology is that the longitudinal muscle layer of the colon is bunched into 3 vertical running groups called the tinea coli. In between these tinea, there is no muscular support of the outer longitudinal group. So in cases of increased pressure inside the lumen, and the colonic mucosa outpouches through the area where the arteries and nerves pierce the serosa, because these are focal weakness.
What is the cause of diverticulitis in diverticular disease?
Diverticulitis is because of because of increased constipation, and sometimes there is retention of fecal matter in the diverticula that can get infected and cause inflammation. So this causes diverticulitis.
And why is the risk of perforation so high in diverticulitis?
Because in diverticulitis, it doesn't have all 3 layers of the colon. There's only the mucosa that is outpouching, and in inflammation, the tissue gets friable, and there is increased chances of perforation.
What is the epithelial lining of the colon?
Simple columnar epithelium.
How neutrophils migrate to the site of infection?
Neutrophils migrate by rolling in the blood vessels. There's a phenomenon called rolling, where they roll to the edge of the blood vessel. Then there's another phenomenon called margination, where again they roll to the side of the blood vessel. Then there is adhesion to the endothelial cells, and there is transmigration through the endothelial cells. And there are some chemotactic stimuli, such as cytokines released at the site of injury. So these neutrophils follow the chemotactic stimuli and go to the site of inflammation.
How are neutrophils formed?
Neutrophils are formed in the bone marrow.
From which cells?
From the monocyte and macrophage lineages by lymphopoiesis.
Lymphopoiesis.
Yes.
Okay, what is the lifespan of the neutrophils in circulation?
Around 5 to 7 days.
What is inside neutrophils?
The neutrophils contain primary granules and secondary granules. The primary granules contain enzymes such as lysozyme, myeloperoxidase, and acid hydrolase that help in attacking the foreign body or the foreign antigen and digesting them. The secondary granules, or the specific granules, they also contain proteases, gelatinases, acid hydrolase, lysozyme, and they also help in digestion of the antigen.
What attracts neutrophils to the site of infection?
Cytokines.
Sorry?
Cytokines, inflammatory mediators.
What else?
The macrophages also attract the antigens presented on the
There are exogenous and endogenous substances. Do you know them?
The exogenous substances are usually the end products of the bacterial cell wall, usually the N-formyl methionine group of the bacterial cell wall. The endogenous substances are the cytokines such as interleukin-1, interleukin-6, tumor necrosis factor alpha, interleukin-8 also.
Okay, how did endometriosis get to the colon?
There are multiple ways in which endometriosis can appear at a different place. There are multiple theories. The one theory is the regurgitation theory, where the endometriotic tissue regurgitates from the uterine cavity through the fallopian tube into the coelom. Then there is the metaplastic theory, where it states that the coelomic epithelium differentiates into the endometrial lining. And there is again another theory where the endometrial tissue can travel through the lymphovascular network to distant sites, and this explains endometriosis in the lungs.
Okay, can endometriosis increase the risk of cancer?
Yes, endometriosis can increase the risk of endometrial carcinoma.
Which type of cancer and how many folds is the increased risk?
The risk is 2.5 into 5 times, and the type of cancer is endometrial carcinoma, and it can also cause the risk of ovarian carcinoma.
Ovarian cancer by how many folds?
2.5 to 2.5 to 5 times.
Why endometriosis causes pain?
Endometriosis causes pain by local release of substance P and intra-abdominal bleeding and periuterine adhesions.
Few days later, the patient developed left iliac fossa collection. Why? Can you explain?
In a patient of diverticulitis, maybe there could be peridiverticular collection, or rupture of the diverticula can also cause collection.
And what else?
The endometriosis, intra-abdominal bleeding can also cause a collection.
Okay, which type of collection?
This can be a purulent collection, abscess.
Okay, what antibiotics would you give?
I would like to give broad spectrum antibiotics after, as per the trust policy, and after taking into account the microbiologist's opinion. I would like to give amoxicillin, clavulanic acid, gentamicin, and metronidazole.
Okay, that was the last question. So we'll move on to next station. Please read the stem.
Okay, yeah.
Okay. Describe the colonoscopic picture, please.
The colonoscopic picture shows multiple small polyps that are studied throughout the colonic mucosa. It is very large in number, and it could be suggestive of adenomatous polyposis.
Define familial adenomatous polyposis.
Familial adenomatous polyposis is a hereditary cancer syndrome characterized by mutation of APC gene at 5q21 location on the chromosome, the 5th chromosome. It is autosomal dominant. And it increases
what is the age of affection, and it's called by a somatic mutation? Of which gene? Complete your answer.
It is caused by somatic mutation of APC gene. This gene is present at 5th chromosome at location 5q21, and it leads to the presentation of colon cancer. Initially, it leads to presence of multiple colonic adenomas, usually by the time of 20 years of age. Almost.
What is the risk of colorectal adenocarcinoma development in familial adenomatous polyposis?
It is almost 100% by the age of 40 to 50.
Okay, what is the function of APC gene?
APC gene is a tumor suppressor gene.
And what else?
Uh,
what does it downregulate, or?
It downregulates the beta catenin. It downregulates the WNT pathway that leads to decreased production of beta catenin and stops over excessive proliferation of cells.
Okay, give a classification of polyps.
Polyps can be malignant and non-malignant, and the non-malignant polyps can be inflammatory, hyperplastic, and
do you mean neoplastic and non-neoplastic?
Yeah, sorry. Yes, neoplastic and non-neoplastic.
Okay.
And the non-neoplastic can be further classified into inflammatory and hematomatous and hyperplastic. And the neoplastic polyps are further categorized into adenomatous polyps, tubular polyps, and tubulovillous polyps.
Okay, what are hyperplastic polyps?
Hyperplastic polyps are usually seen in response to inflammation, and there is a hyperplasia of the epithelium that leads to the formation of polyps.
Is it benign or malignant?
It is a benign. Form of polyp.
And what is the most common age of affection?
The most common is 40 to 50 years.
And what is the malignant potential of hyperplastic polyps?
Hyperplastic polyps are the malignant potential is very minimum. It is around 5 to 10%.
What could be the types of adenoma in familial adenomatous polyposis?
Excuse me, I didn't catch your question.
What are the types of adenoma in familial adenomatous polyposis?
The types of adenoma can be dysplastic adenoma, malignant adenomas, neoplastic, or it can be villous adenomas or tubulovillous adenomas.
Adenomas are neoplastic polyps. Okay, what are the types?
Villous and tubulovillous and sessile.
Villous and tubulovillous, and what else?
Sessile.
What else?
And malignant polyps.
Such as what?
Adenocarcinoma.
Okay, and what else?
Dysplastic polyps.
Okay, what is meant by hamartoma?
Hamartoma is a type of non-neoplastic polyp that is caused by excessive proliferation of tissue that is native to that particular region.
Do you know examples of hamartomatous polyps?
Yes, there are juvenile adenomatous polyposis, then Banayan-Riley-Rubalcaba syndrome, then Peutz-Jeghers polyps.
Okay, what is the risk of malignancy?
The risk of malignancy is 30 to 40% in hematomatous polyps in these syndromes.
What are the extracolonic manifestations of familial adenomatous polyposis?
The extracolonic manifestations can be malignancies at other sites, such as papillary thyroid carcinoma, then CNS tumors such as medulloblastoma. They can also have desmoid tumors. They can have excessive multiple sebaceous cysts. They can have osteomas.
What else?
They can have they can also have uterine malignancies.
There's an excellent stun manifestation that is usually detected at birth.
Congenital hypertrophy of retinal pigment epithelium, which can be used for screening for FAP.
And there are specific syndromes that are associated with familial adenomatous polyposis.
There is Gardner's syndrome. Gardner's syndrome, it's a subset of familial adenomatous polyposis where they have colonic malignancy. They can have desmoid tumors. They can have mandibular osteomas. They can have multiple fibromas and supernumerary teeth. Then there's a Turcot syndrome, which is characterized by sebaceous cyst keratoacanthoma, and it is also characterized by CNS tumors, such as medulloblastoma.
Okay. Mention 2 genetic pathways leading to colonic adenocarcinoma.
There is the adenoma carcinoma sequence, which is by mutation of APC gene and KRAS gene and P53 mutation. Then there is another pathway which is by the mismatch repair MLH MSH2 DNA mismatch repair pathway.
Sorry, the second genetic pathway?
It is caused by the mutation of MLH2, MSH1, MSH2 mutations.
Okay, how could you manage familial adenomatous polyposis?
Familial adenomatous polyposis requires early diagnosis. If diagnosed at a very young age, we will start surveillance of the child very early. We'll start by annual colonoscopies by the
How will
age.
you manage the patient himself?
The patient has to be offered regular surveillance, and he can also be offered total proctocolectomy with ideal pouch anal anastomosis, so that all the infected mucosa is all the affected mucosa is removed.
By which age?
Usually they should be at least by 30, at least by 40 years of age, everything should be removed.
Okay, time out. So now we are done. Thank you, Dr. Vaishnavi. The feedback will be provided to you soon.
Okay, thank you.
Thank you. Now you can leave the meeting. Good morning, Dr. Haytham Al-Zinati. Today we are going to conduct the anatomy mock exam for Dr. Haytham. Dr. Haytham, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. Please identify structure number 1.
This is the spinal accessory nerve.
Structure number 5.
I cannot see number 5. Where is?
Yes. This structure.
Yeah. The number 5 is the attached part of tentorium cerebelli.
Number 9.
This is the free margin of tentorium cerebelli.
Number 19.
Number 19 is the oculomotor nerve.
24.
24 is the optic tract.
The
optic nerve and optic tract.
Number 26.
Number 26 is the pituitary.
Pituitary what?
Pituitary stuff.
Number 2.
Number 2, the olfactory bulb.
Number 4.
Number 4 is the optic nerve and internal iliac, internal carotid.
Number 6.
Number 6 is the oculomotor.
Number 7.
Number 7 is the abducent nerve.
Number 9.
Number 9 is the trochlear nerve.
Sorry?
What?
Number 9?
Number 9 is the trochlear nerve.
Number 15.
Number 15. Number 15 is the facial nerve.
16.
The 16 is the vestibulocochlear.
What is the course and muscle supplied by oculomotor nerve?
The oculomotor nerve varies between the bone and the medulla. It is superior to the posterior, to the anterior inferior cerebellar artery superior to it, and inferior to the posterior cerebral artery, and then the oculomotor nerve leaving the skull through the superior orbital fissure, supplying superior rectus and inferior rectus and medial rectus and inferior oblique and levator palpebrae superioris and sphincter pupilli muscle.
What is the clinical picture of oculomotor nerve palsy? And what is the first signs?
The clinical picture is the deviation of the eye outward by the action of lateral rectus and inward by loss of by the action of as the lateral rectus supplied by abducent nerve, and inward because supplied by superior oblique, and also MRCS because loss of meiosis because loss of pupillary dilatation muscle, and ptosis also because loss of levator palpebrae superioris.
And what are the first signs?
The first sign is meiosis.
Meiosis. Can you explain?
MRCS, sorry.
Okay, explain why.
Because loss of pupillary constrictor muscle. The action of pupillary constrictor muscle.
And why is that?
Because compression of on the oculomotor nerve or paralysis of the oculomotor nerve, paralysis of parasympathetic supply parasympathetic supply and oppose the action of sympathetic supply.
And why is this the first sign to happen?
Skip, please.
What is the structure of the oculomotor nerve might be pressed against?
Structure?
Structure the oculomotor nerve might be pressed against.
Against compressed against tentorium cerebelli.
Which border of tentorium cerebelli?
The attached border of tentorium cerebelli.
What are the attachments of the tentorium cerebelli?
Attachment to the tentorium cerebelli, anterior and lateral to the vitreous bone, vitreous part of temporal bone, and anterior and medial to the dorsal cilia, and also the clinoid process, and posterior anterior. It is the free border, and posterior inferior is the temporal or squamous part of the occipital bone.
What is post-localizing sign?
It's a neurological sign that occur remote from the area where is the pathology, like increase intracranial pressure that make compression on the abducent nerve.
What is the abnormality here?
Middle meningeal artery aneurysm.
What is the consequence of rupture?
Subarachnoid hemorrhage.
What is the abnormality here?
This is MR angiography, the left middle meningeal artery infarction. Occlusion. Middle meningeal artery occlusion.
And what is the clinical picture?
Sorry, middle carotid artery, not middle meningeal, middle carotid.
Middle carotid?
Yeah.
Are you sure about that?
Yes, middle carotid.
Okay, and what is the clinical picture?
Clinical picture, hemiparesis on the contralateral side, and aphasia of the dominant hemisphere, and paralysis of the lower half of the face of the opposite side, contralateral side.
What else?
And aphasia and hemiparesis and lower half of the face.
Okay, time out, so we'll move on to the next station. Please identify section number 5.
Number 5 is calcaneo talus ligament.
Number 7.
Number 7, talofibular ligament.
18.
This is the body of the talus.
19.
19 is the navicular bone.
34.
34 is calcanofibular ligament.
31.
Anterior talofibular.
32.
This is the calcaneus.
35.
Calcanofibular ligament.
30.
Spring ligament.
Suppose that this structure is the first metatarsal. What is structure number A?
This is tubercle. The first metatarsal.
What are arches of the foot, and what are their components, like bones, ligaments, and muscles?
The arches is medial longitudinal arch and lateral longitudinal arch and transverse arch. Medial longitudinal arch composed from the calcaneus and talus and navicular and medial cuneiform, intermediate cuneiform, and lateral cuneiform, the bone, and also from the muscle peroneus longus and brevis, and also tibialis anterior and posterior. The ligament is short and long plantar ligament and spring ligament. Lateral arch of the foot is composed from calcaneus and cuboid, and also from the two metatarsal, the lateral two metatarsal bone, containing the muscle is short and long plantar muscle. The tendon ligament. The muscle is peroneus longus and brevis. Transverse arch composed from the fifth metatarsal bone and peroneus longus.
What are deltoid ligament attachments?
What is the
deltoid ligament attachments?
Deltoid ligament attaching to the medial malleolus and then to the stratum tali of the calcaneus and to the talus, the body and the neck and the navicular bone.
What is the type and articulating surfaces of the subtalar joint?
Articulate a type of articulating surface of
subtalar joint. The type and articulating surfaces.
Subtalar joint is the plan synovial.
What are the articulating surfaces?
Among the calcaneus and talus. The movement is for the subtalar joint is inversion and eversion.
What is the type of calcaneonavicular joint?
Calcaneonavicular joint, ball and socket joint, contain from the calcaneotalus and talonavicular is ball and socket joint.
What are the articulating surfaces?
From the calcaneus and the superior surface of the calcaneus and the talus and the tubercle of the navicular bone.
What's the type of calcaneocuboid joint?
Plan synovium.
And what are the movements of this joint?
Is the inversion and eversion also.
What are the type and bone forming ankle joint?
The ankle joint from the tibia and fibula and trochlear surface of the talus.
What is its type?
Type of what? Of ankle joint? Plan synovium.
What are the movements at the ankle joint and what are the muscles performing it?
Dorsiflexion and plantar flexion among the ankle joint. The muscle for the dorsiflexion is extensor hallucis longus and extensor digitorum longus and also tibialis anterior. For the plantar flexion is tibialis posterior and flexor hallucis longus and flexor digitorum and also can help by tibial by popliteus and plantaris muscle also.
Why is the ankle joint most stable in dorsiflexion?
Because on dorsiflexion, the wider surface of the trochlea is impacted in the trochlea. It's impacted in the joint and make a little movement during dorsiflexion when the shifting is posteriorly. But when plantar flexion, the wide surface not impacted in the ankle mortise, so can be a little of movement about dorsiflexion, eversion, inversion, some little movement.
What is the type of inferior talofibular joint?
Inferior talofibular joint is syndosmosis.
Time out, so we move on to next station and last station. Please identify number 6.
Number 6, I cannot see what is 6. This is 5 or 6. Okay, this is the fundus of the stomach.
Okay, number 2.
Body of the stomach.
18.
18 is the pylorus.
18. This is number 18.
This is not. This is the number 18. Fundus, body, and the pyloric antrum.
Okay, number 19.
Pyloric canal.
Number 23.
Pyloric sphincter.
23. This is the antrum and this is the pylorus. Then number 23.
The first part of the duodenum.
Okay. What is the blood supply of the stomach?
Right gastric and left gastric artery arise from the left gastric from the celiac trunk and right gastric from the hepatic artery. Right gastroepiploic arise from gastroduodenal artery and left gastroepiploic arise from the splenic artery. Short gastric also arise from the splenic artery. This is the arterial. The venous drainage right and left gastric to the portal vein and right gastroepiploic to the superior mesenteric vein and left gastroepiploic and short gastric to the splenic vein.
What are the peritoneal relations of the different parts of the duodenum?
The duodenum is retroperitoneal, except the first part is anterior.
What is the blood supply of the duodenum?
Superior-pancreatico-duodenal, which is arise from the gastroduodenal artery, from the hepatic artery, and inferior-pancreatico-duodenal arises from superior mesenteric artery and duodenal artery, duodenal artery, which arise from also some from hepatic artery.
What are the different relations to the third part of the duodenum?
The third part of the duodenum, anterior the root of the mesentery and transverse mesocolon, anterior and posterior the inferior vena cava and aorta, and right psoas and right gonadal superior is the answering process and the head of the pancreas. Inferior there is the coils of the jejunum.
What else has posterior relations?
Aorta and inferior vena cava and right psoas major and right ureter also.
Okay. Where is the major duodenal papilla and what is its function?
Major duodenal papilla, which it is opening in the second part of the duodenum posteromedial, 10 centimeter from the pylorus.
What is its function?
This is the drainage of the main pancreatic duct and hepatic biliary duct.
What is the blood supply of the pancreas?
Superior pancreatico-duodenal and inferior from gastroduodenal, inferior pancreatico-duodenal from the superior mesenteric, and pancreatic branch from the splenic artery.
Where are the ducts of the pancreas open?
Where is the main pancreatic duct? It is open. There is two ducts, main pancreatic duct in major duodenal papillae and accessory pancreatic duct, which is open in the minor duodenal papillae.
What are the vessels to encounter during the pancreatic surgery?
Splenic vein and superior mesenteric vein and portal vein and superior and inferior pancreatico-duodenal and superior mesenteric artery and left renal vein.
What else?
Splenic and superior mesenteric and portal and superior and inferior pancreatico-duodenal and left renal and superior mesenteric artery.
Okay, what is the ligament connecting the pancreatic field to the spleen?
Lieno-renal ligament.
Describe the development of the pancreas.
The development of the pancreas from the ventral bud and dorsal bud. The dorsal bud from the dorsal aspect of the duodenum, which give the upper part of the head and body and the neck and tail, and the ventral bud from the hepatic diverticulum ventrally, which give the lower part of the head and answer process.
Identify structure number 3.
This is the head of the pancreas.
9.
The body of the pancreas.
14.
Superior mesenteric artery.
15.
Superior mesenteric vein.
Number 9 is the body.
Or the neck of the pancreas, the body little behind.
So that was the last question. Thank you, Dr. Haytham. Now we are done. The feedback will be provided to you soon. Thank you.
Thank you so much.
Now you can leave the meeting.
Thank you.
Good evening, Dr. Hima Rana. Today we are going to conduct the anatomy mock exam for Dr. Hima. So Dr. Hima, you have 3 stations, and for each station you have 9 minutes.
Okay,
So,
got it.
let's start by the first station.
Okay.
9 minutes started by now. Please identify structure 2.
Structure 2 is it's superior vena cava.
Structure 4.
It is the auricle of right atrium.
Structure 5.
It is the right atrium cell.
6.
6 is the infundibulum of the right ventricle.
Number 8.
8 is a papillary muscles.
Number 9.
Sorry, number 9 is a papillary muscle, and number 8 is the cauda tendinae.
Okay. So sorry, again, number 8 and 9.
Number 8 cauda tendinae, number 9 papillary muscles.
Okay, number 18.
Number 18. It is the left atrium.
18, sorry.
Left atrium.
Number 19.
Number 19 is the left atrium, sorry. Number 18, maybe the opening of the aorta. Sorry.
Okay, so number 19 will be?
Number 19 will be right atrium. Sorry, left atrium.
Number 21.
21 are the papillary muscles of the left ventricles.
Number 20.
Number 20. It is the it is the serous pericardium.
How many cusps have the pulmonary valve?
Pulmonary valves are 3 cusps.
What is the vertebral level of the pulmonary valve?
It is T6 level, 6 thoracic
What
vertebra.
is the level of the pulmonary trunk division?
It is 5th thoracic vertebra.
Where to auscultate the pulmonary valve?
It can be auscultated in a second intercostal space, left side of the sternum.
What are the branches of ascending aorta?
There are mainly 2 branches, right coronary artery and left coronary artery.
What are the branches of the pulmonary trunk?
It is the right pulmonary artery and left pulmonary artery.
How many pulmonary veins are present?
There are total 4 pulmonary veins.
Please identify structure number 3.
Structure number 3 is sympathetic trunk.
Number 5.
It is the main bronchus.
Right or left?
Right main bronchus.
Number 10.
Number 10 is the vagus nerve.
Number 12.
Number 12 is a greater splanchnic nerve.
Number 14.
Sorry, I could not get this.
Sorry, number 14.
Number 14, I think. Sorry, don't know.
So would you like to skip?
Yeah.
What are the azygous vein tributaries?
The azygous vein tributaries are the right superior intercostal vein and the lower right side posterior intercostal vein, hemiazygous vein, accessory hemiazygous vein, mediastinal vein, esophageal vein, bronchial vein, and pericardial veins.
Where preganglionic fibers of the sympathetic trunk come from?
They mainly come from the corresponding spinal nerves from T1 to L2 level.
What connects the sympathetic trunk to the spinal nerves?
Mainly the ganglion of the sympathetic and gray ramus and the white ramus of the white ramus communicants and the gray rami communicants. 3 of these.
How sympathetic nerves leave the sympathetic chain?
It can either leave through the spinal nerve or the greater splanchnic nerve, lesser splanchnic nerve, or the plexus around the vessels, like the carotid vessels, around the carotid vessels.
Okay, so that was the last question in this station, and we still have 1 more minute. Would you like to recall any of the unanswered questions?
Yeah, you have told about the structure number 14.
Structure number 14. And are you sure about structure number 10?
10. Actually, I'm not sure about structure number 10, but I am not getting like what it was. This can be a 14 because like anterior to the hilum, so a phrenic nerve.
Okay, which phrenic nerve?
A right phrenic nerve.
Okay. So time out.
Okay.
We'll move on to the next station.
Yeah.
Okay. Where are the different parts of the brachial plexus found?
Basically roots of the brachial plexus. It is found the posterior triangle of the neck between the scalenus anterior and scalenus medius muscle. And the
trunk of the brachial plexus. It is found the base of the posterior triangle and behind the third part of the subclavian artery. And the division of the brachial plexus is found just behind the middle 1/3 of the clavicle. And the cords of the brachial plexus, they are related to the second part of axillary artery.
Show on the skeleton the roots of the brachial plexus.
The roots of the brachial plexus. So like I have to
what are the letters that represent?
Sorry, I didn't get it.
What are the letters on this figure that represent the roots of the brachial plexus?
Yeah, it comes out through the intervertebral foramen, as we can see in this picture, like A, B, C.
So which letters specifically? All the letters?
Yeah, all the letters, yeah. Because it is the intervertebral foramen and it comes out from the spinal root comes from this.
Okay, describe and justify the clinical picture of Erb's palsy.
In Erb's palsy, there is basically damage to the C5 and C6 nerve root. So there will be a sensory loss to the radial of arm and the forearm. And the motor affection will be the loss of the abductor of the shoulder. So the shoulder will be adducted and internally rotated. The arm will be extended and pronated, and the wrist will be in flexion, and there will be a ulnar deviation.
So can you justify your answer?
Yes, the arm is in the adducted position because of the loss of the abductor, like supraspinatus, paralysis of supraspinatus and deltoid. And there is also the paralysis of the internal rotator, like teres minor, and teres minor and infraspinatus muscle. So the arm will be internally rotated, and because of the paralysis of the flexor of the elbow, that is basically biceps brachioradialis. So there will be arm will be in the extended position and pronated, and because of the paralysis of the flexor of the wrist, extensor of the wrist. So wrist will be flexed and it will be deviated. There will be ulnar deviation.
In Erb's paralysis, what would be the impacted reflexes?
There will be a loss of Moro's reflex.
The impacted reflexes in Erb's paralysis.
So it will be diminished. Basically, the C5, C6, the biceps reflex and the biceps reflex.
Okay, biceps and what else?
Biceps, supinator reflex. That's it.
Okay, what is the action of brachioradialis muscle?
Brachioradialis flexes the elbow joint.
At which position of the forearm? Specifically?
When the forearm is supinated, then it helps in the flexion of the elbow.
What are the muscles supplied by musculocutaneous nerve?
Musculocutaneous nerve supply the biceps, coracobrachialis and brachialis.
What is the sensory supply of the musculocutaneous nerve?
It supplies the radial aspect of the forearm.
What is the sensory supply of the radial nerve?
Radial nerve in hand, in the dorsum of the hand, it supplies the first web space. And also the dorsum, the lateral 3.5 of the dorsal aspect of the hand.
What else?
This was only the sensory. Have I also the motor? Have to tell about the motor supply also.
What else has sensory supply of the radial nerve?
In hand, it supplies the radial 3.5 or the lateral to 2/3 of the dorsum of the hand, first web space, and that's it. I know. Can't able to recall.
Please identify structure number 3.
It is the greater tubercle of the humerus.
What are the muscles attached?
Supraspinatus muscle, infraspinatus, and the teres minor muscle.
Structure 8.
It is a lesser tubercle of the humerus.
What are the muscles attached?
Subscapularis muscle is attached to it.
Structure 6.
It is the bicipital groove.
What are the muscles attached?
On the floor, latissimus dorsi is attached. The medial lip, teres major is attached, and the lateral lip, the pectoralis major is attached.
What is the structure passing through it?
It is the tendon of the long head of biceps.
Structure number 5.
It is the head of the humerus.
Number 1.
It is the anatomical neck of humerus.
Number 10.
It is a surgical neck of humerus.
Describe how to articulate humerus, radius, and ulna.
Humerus and ulna. So basically, we will first identify the olecranon fossa in the lower end of the humerus and the olecranon process in the ulna. So we'll articulate like olecranon fossa with the olecranon process.
Time out, so we're gonna move on to the next station.
Okay.
Please identify structure number 2. I'm pointing.
Okay. Yeah, it is the anterior belly of digastric muscle.
Number 37.
37. It is the posterior belly of digastric muscle.
Number 19.
Number 9 is a hypoglossal nerve.
45.
It is the sternohyoid muscle.
54.
It is the superior belly of omohyoid muscle.
Number 8.
It is the common carotid artery.
Number 11.
That is the external carotid artery.
Number 1.
Number 1 is the spinal accessory nerve.
Number 16.
Is the greater auricular nerve.
What are the boundaries of the anterior and posterior triangles of the neck?
So anterior triangle, anteriorly is the midline of the neck, and posteriorly it is bounded with the anterior border of sternocleidomastoid, and superiorly by the angle of the mandible. And posterior triangle, anteriorly bounded with the posterior border of sternocleidomastoid, and posteriorly by the anterior border of trapezius, and inferiorly by the middle 1/3 of the clavicle.
You know the subdivisions of the anterior triangle?
Yeah, so anterior triangle can be divided into submental triangle, digastric triangle, carotid triangle, and muscular triangle.
What are the muscles that divides into these triangles?
Sorry?
What are the muscles that divides the anterior triangle to these subdivisions?
It is one is the superior belly of the omohyoid muscle, and one is the posterior belly of digastric muscle.
Interpret the microscopic finding of these three auricular lymph node biopsy.
Yes, so in this biopsy, we can see the brown pigmentation of the certain cell, which most probably indicate that these are the metastasis of the melanoma, basically. Yeah.
What are the regions that might contain the primary lesion of the malignant melanoma?
Sorry?
What are the regions that might contain the primary lesion of malignant melanoma in this case? Considering this is a finding of preauricular lymph node biopsy.
Yeah. So it could be like from the upper half of the face, and the auricle of the, I mean the external ear, the temporal region of the scalp. Yes.
What else?
And the skin over the angle of mandible.
Okay, what is the nerve supply to posterior belly of digastric?
It is supplied by the facial nerve.
Regarding the great auricular nerve, what is the root value and what are the areas supplied by it?
Greater auricular root value is C2, C3, and it supplies the lower part of the external ear. Also supply the angle of mandible, and also the parotid region.
Regarding the external carotid artery, what is the course and what is the nerve passing anterior to it?
So the external carotid artery, it arises as one of the terminal branches of the common carotid artery at the upper border of the thyroid cartilage, that is at the level of C4. Then it ascends upwards, comes behind the neck of the mandible, and then enters the parotid gland, where it come out and gives two terminal branches, maxillary artery and superficial temporal artery. The nerve anterior to it is the hypoglossal nerve.
What are the branches of the external carotid artery?
The branches of the external carotid is superficial temporal artery, lingual artery, facial artery, occipital artery, ascending pharyngeal artery, and superior thyroid artery. And also the posterior auricular artery as well.
Where is the carotid body and what is its function?
Carotid body is a dilatation present just beneath the bifurcation of the common carotid, and it acts as a chemoreceptor, and it maintains any change in pH in the body.
Where is the carotid sinus and what is its function?
Carotid sinus is present just at the origin of internal carotid artery, just above the bifurcation, and it contains the baroreceptors, which maintain the normal blood pressure in the body.
What is the facial artery palpation surface marking?
Facial artery can be palpated just as it crosses the angle of mandible, just adjacent to the anterior border of the masseter muscle.
And what is the effect of the unilateral ligation?
If we do the unilateral ligation of facial artery, there will be collateral from the contralateral facial artery and as well as the maxillary artery.
Okay, so that was the last question. This patient, I think you answered all the questions. Okay. What else has areas drained by preauricular lymph nodes? Other than upper half of the face, temporal region, auricle, and external auricular meatus.
Okay.
You have 30 seconds.
Upper part of the face, the temporal region of the scalp, and the external ear, and also the area over the mastoid region. Sorry, I cannot recall the last one.
Okay, so time out. So now we are done. Thank you, Dr. Hima. And the feedback will be provided to you soon. Good morning, Dr. Shu Yon Hang. Today we are going to conduct the anatomy mock exam for Dr. Hang. So Dr. Hang, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. 9 minutes started by now. Please identify structure number 2.
Number 2 is the superior vena cava.
Number 4.
Number 4 is the right auricle.
Number 5.
Right atrium.
6.
Number 6 is the pulmonic valve.
Number 6, sorry.
Is the pulmonic trunk, the opening.
Okay, number 8.
Number 8 is the chordae tendineae of the tricuspid valve.
Number 9.
Number 9 is the papillary muscles.
Number 18.
Number 18 is the pulmonic trunk.
Number 19.
Number 19 is the left auricle.
Number 21.
21 is the mitral valves.
Number 20.
Number 20 is the opening to the pulmonary trunk.
Okay. How many cusps have the pulmonary valve?
3.
What is the vertebral level of the pulmonary valve?
It's at the level of T6.
What is the level of the pulmonary trunk division?
It's at T4.
Where to auscultate pulmonary valve?
It's at the left intercostal space at the left sternal edge. Left second intercostal space, yeah.
In which edge?
At the left second intercostal space beside the left sternal edge.
Okay. What are the branches of ascending aorta?
So there is the brachiocephalic trunk, the left common carotid, and the left subclavian artery.
The branches of ascending aorta.
Oh, the left and right coronary sinus.
Okay. What are the branches of pulmonary trunk?
The left and right pulmonary artery.
How many pulmonary veins are present?
There are 2.
2 pulmonary veins?
Yeah, 2 pulmonary veins.
Okay. Please identify structure number 3.
Number 3 is the sympathetic ganglion, sympathetic trunk.
Okay. And number 5?
Number 5 is the arc of the aorta. Oh, sorry. That number 5 is the bronchus, the main bronchus.
Which one?
The right main bronchus.
Number 10?
Number 10 is the exiguous vein.
Number 12?
Number 12 is the esophagus.
No, number 12. Number 12 is this structure.
The greater splenic nerve.
Number 14?
Number 14 is the phrenic the phrenic nerve.
Which one?
The right phrenic nerve.
What are the azygous vein tributaries?
Okay, there is branches from the hemiazygous vein, the I think I will skip this question. Yeah, from the
Okay, where preganglionic fibers of the sympathetic trunk come from?
okay, the preganglionic fibers come from the T1 to T5.
T1 to T5 what?
T1 to T5 sympathetic nerves.
Okay, what connects the sympathetic trunk to the spinal nerve?
That would be the communicants.
What communicant?
This one is the rami communicants.
Okay, and what else?
This one, I think I will also skip this question.
Okay, how the sympathetic nerves leave the sympathetic chain?
Sympathetic, it leaves by the dorsal root ganglion. This one I also like skip this.
Skip this one also. This was the last question
Yeah.
in this station. So would you like to,
Okay.
would you like to move on to the next station?
Okay. Yeah.
Okay. Where are the different parts of the brachial plexus found?
Okay. So there's roots. For the roots, right? It's exists the intervertebral foramen between the scalene anterior and the scalene medius, and the roots, the trunk. It will be at the the base of
Sorry, Dr. Hang, I think you have a problem in the network.
behind subclavian artery, and the division will be yes. Oh, you managed.
Dr. Hang, your voice is not so clear. I think you have a problem.
Oh, okay. Okay. Now is it clear?
Yes. So
yeah. I'll repeat it again.
No, the problem came again. Dr. Hang, I cannot hear you clearly.
Foramen between the scalene anterior and behind. Oh, okay. One second. Okay, how about now?
Okay.
Oh, okay. Oh, yeah. For the trunk, it will be at the base of the posterior triangle behind the subclavian artery, and the division will be behind the middle 1/3 of the clavicle. And for the last part, it will be for the branches. It will be behind the second part of the axillary artery. Yeah.
Okay. Show on this skeleton the roots of brachial plexus.
So the roots will be. It will be at the structure that is labeled A.
A?
Yeah, A.
Okay. Describe and justify the clinical picture of Ehrlich's palsy.
Okay. Ehrlich's palsy is injury to the C5, C6 nerve roots, and it will cause the hand to be in the adducted, internally rotated, elbow to be extended, wrist to be flexed position. It is because it will paralyze the shoulder abductors, which includes the supraspinatus muscles and the deltoid muscles. And the arm will be in the adducted position because of the paralysis to the arm external rotator, which is the infraspinatus muscle, as well as the teres minor. And it also affect the elbow flexors, the brachialis, biceps, and brachioradialis muscles. And it will cause weakness to the wrist extensors, which is the extensor carpi radialis longus muscle. Yeah, which is all innervated by the C5, C6, which is a waiter's tip deformity.
Okay, that was the motor affection. You know, the sensory affection.
Oh, the sensory loss would be to the lateral aspect of the of the forearm and the arm.
Okay, in Erb's paralysis, what would be the impacted reflexes?
Okay, the C5, C6 reflexes, which includes the biceps reflexes as well as the supinator reflexes.
Biceps and supinator?
Yeah.
Okay. Do you know the brachioradialis muscle?
Brachioradialis muscle.
What is the
Yeah,
action
so
of
it's
brachioradialis muscle?
okay. It's a relatively weak flexion of the elbow, which is maximal at the mid-pronated position.
What are the muscles supplied by musculocutaneous nerve?
Okay, there is the biceps, brachialis, and the coracobrachialis muscle.
What is the sensory supply of musculocutaneous nerve?
Okay, it will innervate the lateral aspect of the forearm.
What is the sensory supply of radial nerve?
The radial nerve. The radial nerve supplies will give rise to superficial radial nerve, which supplies the first web space of the hand, and also it will also give rise to the lateral cutaneous nerve of the forearm, which is the lateral aspect of the arm. Yeah.
What else?
What else? And the lateral aspect of the arm.
Okay, and what else?
What else? And this one I'm not sure about I couldn't really remember the others. Okay.
Would you like to skip?
Yeah, can skip. Yeah.
Please identify structure number 3.
It is the greater tubercle of the humerus.
What are the muscles attached to it?
Okay, so you have the supraspinatus muscle, infraspinatus muscle, as well as the teres minor muscle.
Identify structure number 8.
There's the lesser tubercle of the humerus.
And what are the muscles attached?
The muscle would be the subscapularis muscle.
Structure 6.
Structure 6 is the intertubercle groove of the humerus.
Muscles attached.
It will be the latissimus dorsi in the center. At the lateral lip, it would be the pectoralis major, and the medial lip would be the teres major muscle.
And what is the structure passing through it?
The structure passing through it would be the long head of the biceps muscle.
Okay. Structure 5.
Structure 5 is the head of the humerus.
Number 1.
Number 1 is the surgical neck of the humerus.
10.
10 is the anatomical neck of the humerus.
Describe how to articulate humerus, radius, and ulna.
Okay, so the articulation of it will be from the capitulum of the humerus to the radial head, and then from the olecranion to the olecranion of the ulna to the olecranion fossa of the humerus, and the conoid process of the ulna to the conoid process to the conoid tubercle.
Conoid process?
So the conoid process of the humerus to the conoid fossa of the ulna.
Okay, time out. So we
Okay.
move on to the next station and the
Okay.
last station. Is the picture clear?
Yes. Yep. Let's see the picture.
All right. 9 minutes
Okay.
started by now.
Okay.
Please identify structure 2.
Number
This
2 is
structure.
the anterior belly of the digastric muscle.
Number 37.
37 is the posterior belly of the digastric muscle.
19.
19 is the hypoglossal nerve.
45.
45 is the sternocleidomastoid muscle.
54.
54 is the superior belly of the omohyoid muscle.
Common carotid artery.
The common carotid artery is number 8.
Oh, sorry. Number 11.
11 is the external carotid artery.
Number 1.
Number 1 is the that's the spinal accessory the nerve, yeah.
16.
16 is the greater auricular nerve.
Okay. What are the boundaries of the anterior and posterior triangles of the neck?
Okay, for the anterior triangle of the neck, posteriorly is bounded by the anterior margin of the sternocleidomastoid muscle at the midline, yeah, and then the inferior border of the mandible superiorly. And for the posterior triangle, inferiorly is the middle 1/3 of the clavicle, and it's bounded anteriorly by the posterior aspect of the sternocleidomastoid muscle, and posteriorly is by the anterior aspect of the trapezius muscle.
Do you know the subdivisions of the anterior triangle?
Yeah, for the division wise, you have the muscular division, carotid, and the two submental. One is the submental, and the other one is the submandibular triangle. The digastric, yeah, digastric.
And what are the muscles that divide the anterior triangle?
Okay, so it's divided by the digastric muscles.
What else?
There's the superior belly of the omohyoid muscle.
Okay. Interpret the microscopic findings of preauricular lymph node biopsy.
Okay, so this is likely there's pigmented cells in this biopsy. So it's suggestive of malignant melanoma from the metastasis.
What are the regions that might contain the primary lesion of malignant melanoma? In this
Okay,
case?
would be likely for the skin. And yeah, it's from the skin.
Which skin specifically? We mean in
Okay.
this case of preauricular lymph node biopsy.
Okay, for the
this
preauricular, so it will be anterior to the auricular region, like anterior to the tragus, and also the superficial aspect of the face and the temporal region.
temporal region is right. What else?
Temporal region. And you have the anterior to the ear with the auricular region, anterior to the tragus, and from the cheeks.
What else?
Anterior to the this one I think I'll just skip this part. Yeah.
Okay. What is the nerve supply to posterior belly of the gastric?
Posterior belly of digastric supplied by the facial nerve.
Regarding the great auricular nerve, what is the root value and the area supplied by?
Okay, the C2 to C3 nerve roots, and it supplies the aspect that's anterior to the auricular region and the temporal region and the superior superficial parts of the face.
What else?
And the corner of the mouth.
Corner of what?
The corner of the mouth.
Okay, regarding external carotid artery, describe the course and the nerve passing anterior to it, also the branches.
Okay, so nerve passing anterior to it is the hypoglossal nerve. So it begins as one of the two terminal branches of the common carotid artery at the area of the thyroid cartilage region, and then it terminates behind the neck to give rise to two terminal branches, which are the superficial temporal artery as well as the maxillary artery, and it will give rise to the branches which are namely the superior thyroid artery, lingual artery, facial artery, occipital artery, superficial temporal artery, maxillary artery, posterior auricular artery.
Okay, where is the carotid body and what is its function?
Okay, for the carotid body, it's located posterior to the bifurcation of the common carotid artery, and it's a chemoreceptor, and it will sense changes to pH in the body.
Where is the carotid sinus and what is its function?
Okay, carotid sinus is also at the. Okay, I know this one is a baroreceptor that will sense changes to the blood pressure in the body, and it will act to regulate the blood pressure in the body. And for the area where it's found at, it would be this one I would just skip this part.
Okay, what is the facial artery palpation surface marking? And what is the effect of unilateral ligation?
Okay, the facial artery can be palpated inferior to the mandible, just immediately adjacent to the anterior margin of the masseter muscle. And ligation will cause collaterals to be formed between the facial artery as well as the contralateral facial artery as well as the maxillary artery.
Okay, so that was the last question. So we are done. Thank you, Dr. Shu Yon Heng. And the feedback will be provided to you soon.
Okay.
Thank you. Now you can leave the meeting.
Thank you very much.
Good morning, Dr. Kamrul Khan. Now today we are going to conduct the anatomy mock exam for Dr. Kamrul. So Dr. Kamrul, you have three anatomy stations, and for each station you have 9 minutes. So let's start by the first station. Can you identify the structure number 1? Structure number 1.
Structure number 1 is a oculomotor nerve.
this structure. Is the picture clear, or would you like to? Would you like me to magnify the picture?
Okay,
Dr. Kamrul.
yes, I can see it. I think it's. Would you please go to the next question, please?
Okay, structure number 5.
Pass. I want to go to the next question.
You would like to pass all this figure, or all the station?
No, that's just the question.
Okay, do you know structure number 9?
Abduction.
Which structure is the abducens nerve?
It is in the base of the skull, including the.
Here in this figure, which number indicates the abducens nerve?
Number 9.
Identify number 19.
Number 19 is abduction nerve.
Number 9.
Number 9, I think is midbrain.
Number 24.
This is optic nerve.
Number 26.
This is sella turcica.
Okay, would you like to recall any of the unanswered numbers before moving on to the next figure?
No.
Identify number 2, please.
This is olfactory nerve.
Olfactory nerve.
Yes.
Number 4. Number 4 are 2 structures.
Number 4 it's oculomotor nerve.
4. 4 are 2 structures. What are these 2 structures?
Okay. Would you please go to the next question?
Okay, number 6.
Number 6 is abduction nerve.
Number 7.
Well, I want to go to the next question.
Number 9.
Okay. Sorry, I want to go to the next question.
Number 15, number 16.
Number 15, facial nerve. Number 16, vestibulocochlear nerve.
Okay, regarding the oculomotor nerve, what is the course and what are the muscles supplied?
Oculomotor nerve originates from the midbrain and it passes through the superior orbital fissure and it supplies all the extensor muscle of the eye except
Before leaving the cranial
superior
cavity,
oblique.
I need you to say that the course in more details. It originates in the midbrain, yes, and it emerges or leaves the cranial cavity by the superior orbital fissure. But what is the course and relations of the oculomotor nerve before leaving the cranial cavity?
I could not recall this. I could not recall the course.
Okay, then.
But it supplies all the muscle of the external muscle of the eye except superior oblique and lateral rectus.
Can you enumerate these muscles?
Inferior oblique, medial rectus.
Mm-hmm.
Constrictor pupillary muscle.
Mm-hmm. What else? You have to be a little bit faster because you're running out of time. You have 1 more minute for this station and there are still questions.
Okay, then would you please go to the next question?
Okay, what is the clinical picture of oculomotor nerve palsy and what is the first sign?
In oculomotor nerve palsy, there will be ptosis and dilatation of the pupil.
Can you explain why?
Because levator palpebral superioris muscle will be paralyzed. Function will be impaired there, so it will be ptosis.
And why are these the first signs?
I could not recall.
Okay, and what else as clinical picture of oculomotor nerve palsy?
And
how will the eye be displaced?
So I'll be placing in laterally, downwards and laterally.
Time up. So we are going to move on to the next station. Okay, can you identify number 5, please?
Number 8.
Number 5.
Number 5. This is the deltoid ligament.
Number 7.
Number 7 is spring ligament.
Number 18.
Number 18. Okay, this is the I think talonavicular ligament.
Number 18 is not a ligament. Number 18 is a bone.
There is an navicular bone.
Number 19.
This is the lateral cuneiform.
And number 34.
Okay. Anterior talofibular ligament.
Number 31.
Number 31. Calcaneofibular ligament.
32.
The 32 is calcaneus.
35.
35 is talus.
30.
30 is sustentaneculum tali.
Okay. In this figure, considering this the first metatarsal bone, what is the structure number A? What is structure A?
It's a tubercle.
Sorry?
Tubercle.
Okay. What are the arches of the foot?
Arches, there is a transverse arch and two longitudinal arches, medial and lateral.
Okay, and what is the content of each arch as bones, ligaments, and muscles? What is the medial longitudinal arch formed of? Dr. Khan, you're running out of time. You would like to skip to the next question?
Yes.
Okay, what are the attachments of deltoid ligament?
It is attached to the tibia, then talus and calcaneus.
Tibia, talus, and calcaneus. Okay, what is the type and articulating surfaces of the subtalar joint?
Can I answer 1 minute later? Actually, here is Ajan occurring. I cannot hear it. Can I wait for 1 minute?
Okay.
Hello, now I can hear you.
Okay. So what is the type and articulating surfaces of the subtalar joint?
Subtalar joint is a type of saddle joint.
Sorry?
Saddle joint, saddle.
Saddle joint. What are the articulating surfaces of subtalar joint?
Subtalar joint is talus and calcaneus.
What are what's the type and articulating surfaces of talocalcaneonavicular joint?
I think it's by talus, calcaneus, and navicular bone. These three.
And what's the type?
I think is a saddle type of bone.
What's the type of calcaneocuboid joint?
Calcaneocuboid, I think it's mid-tarsal joint.
What are the type and bone forming ankle joint?
Ankle joint is formed by tibia and talus.
Which surface of the talus bone? Okay, time up. So we move on to next station and the last station. Please identify structure number 6.
Number 6.
This structure.
Okay, this is the fundus of stomach.
Okay, and structure number 2.
It's body of stomach.
Number 18.
And this is the pylorus of stomach.
Number 18 is the pylorus.
And antrum.
Number 19.
19 is pylorus of the stomach.
Number 23.
This is the first part of duodenum.
What is the blood supply of the stomach and venous drainage?
First is the blood supply of the curvatures. The laser curvature is from the left gastric artery, which is direct branch of celiac trunk, and the right gastric artery, which is branch of the common hepatic artery, and the greater curvature. It is by the right gastroepiploic artery, which is branch of splenic artery, and left gastroepiploic artery, which is branch of gastroduodenal artery. And the fundus of the stomach is supplied by short gastric arteries, which is also branch of the splenic artery. And venous drainage is the laser curvature is the left gastric vein is enter into the portal vein, and right gastric vein it's into inferior vena cava, and short gastric vein into the splenic vein, and right gastroepiploic vein.
The left gastric vein and right gastric vein drain into which structure?
Left gastric vein in the portal vein, and right gastric vein into inferior vena cava.
Okay.
And then right gastroepiploic vein into the splenic vein, and
Right gastroepiploic vein drains into which structure?
Splenic vein.
And the left gastroepiploic and short gastric veins?
Left gastroepiploic vein and short gastric vein into splenic vein, and right gastroepiploic vein into the gastroduodenal vein.
Gastroduodenal vein? Okay, what are the
superior mesenteric vein.
Okay, what are the peritoneal relations of the different parts of the duodenum?
Duodenum, only first part is first part is interperitoneal, and second, third, and fourth part are retroperitoneal.
What is the blood supply of the duodenum?
It is from the gastroduodenal artery.
Gastroduodenal artery. Could you please say more details?
I could not recall. Would you please go to next question?
Do you know what are the different relations to the third part of the duodenum?
Third part of the duodenum is posteriorly is the abdominal aorta, and inferior vena cava, and body of vertebra, and the right ureter,
What else? What else, Dr. Khan?
sorry, I could not recall.
Okay, do you know where is the major duodenal papilla and what was its function?
Yes, it is in the main pancreatic duct and common bile duct open here.
And where is it?
It is in the second part of the duodenum.
Where specifically in the second part of duodenum?
It's a posterior medially.
Do you know its distance from the pylorus?
No, sorry, I don't know the distance.
What is the blood supply of the pancreas?
Pancreas, the body branches, pancreatic branch from the splenic artery, and body and shape is from the branches from the splenic artery, and here synapse process is from the
What else other than branches from splenic artery? Dr. Khan.
It's a pancreatic or duodenal artery, superior and inferior. It supplies the head and unsynapse process.
Okay, and with the superior pancreatic duodenal artery is a branch from which artery? What is the origin of superior pancreatic duodenal artery?
It's gastroduodenal artery.
And the inferior inferior pancreatic duodenal artery, what is its origin?
It's a branch from superior mesenteric artery.
Okay, time out. So thank you, Dr. Khan. Now we are done. The feedback will be provided to you soon. Thank you.
Thank you very much.
Good morning, Dr. Kyrillos Morkos. Now today we are going to conduct the anatomy mock exam for Dr. Kyrillos. So Dr. Kyrillos, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. Please identify structure number 1.
This is the abducent nerve.
Number 5.
The attached margin of tentorium cerebellar.
Number 9.
Sorry, I can't see it. Number 9. Can I bypass it, please?
Number 19.
Sorry?
19.
The oculomotor nerve.
24.
The optic nerve.
26.
So the pituitary gland over the dorsum celli.
Sorry?
This is the pituitary gland.
Option number 2.
Number 2. The olfactory nerve. It's a bad I'm sorry.
Number 4.
This is the optic nerve.
And number 4 indicates 2 structures.
2 structures. It is the optic nerve and the internal carotid artery.
Number 6.
Number 6. The oculomotor nerve.
7.
The adjacent nerve.
9.
9. The trochlea.
15.
Sorry, I didn't hear it.
Number
What
15.
is the number, please? 15?
15.
Yeah. The trigeminal. Nerve.
16.
The facial.
What is the course and muscles supplied by oculomotor nerve?
The muscles supply. Only the muscles supply?
And the course and relations of the oculomotor nerve.
Yeah, okay. The oculomotor nerve starts from the oculomotor nucleus within the midbrain. It emerges from the midbrain and enters through the superior orbital fissure until it reaches the ocular muscles. It supplies the superior rectus muscle, the inferior rectus muscle, the medial rectus muscle, the inferior oblique rectus, the inferior oblique muscle, and the levator palpebrae muscle, and the molars muscle, and lastly the sphincter papillae. Sphincter
What
pupil.
is the course? You said it emerges from the midbrain and then it enters or leaves the cranial cavity through the superior orbital fissure. And between these points, what is the course and relations?
Between the superior orbital fissure, yeah, it passes through the cavernous sinus. It passes through the cavernous sinus with the other ocular nerves, the trochlear and the adjacent, and the internal carotid artery.
And what else as relations, as arterial relations?
The posterior communicating artery.
Okay, what is the clinical picture of oculomotor nerve palsy? And what is the first sign?
The first sign is the ptosis. The signs of oculomotor palsy are ptosis and meiosis and the plegia in the ocular muscles. So it's the gaze is downward and outward. The first sign is ptosis, I guess.
Explain each symptom or explain each sign.
Sorry?
Why is the eye displaced outward and downwards?
Because all muscles of the eye are paralyzed because they are all supplied by the oculomotor nerve except 2 muscles, the lateral rectus muscle, which is supplied by the adjacent nerve, and the superior oblique muscle, which is supplied by the trochlear nerve.
And why is ptosis the first sign to happen?
The ptosis, I think because the first fibers to be compressed are the fibers causing cytosis? I can't remember it very good, I'm sorry.
What is the structure of oculomotor nerve? The structure that the oculomotor nerve might be pressed against.
The oculomotor nerve
is pressed against which structure?
Can I bypass it, please?
What are the attachments of the tentorium cerebelli?
The tentorium cerebelli are attached anteriorly to the vitreous part of anterior and lateral to the vitreous part of the temporal bone, anteromedially, three borders surrounding the brainstem exit, and posteriorly the squamous part of the occipital bone.
What is false localizing sign?
False localizing signs are neurological signs that reflect a pathology not regard or not reflecting the expected anatomical disruption or dysfunction.
What is the abnormality here in this figure?
The abnormality?
Okay, time up. We move on to next patient. Please identify number 5.
Anterior talofibular ligament.
Sorry?
Anterior talofibular ligament.
Number 7.
Sorry, which number?
7.
Second, it's the medial malleus.
7. Number 7.
7, sorry. 7. Yeah, okay, it's the calcaneofibular ligament.
Number 18.
Number 18. Head of talus articulating with the navicular bone.
So number 19.
19 is the navicular bone.
Number 34.
34 is the deltoid ligament.
31.
31. It's the anterior fibers of the deltoid ligament.
32.
32. This is the medial surface of calcaneus.
35.
35. Posterior fibers of the deltoid ligament.
35 is a bone.
I'm sorry?
35 is a bone, not a ligament.
Is a bone? I'm sorry. Yes. The talus bone.
30.
30 is sustentaculum tilli.
Okay, mention the arches of the foot and their components regarding bones, ligaments, and muscles.
There are three arches in the foot: the medial longitudinal, the lateral longitudinal, and the transverse arch. The medial longitudinal is composed of the medial three metatarsals, the three cuneiforms, the navicular bone, and the calcaneus. Regarding the ligaments, it's composed of the short plantar ligament, long plantar ligament, and the plantar fascia. Regarding the muscles, the tibialis anterior, tibialis posterior, and flexor hallucis, flexor and extensor hallucis longus. For the lateral longitudinal arch, it's composed of the lateral two metatarsals with the cuboid bone and the calcaneus. For the ligaments, the long and short plantar ligaments. For the muscles, the peroneus longus, the peroneus brevis, and also the peroneus longus considered one of the muscles supporting the medial longitudinal arch as well. For the transverse arch, it's composed of all the pieces of the metatarsal bones with the tarsal bones. For the ligaments, I think it is the plantar fascia with the muscles, the tendons of the tendon of peroneus longus muscle.
What are the deltoid ligament attachments?
The superior attachment is the medial malleus, the inferior attachment to the body and the neck of the talus, the navicular bone, the sustentaculum lie over the calcaneus, and the spring ligament between the navicular and the calcaneus.
What is the structure number 8 in this first metatarsal bone?
Can I bypass it, please?
What is the type of subtalar joint and what are the articulating surfaces?
The subtalar joint.
Mm-hmm.
The movements, it's eversion and inversion.
The type.
And it's the type. It's a plain synovial joint between the inferiors. The articulating surfaces between the inferior surface of the talus and the superior surface of the calcaneus.
What's the type of talocalcaneonavicular joint?
It's a ball and socket joint.
This is the talonavicular part.
The talonavicular part.
And what else types in this joint?
I think it's a synovial ball and socket.
What are the
calcaneocuboidal?
Sorry?
I'm sorry, you are asking about the talocalcaneonavicular?
Yes. There are two types of joints in this joint.
Yeah, okay. I think the talocalcaneal is the top subtalar, so it's a plane. The other part is ball and socket, which is the talonavicular.
Okay, what are the articulating surfaces in this joint?
Sorry?
What are the articulating surfaces in this joint?
It's the talus, the head of the talus, with the calcaneus and navicular bones.
What is the type of calcaneocuboid joint?
It's a plain synovial.
What is the movements at this joint?
Eversion and inversion, and circumduction, foot circumduction.
Okay, what are the type and bone forming ankle joint?
The ankle joint is forming by the lower ends of the tibia and fibula, the medial malleus and lateral malleus, with the trochlear surface of the talus.
And what is the type of this joint?
It's sorry, of which joint?
Sorry?
Of each joint, I'm sorry. I forgot.
The type of the ankle joint.
It's a synovial hinge.
What are the movements at the ankle joint and muscles performing?
The movements are dorsiflexion and the plantar flexion. For dorsiflections, the muscles are tibialis anterior, extensor digitorum, extensor hallucis longus, and peroneus tertius. For plantar flexion, there are two muscle groups, tibialis posterior and flexor digitorum, flexor hallucis longus are the deep group, and superficial group is soleus, gastrocnemius, and the plantaris muscle.
Why is the ankle joint most stable in dorsiflexion?
Because of the shape of the talus and its anterior wide part. So in dorsiflexion, the talus is displaced posteriorly, so the anterior part is wedged into the ankle mortise, so it makes it more stable, unlike when it's plantar flexed, when the narrower part of the talus is in the articulating surface with the tibia and fibula, so there is some wobble in the joint that allows some movements to occur.
Okay, thank you. Now the time is up, so we move on to next station and the last one. Please identify structure number 6.
This is the fundus of the stomach.
2.
The body of the stomach.
18.
The pyloric antrum.
Sorry?
Pyloric antrum.
Number 19.
The pylorus.
23.
The first part of the duodenum.
What is the blood supply of the stomach and venous drainage?
The blood supply, I'm sorry?
Blood supply and venous drainage of the stomach.
Venous drainage, okay. For the blood supply, it's mainly from the celiac trunk, which gives the left gastric artery and the right gastric artery from the hepatic artery. This is over the lesser curvature. For the greater curvature, it's from the right and left greater gastric gastroepiploic arteries, and that's it, I guess. And from the splenic artery, there is also short gastric trenches.
And what the venous drainage?
Yeah, I'm sorry. For the venous drainage, it's from the sorry. Bypass it, please.
Bypass the question?
Yeah, bypass it, please.
What are the peritoneal relations of the different parts of the duodenum?
What are, sorry?
The peritoneal relations of the different parts of the duodenum.
Which part, please? I'm sorry.
All the parts of the different parts.
Okay, I'm sorry.
The peritoneal relations of the different parts of the duodenum.
Okay. So the first part is only the intraperitoneal part. Its relation anteriorly is with the caudate lobe of the liver and the gallbladder. The quadrate lobe, I'm sorry. The posterior relations are the common bile duct, portal vein.
This is not the question. The question is the peritoneal relations, the relations of the peritoneum to the different parts of the duodenum.
Okay. So it is the first part only, it's within the peritoneum, while the other parts are retroperitoneal.
Okay, what is the blood supply of the duodenum?
It's from the superior pancreatic duodenal artery, from the gastroduodenum, inferior pancreatic duodenal artery, from the superior mesenteric artery, and the supraduodenal artery also, from the gastroduodenal artery, with some branches of right gastric and right gastric arteries.
Okay, and what are the different relations to the third part of the duodenum?
For the third part. Okay, the third part, anteriorly, the superior mesenteric vessels with coils of the jejunum. Posteriorly, the right psoas major, and the right ureter with the abdominal aorta and the inferior vena cava. Superiorly, it's the head of the pancreas, and inferiorly, coils of the jejunum.
Where is the major duodenal papilla and what is its function?
It's in the posteromedial wall of the second part of the duodenum. In this papillae, the major duct of the pancreas opens into it. Okay, so.
What is the function of the major duodenal papilla?
I said that the main pancreatic duct with the common bile duct opens within it.
What is the blood supply of the pancreas?
The blood supply
of the pancreas.
Yeah, it is through the splenic artery and also the superior pancreatic duodenal artery and inferior pancreatic duodenal artery.
Where are the ducts of the pancreas open?
The major pancreatic duct opens into the major duodenal papillae. The accessory pancreatic duct opens within the minor duodenal papillae.
What are the vessels encountered during pancreatic surgery?
I'm sorry, again?
What are the vessels to encounter during pancreatic surgery?
Yeah, okay. It's the abdominal aorta with a superior mesenteric artery and superior mesenteric vein, and the splenic vein, portal vein, superior and inferior pancreatic duodenal arteries.
What is the ligament connecting the pancreatic tail to the spleen?
Sorry, please.
What is the ligament connecting the pancreatic tail to the spleen?
With the spleen, lienorenal ligament.
Describe the development of the pancreas.
It arises from two buds, the ventral bud. It gives rise to part of the head, the lower part of the head and the unseen process, and the dorsal bud, which gives rise to the rest of the head and the body and tail.
Identify structure number 3.
It's the head of the pancreas.
9.
Neck of pancreas.
14.
Superior mesenteric artery.
15.
Superior mesenteric vein.
So that was last question. Would you like to recall the unanswered questions so that because you have 1 more minute left? The
yeah, okay.
Blood supply, the venous drainage of the stomach.
Okay.
You said it was supplied by the right and left gastric arteries from
Yeah.
the celiac trunk. So
I can't remember to which vessels they drain, the right and left gastric veins, and the right and left gastric epiploic veins, I guess. I can't remember it.
it's almost nearly similar to the arterial supply.
It's right and left gastric and right and left gastric epiploic arteries.
Okay,
Veins,
out.
I'm sorry. Okay.
So thank you, Dr. Kirolos. Now we are done, and the feedback will be provided to you soon. Thank you.
Okay, thank you.
Good morning, Dr. Khawir Rahman.
Yes,
Today we are going to conduct the anatomy mock exam for Dr. Khawir. Dr. Khawir, you have 3 stations, and for each station you have 9 minutes. So let's start by the first station. Please identify the structure number 1.
Structure number 1 is abductor nerve, sir.
Structure number 5.
Structure number 5 is the trochlear nerve or motor nerve. It is the structure number 5 is the no, sir, miss.
Number 5. What?
I miss it. No, I don't know.
Okay, number 9.
Number 9 is the midbrain.
Number 19.
Number 19 is the abductor nerve.
You said number 1 is the abductor nerve.
Then number 19 is oculomotor nerve.
Number 24.
24 is the optic nerve.
26.
26 is the sila tersica, sir.
26, which structure?
26 is clivus. No, no, sir.
So 26.
26 is no, sir, miss.